Yeah, I started my CDMO Excellience back in 2006, and now I have the luck to be able to choose the people that I'm able to work with, and that's certainly the group now here that Tim Scott has pulled together here in Austin. At Excellience, I didn't delve into ASDs due to fear. Basically, I was afraid of the area. I was intimidated. And with a little bit of imposter syndrome, I've now joined the AustinPx board last year to help this was all morph into a ASD CDMO. And today's presentations will start to lay that or continue to lay that groundwork. Tomorrow, as I understand, you'll be the first of non-employees to be able to see the formulator and compounder in operation. A little bit of my detector says, Rob, that's not true. I can't, but I'd like to hear from other people that this is really something that other people have not seen before. So really looking forward to tomorrow for those who are able to join us. I think today we're dealing with experts today, so I'm not going to be the one to say that 80% of drugs are class 2 and class 4 and poorly soluble. I'm also not going to be the one to say that 60 to 70% of all new drugs are having a high solubility, but a low solubility and a low permeability class 2. And I'm not going to reference pharma projects in form of 2022's data that says that 58,000 drugs have failed in the last 40 years and that 20,000 drugs in development are under risk. So I'm not going to say that. So we'll get that out of the way so we don't have to go through that again that you hear at the beginning of the first 10 minutes of every presentations on this subject. My word of the day is going to be polyvinyl pyrrolidine. So that's what I'm going to be listening to if we have a bingo. That's what I'm going to be listening for and try to learn about that as well. But from now on, I'm going to be referring to it as PVP, so I don't have to have that tongue twister anymore. And some specific questions for myself that I'm going to ask. And I think it was always good when you go to a seminar is to ask some particular questions, things that you want to have answered for yourself. And for me, I'm going to basically ask, why is crystallinity a problem in ASDs? How soluble is soluble? What does that really mean as a number? And I'm going to try to finally understand what the glass transition temperature is and why is it different for melting temperature? And two more questions I think in my head, I've written them down, is why is that only important in ASDs and not in crystalline materials? And what is nucleation? So those are some things for myself, and just take a few minutes, and even if you are very advanced in this topic today, maybe you can ask a few questions for yourself that you'd like to have answered. And I'd love to hear what your questions are and what answers you're able to find. Please don't use equations for me. And don't ask me questions while I'm listening to other people. So those are the two requests that I have, please. All right, so while everyone here knows about ASDs, our first speaker has to introduce the subject. So we're all here on the same level, on the same page. And that's a tough job. So I think the first speaker here has got a lot of good basic material because we have to come up to that level. And then she's also got to do the subject that she has, which is really an involved topic. Basically, the three main points that I gathered after looking at her presentation, not to steal her thunder, but things that I think I'm going to be seeing are how ASDs enhance bioavailability by maintaining a supersaturated state, by having advantages over crystalline formulations, the presence of crystallinity within ASDs, whether from an incomplete amorphization and how they pose analytical challenges. So that's always something I'm interested in. And given the multifaceted nature of ASDs, it's essential to employ a comprehensive approach to drug development. So that maybe is a theme we're going to see through the day is how you approach them from through the different development stages, and also from drug to drug. It's not a one size fit all. I think that's a common theme. Anyway, Dr. Dana Moseson comes from the Drug Product Design Department at Pfizer in Groton, Connecticut. Dr. Moseson earned her PhD from Purdue University, where she delved deep into the intricacies of hot melt extrusion processing under the guidance of Professor Lynn Taylor. Her postdoctoral research further explored the physical stability of ASD particles. Dr. Moseson's excellence in research has been recognized with numerous awards, including the Pharma Foundation Postdoctoral Fellowship and the National Postdoctoral Fellowship and National Science Foundation Graduate Research Fellowship. Please join me in welcoming Dr. Dana Moseson.
I'm really excited to talk to you all about amorphous solid dispersions. It's something I've been spending the last feels like decade of my career working on, and I know that it has a tremendous impact within the industry for delivering molecules to patients. So that's our goal. All right. So my talk today is entitled Critical Quality Attributes of Amorphous Solid Dispersions. So we're going to start out as a way to set the stage today. We're going to talk a little bit about what are amorphous solid dispersions. Since I'm the first speaker, I got this topic. So amorphous solid dispersions are one technique used to enhance the limitation of poorly soluble molecules. So solubility, though, is only one component of what informs a drug delivery strategy. So this pretty complex figure tries to illuminate that it's not just the poorly soluble aspect of a drug, but it's also what is its pKa, what is its log p value, what is the dose required. It's when we're actually thinking about product development, it's a multifaceted strategy to select an ASD as the right delivery strategy for your drug. So first, why would we choose the amorphous form? When we have a crystalline drug, it's tightly held within its crystal lattice. By disrupting that structure, we now have a disordered amorphous form. This gives us a solubility advantage that we seek to capture to improve the delivery of our molecules. However, we now have the thermodynamic driving force for crystallization. This is in part why we use polymers as to form the amorphous solid dispersion, a homogeneous molecular dispersion of drug and polymer. There could be other components there as well, but here we'll simplify it down to two components. I apologize, this is my only equations for today. We want to start out by understanding the solubility and dissolution rate advantage that we seek to achieve. So through the Noyes-Whitney equation, we can kind of simplify it down that the solubility advantage that we can achieve is the ratio of amorphous to crystalline, and this applies both to that solubility ratio as well as a dissolution rate ratio. So for most drugs, this ratio is about 4 to 20 times. And so that's one way to characterize what kind of advantage we can achieve. But for most molecules, really, is that good enough? Maybe and maybe not. But it's one thing that we can understand about our molecules. And so here I've highlighted what a handful of these example compounds are. Some of these are just molecules that are used as model compounds. Some of them are marketed as amorphous solid dispersions. So the polymer acts within our formulation to both stabilize our formulation. So without our polymer, we may have this rapid crystallization route. With the polymer, we may be able to inhibit it, and they can do that through acting as a solvent for the drug. Thinking the polymer is think of it as a liquid solvent, except once it's in its solid state, it's now frozen in time. Through some specific interactions of the drug and polymer. It can also, through antiplasticization, decrease our drug mobility, and through steric hindrance to prevent crystallization. The other important part of the polymer is to act as a dissolution enhancement. It can do this through our common idea of the spring and parachute. We get that bonus of solubility with the amorphous form, and the polymer could give us that spring and parachute effect. Ideally, though, we would have a spring and plateau where we achieve supersaturation and maintain it for a biologically relevant period of time, preventing solution crystallization altogether. So it's not just spring and parachute, everyone, spring and plateau. We're going to go through just a handful of the common polymers that you'll hear lots about today. So we can get through some quick terminology. HPMCAS is among the most common polymers that you'll encounter for ASD formation. It is an enteric polymer, which means under acidic conditions, it is insoluble and becomes soluble above, depending on the grade, pH 5.5, 6, and so on. So those are those different grades. It has a TG of around 120 degrees, so that's the point at which it gains mobility. So Derek, you wanted to know about TG. And it's commonly used in It's commonly used in pretty much every manufacturing technology that ASDs are made with. It tends to be an excellent crystallization inhibitor for most drugs. Has low hygroscopicity. One of its key features is this pH-dependent solubility. So that could be both a positive or a negative for your material. It, though, is a little bit more reactive than some of the other polymers, so that it may or may not be a good choice for your material. PVPVA, not PVP, is the important polymer that we want to be aware of. PVP as a related polymer is much more hygroscopic, so it's less commonly used in actual product development. PVPVA is the more common version. It's neutral. It doesn't have this pH-dependent solubility. It's the most common polymer used in hot melt extrusion, for example, and it is highly soluble and not pH-dependent. One of the major challenges with this polymer is its gel formation. So as a drug product, overcoming gel formation is either something you lean into, you either want gel formation, or you want to lean away from and then have to overcome it. So that's its main challenge as a drug product in drug product formation. HPMC is the other third main polymer that you'll come across. It generally is hard to extrude, although there are new grades out there to do so. It has limited organic solubility, but again, it's a good crystallization inhibitor. It has a nice high TG for antiplasticization, so it may be a good choice for your formulation. There are many other polymers out there that have potential as having good applicability for your ASD formulation. I've listed a handful here. Most commonly, though, you'll see these in research and not as commonly in commercialized products. All right, so let's talk a little bit about physical stability. This is one of the two main objectives for your ASD. Because you're now creating this metastable amorphous form, we need to understand its potential for stabilization. So we can think about that through the phase diagram. So we have temperature on our y-axis and our drug's weight fraction, so that mixture of drug and polymer. We have two main aspects here, the solubility line and its glass transition temperature. So I'm going to highlight a couple of regions within this diagram. So for our below the glass transition is where our material is a solid. And so to the left of the solubility line, we are thermodynamically stable. In that region, your drug cannot crystallize. It is solubilized in your polymer. So that would be an ideal state. You're no longer metastable. You are thermodynamically stable. If you're to the right of the solubility line, you're now in a thermodynamic metastable state, but you still have kinetic stability below the glass transition temperature. So that may be good enough for most materials you'll probably find are within this region. At too high of a drug loading, you could encounter a region of amorphous phase separation, though still within the solid. When you think about your storage temperature, you can observe the difference of your storage temperature versus your formulation's temperature, the TG minus T value. The rule of thumb has historically been about 50 degrees is the needed difference to have a stable enough system for an appropriate storage period. However, in practice, this has been found to be really, you don't need that much. 10 to 30 degrees in practice has been found to be sufficient. So now we'll talk very, very briefly about manufacturing methods. We can have either solvent or thermal-based processing methods. In both cases, we are quenching our material into its solid state. For solvent-based processing, such as co-precipitation or spray drying, we're dissolving our drug and then evaporating it off to achieve our solid. In thermal-based processing, like hot melt extrusion or kinetisol, we're essentially we have no solvent. We are doing some sort of mixing and heat altogether to transform our crystalline drug into its amorphous form through that process. So when we're thinking holistically about our amorphous solid dispersion formulation, in order to achieve the desired product performance of physical stability and dissolution performance that we want, we need to holistically consider our material properties, like our drug's melting point, our glass transition temperature, the molecular weight of our polymer, rheological and thermal properties, the overall miscibility of our components, the drug loading that we select, the chemistry of the API and excipients, we need to consider our processing variables. For the two examples here, the spray drying and hot metal extrusion, I've listed out a range of variables that if those are modulated, you might get a different result. And then those things all together give you the structure and critical quality attributes of your material. So this is your glass transition temperature of your formulation, any intermolecular interactions that you're forming, the overall hygroscopicity of your system, the moisture content or residual solvent content. You're generating particle properties. For the two techniques of spray drying and hot metal extrusion, those are very, very different. And ultimately, what you're driving at is a homogeneous system. You want it to have no crystallinity, not be phase separated, not have any degradation of your drug and or your polymer. And those things characterize the overall system that you've made toward the physical stability and dissolution performance that you want for your formulation. So now we're going to get into talking a bit more about crystallinity as a critical quality attribute. So first, why are we concerned about crystallinity in our ASD? We want to know, we can ask, how do crystals form in ASDs? How can we detect trace crystallinity in our ASDs? What are the typical properties of crystals that may be present within our formulations? And ultimately, does the performance of our ASD rely on being 100% amorphous? This is a really challenging question, so I hope by the end you'll have a pretty good idea of what my answer is. Amorphous solid dispersions, the whole goal is to enhance bioavailability. So if we have crystallinity in our materials, we could have a lost solubility advantage. And that simply means that if the drug isn't in its amorphous form, it can't contribute to that solubility advantage that we're seeking to achieve. In a dissolution performance, the crystals themselves may initiate crystallization, causing reduced dissolution rate and extent, as well as desupersaturation. And from a physical stability perspective, any crystals may grow during storage, reducing the solubility advantage and hindering dissolution performance. Crystals can form in our ASDs through a couple different pathways. The first is through a crystal dissolution or size reduction pathway. This is essentially where we have a manufacturing failure. Our crystals are incompletely dissolved or destroyed through the manufacturing process. This is relevant to hot melt extrusion, to kinetisol, and to some extent even to a solvent-based process. Here we need to provide adequate thermal input, mechanical input, and processing time, as well as have good control over our input particle size distribution of our materials in order to reliably generate our amorphous material. If this is done incompletely through changes to any of those input properties or the process, we may have residual crystals at the end of the process. More commonly thought of is a nucleation and crystal growth pathway, where crystals are forming either through our stability storage or through a manufacturing failure. And this can be based on the crystallization tendency of the drug, the overall molecular mobility of the system, use of a high drug loading beyond which the polymer can stabilize, or through water or solvent-induced phase separation. When we're talking about high temperature processing, we can again return to the phase diagram to understand our processing design space. The solubility line forms the minimum temperature to solubilize all crystalline drug into the molten polymer. We can think about this as a dissolution process through the Noyes-Whitney equation, where that driving force for dissolution is a key parameter. In the Noyes-Whitney equation, it's listed as a solubility temperature, or the temperature, the concentration at which all drug can be solubilized for a given temperature. But in our formulation here, we have a fixed concentration. So we want to seek what temperature is that minimum solubility value. I have it here listed as the T sub C, the critical temperature for processing. So if we are processing in this dissolution regime, the temperature below the drug's melting point, but above its solubility temperature, we are dissolving crystals into our polymer. So here I have an SEM EDX series of a crystal in a polymer film. On the left-hand side, we have distinct boundaries on either side of the crystal, indicating that we don't have dissolution into the polymer film, that the drug is present only where the crystal is. When we move to the right-hand side, after controlled heating of this polymer film that had crystals in it, that we now have areas where that drug has dispersed into the polymer film, dissolved into the polymer film. So we have these concentration gradient boundaries where we can see where the drug is now present based on the mapping. So this is an example of this dissolution process through diffusion, as described by the Noyes-Whitney equation. However, real crystals don't dissolve quite so neatly. This is a time series of crystals crystals in a polymer film on a hot stage. Through that controlled heating over time, we can watch the crystals dissolve into the polymer film. So on that top series, we can see that over time, that crystal fragments into several pieces, and each of those individual pieces shrink with time. And by the end of the heating series, all of them have completely dissolved. That initial fragmentation likely occurs because of grain boundaries in the initial crystal. Grain boundaries are going to be found in nearly every crystalline material ever made that we're ever going to work with. So this is a pretty common phenomena that could occur during heating of our materials. In the second series, we can see a channel forming into the side of the crystal. Again, that could have been grain boundaries or some kind of other high energy defect found at the surface, but we have enhanced dissolution occurring at that site. And ultimately, the crystal fragments into two, and those pieces individually dissolve. Most interesting, there's a hole that forms in the crystal that's in the bottom panel series. How interesting! Our crystal is dissolving from the center. And again, this is likely due to the inherent defects and surface energy distribution that's found within normal crystals. So we've described this as a defect site-driven crystal dissolution model. Where a perfect single crystal would dissolve from the outside in. Real crystals have defects and grain boundaries. So those high energy sites within the crystal can be the first places in which the crystal dissolves under this kind of high temperature processing like we're describing through hot melt extrusion or through kinetisol. Ultimately, at those defect sites, we have dissolution. Those sites eventually connect. And then we have smaller crystal fragments that dissolve independently. So let's now do some characterization. We have a process operating design space created through a phase diagram where we are seeing that at the formulation critical temperature, that minimum boundary where the crystals could completely dissolve into the polymer, and then we process for a long time. So this sample has a high risk of residual crystallinity by being at that boundary. Through normal characterization, it appears completely amorphous, polarized light microscopy, XRD, DSC, and so on. But through transmission electron microscopy, I was able to find lots of tiny crystals in those samples. In this particular image, we have two populations of crystals. On the left-hand side, we have these nanocrystalline domains of 5 to 10 nanometers in size. They are randomly oriented, so I hypothesize that these were formed through a mechanical breakage event that happened right before the sample head quenched. On the right-hand side, there is a large crystal, and by large, I still mean extremely small, under 100 nanometers in size. In that crystal, we can observe the dissolution process happening. We see defects in the lattice structure. We see bend contours, which is which reflects how the crystalline material is interacting with the polymer surrounding it, and so on. We can see this fragmentation process happening in real time, essentially. In another TEM image from the same sample, we can see these more apparent amorphous channels forming into a crystal that is being broken down. So this is the other aspect of that fragmentation process, that the crystal is dissolving at its high energy sites and forming these amorphous channels. We're fragmenting and creating new surface area, which expedites the dissolution process. So essentially, if we designed our crystalline drug to take advantage of this process, it would be advantageous to design our crystalline drug with a lot of defects into it. And so through another study, I did this through manufacturing a highly agglomerated crystalline material. That's the blue one. I made, through some cooling crystallization, a handful of other materials, did some milling to get to different particle sizes. So I had some large crystals, and I had 3 lots that had nearly equivalent D50, including this agglomerated material. Based on the particle size distribution and defect density, the material that dissolved the fastest through equivalent processing was this highly agglomerated, highly defective material. So it seems counterintuitive that it isn't just particle size distribution, but it's also that underlying defect structure that could be taken advantage of when trying to generate amorphous materials through thermal processing. I wanted to highlight that the potential for crystallization during spray drying as well. So this is a ternary phase diagram of drug polymer and solvent. The solubility line is the same type of solubility line of drug and polymer, but we now have a third component here. On the right-hand side of that solubility line, crystallization may occur. And on the other side, we have a homogeneous solution. So depending on our formulation selected, the ones marked number 1 or number 2, as we are evaporating out our solvent, one of those systems passes through that solubility line. And therefore you could have the potential for crystallization during spray drying, during that evaporation process. So it's important to understand the interaction of your drug polymer and your solvent when trying to design your spray drying process and your formulation to ensure that you are generating a fully amorphous system based on spray drying. These kind of figures are made by PC Saft. So I think that that's another essential tool in our toolkit as product development professionals. There's another failure mechanism that can also occur during spray drying. It would be phase separation. So crystallization is sort of one step beyond phase separation. So here, if you have different drying paths, if you go through the miscibility gap, where you have a miscibility gap caused by a co-solvent system, you can end up with phase separated material where you have different compositions of drug and polymer ratios within the same particle. There have been a handful of publications out there that have shown at the surface you can either have drug enriched or polymer enriched surface composition. And that's essentially generated because of these miscibility gaps in these co-solvent systems. So it's another thing to be aware of that, when designing your spray drying process. I wanted to give a manufacturing example. Here we have a system of naproxen and PVP generated by spray drying and by hot melt extrusion. At the higher drug loading, crystallinity was found after processing in both cases. And then that crystallinity could grow over time. In this particular example, the sample from hot melt extrusion had reduced level of crystallinity, and that was hypothesized due to the higher viscosity environment that occurs when your sample is being quenched. During spray drying, you have greater mobility because of that solvent during that quenching process and during secondary drying, and that was hypothesized why we had a different level of crystallinity after both of those types of processing. So residual crystallinity can occur from both types of processes. Next, I have an example of a kinetisol process. Here, kinetisol processing was used on a shear sensitive material, trying to generate an amorphous form, but it also degraded. So it was highly reactive, but also shear sensitive. By balancing out those optimized kinetisol parameters, they were able to make a sample of the least amount of degradation, the least amount of crystallinity, and to maximize its potential for maintaining supersaturation without extensive crystallization occurring. When we're talking about ways to detect crystallinity, the common techniques tend to not be very sensitive or tend to not be quantitative. So things like polarized light microscopy can be a very sensitive, easy to use technique for formulators, but again, it's non-quantitative. I gave examples of transmission electron microscopy. That is a highly specialized, low throughput tool, potentially great for a research environment, but practically not accessible. And so there are other emerging techniques out there that are, again, good for research, good for quantitation. Things like solid state NMR can be incredibly sensitive, particularly if your molecule has fluorine in it. If it doesn't have fluorine, your detection limits may not be all that much better than X-ray diffraction. Something like SHG, second harmonic generation, is again very sensitive, but not all drugs have SHG activity. All that to say, there's lots of up and coming opportunities for improved detection of trace crystallinity. But ultimately, do we need to detect trace crystallinity? Does it matter to our formulation? The answer is sometimes yes and sometimes no. So it's all about understanding your formulation, understanding its failure modes, to understand what kind of detection you need for your formulation. Because from a QC environment, XRD is not likely to be sensitive enough if trace crystallinity matters. If trace crystallinity matters, you should probably be reformulating your material to account for that. So in some of my work, I had done some hot melt extrusion through a range of the process design space and generated samples of different levels of crystallinity. So when I tried to detect crystallinity through common techniques like XRD, DSC, polarized light microscopy, that boundary of when I was able to say something was crystalline or amorphous varied greatly. I'd in particular like to caution against using DSC to detect crystallinity. For a miscible drug polymer system, your crystals are going to dissolve into your polymer upon heating. So you're not detecting the sample as it is at room temperature, and you may not detect anything at all. In a set of data that I'm not showing here, I needed to have 30% crystallinity in my sample before I could begin to detect it, and I could only then detect it because I knew it was there. An untrained eye or just as part of a QC method, no one would have ever thought that it was there. So in particular, DSC is for a miscible drug polymer system. If your system's not miscible, it's a little bit different. But again, things like solid state NMR, transmission electron microscopy are incredibly highly sensitive and can be differentiating when trying to understand your processing conditions and dissolution impact, for example. All right, so now let's talk a little bit more about dissolution. Our goal of our dissolution test is for a supersaturating system like an amorphous solid dispersion is to provide an in vitro tool to link our product changes with our hopeful clinical performance, right? So non-sync conditions enable evaluation of both our dissolution performance and crystallization kinetics. And so that forms the essential components of what we need for understanding our amorphous solid dispersions. And to that end, what is non-sync? Non-sync can be a wide range of concentrations. Depending on what you want to learn, a different type of concentration-based measurement can be very important. I'm not really going to go into that very much here today, but when you're designing your dissolution studies, challenge them, challenge your assumptions. So again, non-sync we also think of as very important for these types of formulations because sync conditions are not biorelevant. So not only we can't detect some of the important performance criteria, but in this example, we would need about 3 gallons of water to dissolve the complete amount of drug found within our test. And that is not relevant to the human body. So within our dissolution environment, the first step is to dissolve our drug by having molecularly dissolved drug that can be absorbed. So that's ultimately, hopefully, that spring and plateau profile. We get all of our drug into solution and it doesn't crystallize. We could then have a nucleation event where our supersaturated solution nucleates and grows. That will cause desupersaturation, so that's that loss of concentration profile. And once it's now crystallized, it can't be absorbed. So that's our spring and parachute style dissolution profile. If we have crystals within our formulation, we could have a loss solubility advantage type profile where our amorphous drug dissolves completely, but we simply have dispersal of the crystal seeds, and they have no driving force for dissolution. So we have a loss in net concentration achievable proportional to the level of crystals in the formulation. So that would be a loss solubility advantage. We could also have, through growth from those seeds or triggering secondary nucleation, we could have ultimately a reduced dissolution rate and desupersaturation profile, as shown here. The other type of crystallization that we can observe is not only that solution-mediated crystallization like I was just describing, but you can have crystallization through your amorphous solid. I tend to call that matrix crystallization, where your solid hydrates, the drug never gets into solution and simply crystallizes directly in your solid. So that's, in my mind, the most detrimental failure mechanism because it's never had a chance to get into solution and be absorbed. It's always just stayed in the solid and is essentially inert with no driving force for dissolution. Let's look at some case studies and assess them. Here is an example of an endomethacin PVPVA ASD samples prepared with 0 to 25% residual crystallinity. The processing conditions based on based around the phase diagram to generate samples with residual crystalline content. Here we essentially have a lost solubility advantage where the total concentration achievable is reduced proportionally with how much crystallinity is found within them. In a comparable experiment of simply mixing amorphous ASD with crystal seeds, we see the same type of profile where we are able to achieve total concentration of the amorphous content, and there's no driving force for dissolution or for crystal growth from the crystal seeds. So this is an example of a lost solubility advantage, where if you had trace crystallinity in your system, it likely wouldn't matter for this type of system. This kind of system can occur through a process of polymer absorption, where your polymer absorbs onto your crystal surfaces and essentially prevents the supersaturated drug from integrating into the crystal lattice. It's preventing crystal growth from occurring. So this can be a really positive outcome, a feature that de-risks having crystallinity in your formulation if your formulation, your crystalline drug, and your polymer interact in this way. And another example, again, made samples of, in this case, up to 30% crystallinity. In our fully amorphous sample, we see, again, a spring and plateau style dissolution profile, but distinctly, we don't have full release of our drug. As soon as we have a little bit of crystallinity in that system, we have a little bit of release, but a very fast plateau. So this type of profile is occurring because of matrix crystallization, even in our fully amorphous sample, where we have nucleation at those solid interfaces, preventing some of that amorphous solid from dissolving. When we have crystals within that amorphous solid, that crystallinity grows rapidly and prevents that amorphous drug from getting into solution. So that's when I say the most detrimental failure mode. Trace crystallinity caused that process to occur. The orange profile that I'm showing, where I say below limit of detection, that was limit of detection based on powder X-ray diffraction. I was able to confirm crystallinity by transmission electron microscopy, and after 30 minutes, there was no additional release from that sample. So highly detrimental, even having crystallinity that couldn't be measured by common techniques. The other part of this particular case study is that we had different polymorphs that appeared. The fully amorphous ASD crystallized to its metastable polymorph upon that matrix crystallization process taking place. But all of the samples that had residual crystalline content in it had this stable polymorph. And that was because it was left over from the manufacturing process, which was from the stable polymorph of the crystalline drug. So here we then did not have any induction time. We're forming crystals that have a lower solubility as opposed to that metastable polymorph. So we're changing that solubility advantage profile that is occurring over time through this process. In a kind of a schematic, we see that in a fully amorphous system, we have some induction time where through matrix crystallization, we can generate crystals at the surfaces, which ultimately consume all of the amorphous solid. When we have residual crystals in our formulation, those crystals have no induction time. They grow immediately and rapidly consume the amorphous solid, and ultimately leading to less amorphous drug getting into solution, reduced supersaturation occurring. So this is an example where trace crystallinate was highly detrimental to potential bioperformance. Where if this was your formulation, I would highly recommend you reformulate. Find a different polymer that works better, prevents matrix crystallization, or change your drug loading, add a surfactant to increase your dissolution rate, or a handful of things you could do. All right, so now we'll talk a little bit more about risk assessment overall of our formulation. The first piece is our drug's physicochemical properties. It's important to understand the polymorphic landscape, the general crystallization tendency of the drug, both in the solid or from solution. The drug's melting point versus and its class transition temperature are important pieces of information, as well as the solubility ratio. One example here is that there are drugs out there that don't have crystalline forms. Therefore, you wouldn't have a risk to crystallization. And so your risk profile would be very different in that case. Now moving to formulation fundamentals of our ASDs. This is things like polymer selection or additional formulation components. In the previous example I just gave, because of that matrix crystallization failure mode, recommending reformulation, changing your drug loading, changing your polymer to improve your dissolution profile and preventing these failure modes of crystallization. Things like the hygroscopicity of your formulation, the glass transition temperature of your formulation can matter a lot. Drug polymer miscibility is also an important component, particularly when we're talking about physical stability, and as well as drug polymer interactions. Drug polymer interactions during physical stability are very important. But lack of drug polymer interactions can actually be beneficial upon hydration of your amorphous solid. So it's that balance of formulation attributes. When we're thinking about physical stability, things like the impact of water on your formulation's glass transition temperature. So it's not just Tg minus T in the absence of moisture, but what happens to your formulation once it's in the real world? There is humidity in your environment. And thinking about packaging design, do you need a desiccant or not? What kind of storage temperature do you want? When you have moisture uptake, does that cause phase separation of your system or not? Upcoming, I'll give an example of the phase diagram to better explain some of those things. From our dissolution perspective, and we've just gone through a couple of the kinds of things that can occur, but detecting what is your sink index. This is essentially the degree of non-syncness, and how does your drug in the body, what kind of dose to volume ratio do you really have, and are you testing under relevant conditions that match to that kind of environment? What is your media composition? Drugs can have distinctly different nucleation induction times and crystal growth profiles depending on the presence or absence of biosalts, or lecithin can be a significant trigger of crystallization. So do you have a clear understanding of whether or not your formulation is susceptible to that or not? And how does that translate to your in vivo environment? If you're only doing testing under simple buffer conditions, how does the real in vivo environment change your crystal growth profiles? Both of the examples I just gave were simply in simple buffers. So when I said I had an example of only lost solubility advantage, would that translate to an example done with biorelevant media for a sample. And that wasn't the degree of the tests that I had done at the time. I was looking more mechanistically, but those kinds of features can matter quite a lot. Other features are about your test design, whether you're doing single stage testing or two-stage dissolution testing, particularly when you have drug polymer systems that have different pH sensitive profiles, such as a weak base or using HPMCAS. Testing under different conditions can illuminate your product performance and potentially your failure mechanisms. The other important feature that we'll give some examples to eliminate are the properties of the crystal. So this is the crystallite size, its surface area, potential for crystal defects, what is its origin, and what are the surrounding matrix properties. And I'll go ahead and give an example of intrinsic crystals, such as leftover from manufacturing process versus spiked crystals, for example. First up, we're going to talk a little bit about taking the phase diagram concept to understanding our physical stability under more complex environments. There's a lot in these two figures, so we'll try and break it down. So we have three different formulations in the black, gray, and blue. We see the solubility line as well as the glass transition temperature. And then under dry conditions, 0% RH versus 75% RH. These are all, again, PC-SAFT model predictions, but they are helpful to illuminate the difference between the thermodynamics that are taking place and the kinetics that are happening towards your risk assessment of your formulation. So let's start out with the 20% drug loading composition. I have a little orange star in both figures to identify that idea. So under dry conditions, all three of these formulations are kinetically stable, so that Tg minus T of greater than 50 degrees. The PVP and PVPVA formulations are thermodynamically stable, so they are to the left of the solubility line. So they have no driving force for crystallization simply based on that thermodynamic solubility. Once we move up to 75% RH condition, the PVP and PVPVA formulations become kinetically unstable and thermodynamically metastable. So they now have tremendous mobility and likelihood of crystallization simply by modulation of the ambient humidity and how much moisture would be taken up into that formulation. Under the 40% drug loading composition, again, we have an orange star marking that location. Under the dry condition, all of these samples are now to the right of the solubility line, so they're all thermodynamically metastable. This is a pretty common likelihood for all of your formulations. They are all kinetically stable, but the Tg minus T value becomes smaller, which may or may not be problematic for your formulations. Once we now move to 75% relative humidity, all of these become kinetically unstable or nearly so. They all have tremendous mobility and would likely crystallize under that condition. So this is emphasizing the importance of packaging design and storage conditions to your samples, of making sure that they stay kinetically stable and that any moisture that they've taken doesn't cause phase separation or crystallization. So here's an example of sink index for our dissolution study design. Again, I apologize for the equations. So as we're moving through, I have highlighted that we're using the same dose, but different media volumes. So this changes the total concentration being put into the system with respect to the crystalline solubility and the amorphous solubility. So on the left side, we have all samples are able to achieve some supersaturation in excess of the crystalline solubility, but the concentrations being applied are far below the amorphous solubility. So we can see that there's no difference in the black versus orange curve. Having 10 or 20% crystallinity are nearly identical under those circumstances. As we move over to the lower dissolution volumes, this is now also being tested against the brand drug that's being considered here. The brand is able to achieve complete complete release up to the amorphous solubility, and that is maintained. These samples that have some crystallinity in them, they are able to be readily differentiated by the extent of supersaturation they're able to achieve and their rate of desupersaturation. And so you can easily see the differences based on how much crystallinity is found within them. And that's just based on choosing different dissolution conditions to challenge test your formulations. In this same set of studies, they performed a dog study, and the recrystallized ASD outperformed the crystal in suspension. Even though it was essentially fully recrystallized, it was able to outperform by 2 or 3 times margin for hypothesized a few potential reasons. First, that the product couldn't be fully crystallized in the matrix and couldn't be detected, perhaps. The crystals found within the matrix were highly defective and therefore could potentially redissolve. And the crystals formed are very small, which provides for that rapid redissolution. And so even a fully crystallized ASD may not be as bad as your crystalline suspension. There's at least one other example in the literature where it goes the other direction, where the recrystallized ASD performs worse than the crystalline suspension. So to me, that's just a really interesting phenomena that can take place when we put these formulations into real challenge conditions. All right, so now we're going to get into a little bit about the properties of our crystals. So when we are growing crystals, for example, through stability storage conditions, our matrix around those crystals is essentially changed as well. So we have our bulk ASD concentration, we have the crystals that we formed, and then in the areas surrounding them, we now have depleted API regions. So we would essentially have in those microdomains higher glass transition temperature with even less likelihood of continuing to grow crystals. So eventually you could get to the point through this kind of process where you aren't able to completely crystallize your material, but we still have this very intimate polymer contact with our crystals. It's an interesting concept to think about. In many studies, they use spiked crystals, where you're using bulk API crystals to challenge test your ASD formulations in a dissolution environment. Here you have completely independent crystals depending on whether or not they have been micronized. That's still compared to the TEM images I showed you of crystals in the nanometer scale range. Even micronized crystals are going to be 1, 10, 20 microns based on their particle size distribution. And lastly, the example here shows residual crystallinity, such as through hot melt extrusion or other kind of thermal processing failure, where the crystals have simply not completely dissolved or been destroyed. So they're going to be very small and be in a homogeneous surrounding matrix. Highly defective crystals, such as through a residual crystal environment, are going to grow differently. And so we can then anticipate that growth could also show up differently in a dissolution environment. So for example, bulk crystals, as found, grown under high supersaturation with and without polymer. When in the presence of polymer, they kind of grow really erratically. And that's because of that polymer adsorption phenomena, where the polymer is preventing growth at certain sites around the crystal. So we get this kind of wild growth pattern instead. A mechanically damaged crystal would have a high level of defects at the surface and potentially through the bulk of the system. This example here I made through cryomilling and then grew it under those 2 different conditions with and without polymer. Under the condition without polymer, now that I have independent domains within that mechanically damaged crystal, they grow as nice independent crystallites. And then in the presence of polymer, I have this wild growth phenomena. A crystal grown from a residual crystal within an ASD solid looks very similar to that, highlighting that residual crystals within your ASDs are going to be highly defective and have these unpredictable growth patterns that don't well match that of bulk crystals. And so you may not expect the same type of growth patterns if you're doing spiking dissolution studies. Here's an example from the literature where they were comparing spiked crystallinity versus recrystallized, and they used two different dissolution medias. Depending on the origin of those crystals and the dissolution method, either there was great differentiation for different amounts of crystallinity or no differentiation at all, highlighting that the design of your dissolution test is really important, as well as using crystallinity that is representative of the failure mode of your formulation is quite important to detecting the potential impact of it under non-sync conditions, or I think these were both under sync conditions. I'm going to take you back to the first case study that I showed you, where we looked at the difference between a dissolution profile of a loss solubility advantage with residual crystals versus bulk crystals. Both of them were able to achieve near to the theoretical maximum of based on the amount of amorphous content present. Those with residual crystals were slightly below that due to low levels of crystal growth, but not high levels. And so that's shown in the right side, where we have a proportional reduction in concentration when we're comparing residual crystals to bulk crystal seeds. So in that case, the identity of the crystal material didn't matter quite as much to the overall conclusion generated, which was, for this system, under these kind of media conditions, we simply had a loss solubility advantage, so a low risk of the crystallinity contained within. However, if we change our supersaturation method, here we're adding 100% amorphous content, and so depending on how much crystallinity was there in the sample, we would then have an excess of API. So always 100% amorphous content. So essentially having a consistent supersaturation achievable, even though we had different levels of API present. And here we were able to see, even with those same samples, that the residual crystals were far more detrimental than bulk crystal seeds. So where we have a theoretical maximum concentration through spiking experiments, when we had a constant supersaturation achievable and then simply adding excess crystals, we had nearly no desupersaturation, nearly no concentration loss. But when we used our ASD samples in the same manner, we have a distinct drop in concentration achievable. And so it's all about how you design your studies to detect what may be going on in your formulation and the impact of crystallinity. So if example, number 4 here was what your QC group did to detect the potential impact of crystallinity, you'd think you might have no problem. And for some systems, that may or may not be true. So it's important to question your experimental design. So lastly, I'd like to talk a little bit about crystallinity specifications. Here I've pulled from the ICHQ 6A about specifications related to polymorphic form control, which would therefore apply to the use of an amorphous formulation. In this decision tree, they suggest essentially that a surrogate test like dissolution can be used to monitor product performance, but polymorphic content should only be used as a test of last resort. So that would be a solid state measurement such as XRD. I'd like to question this as an appropriate approach. So in a QC environment, to detect crystallinity, this relies on solubility differences between your amorphous and crystalline forms. Again, you must be under a non-sync condition, which is not what we usually think of as how we would design a QC test, because QC tests are intended for looking for manufacturing failure, changes in dissolution rate, which are non-specific to the origin, whether it's some problem in the processing, some problem with dispensed formulation components, some problem with solid fraction of your tablets that you generated, or something like having crystallinity in your formulation. It's non-specific. So trying to use that test to quantify crystallinity is highly suspect from my perspective. If you do it in a non-sync environment, you can theoretically aim for looking at these solubility differences, but you have to not have a system that has crystal growth occurring. So you have to choose your sink conditions properly. You have to have no crystal growth you have to have good stability of your solution medium and so on. So this is a pretty challenging thing to achieve. It's achievable, but it's pretty challenging. In the literature, there's a statistical analysis of the maximum level of crystallinity that could be achieved or that could be measured in this kind of environment. So here, what I'm highlighting is a sample with an RSD, a theoretical RSD based on a content uniformity test of 5%, could have potential detection of crystallinity of about 6%, assuming no variation in your dosage form assay, no variation in analytical variability in both your assay and dissolution methods, which isn't really an appropriate assumption, of course, and then no additional manufacturing of variability, which would impact your release rate. And so all of those factors together make actually detecting and quantifying crystallinity by dissolution in a QC environment really challenging at the very least. So essentially, I would prefer solid state measurements or microscopy. So essentially, this is what I just described. Highlighting that a QC test to detect crystallinity doesn't necessarily also account for the normal variability of your batch. You needing to have non-sink conditions versus sink conditions, which would be used in a normal QC test. There's just a general level of complexity added in, and you're not necessarily able to detect greater levels of crystallinity than you might be in solid state tests. So really, it's the product development studies that need to be used to both understand, can your formulation crystallize? So by modulating your spray drying process or modulating your hot melt extrusion process or modifying your kinetic process, can you generate formulations that have crystallinity? In some situations, maybe not. That would be a great outcome to de-risk whether or not crystallinity matters in your formulation. Then under physical stability, based on your packaging design, can you generate crystallinity in reasonable ranges of storage conditions? If not, then that's another factor that de-risks your formulation. And so that de-risking process is my suggestion, rather than relying on QC tests to detect crystallinity, and then in the absence of understanding as well whether or not they matter into when placed in a real clinical environment. This is my last thought here is that so much of ASD research is done only on the drug product intermediate, just the powder or just the supersaturated solution. But real ASDs are drug products. They're tablets, they're capsules, they're sachet powders. They have coatings on them. They have excipients that could have chemical reactivity concerns or bring moisture into your formulation where you don't want it. And that adds another layer of complexity beyond anything that I discussed here today. And so thinking of your formulation holistically is incredibly important. And I hope I've, in that way, challenged a few of your assumptions today. Do we have time for questions?
This could be, I think, an effect of the polymer itself, right? That's what's driving the difference between the release on the reader slide and the spiking. It seems that the difference here is, or could be, just because one is soluble in the polymer and the other is not.
Yep. I think that in this kind of example, yes, that's definitely a possibility, that some of that, even though it seemed based on the analytical testing, in this case, it was fully recrystallized, there could be some of that drug that's still fully amorphous within the polymer. And simply our analytical methods are not good at detecting low levels of amorphous content. I think the broader point here is to show that the environment matters a lot. your particle size, your microenvironment of that polymeric matrix can matter a lot in terms of what kind of performance outcome you get. So that's in essence the main point of showing a slide like this, is trying to take these simplistic, simple media dissolution tests and putting it in context in this case a dog species, to show some of those differences in terms of understanding what your crystallinity risk is, how much loss in concentration you achieve based on 20% drug or 50% drug. Here, this particular figure is only showing what was theoretically fully recrystallized. And to me, one of the most interesting features was that difference between the fully recrystallized and the suspension, just showing that all crystals are not created equal.
So those are that QC dissolution tested, right? And do you think there could be any issues with those? Have they been fully vetted?
I mean, that's between the developer and the regulators. And, part of my goal with talking about these kind of concepts and writing papers on them is to challenge the regulators to think about the complexity of crystallinity and not be imposing a blanket specification, such as essentially guided by the ICH Q6A. A couple months back, I was at the MSRC workshop on dissolution testing for drug products, and one of the regulators got up and gave a talk about detecting crystallinity in ASDs by QC methods. And it was this is the best approach. It's so easy. You can detect 2% crystallinity, no problem. I led a breakout session a couple hours later, and I took that person from saying, this is the approach, to, it's really complicated. And to me, that is like driving to the fundamentals of the science is the important piece there. It may make our job as industrial pharmaceutical product development scientists more challenging, but it's all about protecting our patients, getting our therapies to patients, and having a scientifically based regulatory environment that is focused on the fundamentals and guiding that risk assessment. So that's my goal here, is highlighting, bringing together these concepts of all crystals are not created equal, because I think it challenges the blanket assumption that we would make that, of course, crystals are bad. I don't think that's always the case. And not every formulation is susceptible to crystallization in the same way, through the same failure mechanisms, or just because our drug properties are different. They have different crystallization tendencies or different packaging design. Some of those drug products are packaged in blister packs for a reason that protects the patients. And that's the important part. I did in my postdoc related to, I was working on atomic layer deposition and that particle coating mechanism. The kinds of differences, my approach is that your process should do no harm. So in theory, you would get an identical performing product through either manufacturing approach. In practice, that's not the case. And that's because processing conditions matter, your bulk powder properties matter, how you formulate it into a drug product matters, because you have different mechanical properties, for example, between the kind of bulk powder properties that you get out of spray drying and hot melt extrusion. Those sort of different surface area properties could also impact crystallization, as a related example. And so it's important when you are choosing your manufacturing process that it is interrelated to your formulation, and it's interrelated to the formulation, the performance of your drug product as well. Your formulation, your drug product intermediate formulation process, drug product formulation and process are interrelated components in terms of thinking about an ASD drug product as a whole.
Well, great. That was absolutely fantastic. And thanks, Dana, for answering many of my questions and providing images as well to the equations as well. I really appreciate that a lot. I think at Purdue University, you also got a teaching award because that was fantastic. And I could see lots of people making notes and recording things. So I think you had a really tough job trying to do an introduction and covering so much material at the same time. And I think a big question for me is always going to be, now, if you've added a questions, which is a good teacher, how do you know when crystal formation is important? So that's good. And I'm going to talk to you after in the break a little bit about packaging design, because that's new for me, that packaging design, because people who do packaging in clinical studies certainly aren't adding this to their discussion. So maybe I misunderstood. So I don't want to ask that question in front of everybody, which I just did. So, all right. So this is really important, obviously, characterization of the ASD. And our next speaker is somebody you really should meet at the break. David is really connected. And so just as a career advice or something, if you're looking for another job or something, or wanting to know what's happening in the industry, please meet with David. It's just a little tip for free here. And certainly as techniques as spray drying and hot melt extrusion can also make process stabilizing amorphous dispersions more prevalent, there's a heightened need for intricate characterization and risk assessment. While there's an array of sophisticated tools available for drug release characterization, the challenge lies in discerning the appropriate time and method for their application. So I'd like you to welcome David Koyeski, who's a seasoned expert with 2 decades of dedicated dissolution and innovation in vitro release tools. He has a vast experience in the development, commercialization, and implementation of pivotal technologies in drug development. He's very connected across academia, regulatory bodies, and the industry. Notably, his background, of course, he's a co-author on the patent for Pion's macroflux dissolution absorption model, and he's held significant roles in industry giants like Distech, Pion, Tim Company, and the Solubility Company, which you'll hear a little bit about during this presentation. In 2021, he took the technical and the contacts he had and founded Selling Science Incorporated, which is a consultancy that bridges the gap between sponsor companies and technology innovators, and helping them to choose the right in vitro tools for small molecule oral drug development. Let's give a warm welcome to Dave.
So following Dana is a blessing and a curse, right? I mean, she is so knowledgeable in so many ways, but she's laid such a great foundation and put so many thoughts in your head about the importance of dissolution and how to characterize it. So I hope to expand upon those from the standpoint of what tools are available, what methods have been implemented, and where should your thinking be in terms of, the types of approaches you should take for these characterizations, risk and performance-based things. So I am here on behalf of the Tim Company. I'm a senior business technical consultant with them. And as Derek mentioned, I founded my consultancy, Selling Science. I never know where to put this slide, so I tend to just stick it up front so you know who I'm affiliated with. Coincidentally, I'm affiliated with a lot of the people you'll be hearing from today. So you'll be hearing from Josh from DigiM this afternoon. They have a really interesting imaging, analytics, and prediction tool. He'll tell you much more about that. The Solubility Company was a recent addition to the panel for this conference. Sammy, the CEO, is supposed to be here. Unfortunately, he was ill, but we have the pleasure of having John here from the company to talk about their technology as part of the panel. And I'm going to give you a little bit of an intro to the technique they use for those people in the room who might not be as familiar with it. And then I'll take a deeper dive into the TIM technology. TIM is a really sophisticated gastrointestinal simulator in vitro tool to help characterize your drug substances and drug products. So why did I start a consultancy? I guess I should start there. I had held a couple VP of sales roles for companies like Pion and another analytical company that's not really in this space. But what I saw is that without proper commercial infrastructure, a lot of great technologies never reach their target market. And that has an impact on the people who founded these great technology companies, but it also impacts drug development. So while most of the time I'm measured by the revenue I generate or the contacts I make or the sales that come in because of it, my utopian vision for Selling Science was that no great technology goes unnoticed and unimplemented. That the industry, through if I can play one role in bringing better drugs to market, it's making the industry aware of these techniques and tools that exist. The Solubility Company was founded out of the PhD work of Sami Svenbach out of the University of Helsinki. And what he identified was a need to better characterize solubility earlier in the drug development process. And so he came up with this imaging analytics platform, which combines very intelligent algorithms in order to measure equilibrium solubility with a very minute amount of material. We're probably all familiar with the unattainable triangle of consumerism, right? If you want something fast, you want it well made, you're going to pay a high price. You can only pick two of those things. Well, in solubility, the triangle was either a lot of material or a lot of time or inaccurate results, right? That's kind of the triangle. So if you think of the basic like kinetic solubility, which is like your DMSO stock type solubility measurement, yeah, it's very fast, but it's inaccurate, right? It's largely regarded as almost fulfilling a checkbox in the phys chem measurement profile. Most of the time, this data isn't well trusted. I have a very good friend who's been a med chemist at very prominent organizations, and I asked him, why do you do this if you don't trust it? He said, because you have to, right? But then on the other side, you have equilibrium solubility, the shake flask method, right? Which is basically the gold standard. But it takes a lot of material, takes quite a bit of time, but it is the gold standard. It is the most trusted analytic. So Sammy saw this and said, is there a way to combine these two? And came up with this single particle analysis method. So we're here talking about ASDs. I just want to highlight one application of this. Obviously, please direct the majority of your technical questions to John on this technology. He is the expert. But here's a way, using less than 2 milligrams of total API, you can screen through a range of, apologize for the clarity of the graphics, but a range of organic solvents and vehicles which could potentially be used for ASD formulation, right? So hopefully the gears are turning in terms of how such little material could be used so early to get so much information. And that information can be used to feed models, right? So if you're measuring solubility, that can be used to feed PBPK models. But it also can be used to feed models to predict molecular interactions, right? So the solubility company has recently partnered with a company called Amorphous out of Germany, and they're looking at ways to apply this technique. And they have a few case studies that show the applicability of this technique for using this really high density of data very early in the process to actually make better predictions. John, I may call on you to remind me of the phrase, but why is this important for amorphous solubility, right? So obviously for formulation design, it can be very important, but also if you have amorphous drug substance, you can use this method to determine the highest possible supersaturation of this substance in a given media system. Directly measuring the amorphous concentration of crystalline substances can be tricky. This is a method that does it on a particle level and can give you the information directly. Okay, so into the novel dissolution tool piece. So why are we talking about this, right? And this is where coming after Dana is great, because hopefully you already know why we're talking about this. Characterizing complex formulations takes a unique set of tools. They're tools that go way beyond the compendium, right? If we think of compendial USP apparatus, they have their place. We'll talk about that place. But as it pertains to evaluating these novel formulations, they have their limits. These models that we're all turning to, PBPK, PBPM models, it's widely regarded that a good biorelevant dissolution result, and maybe more than one biorelevant dissolution result, is needed in order to build a robust and reliable model. A representative from the TIM company was at the CERSI PBPM workshop a couple weeks ago in Maryland, and while a lot of the traditional methods like two-stage disso are still being used across the industry, there is a huge demand for knowledge and implementation of new methods. So within this presentation, one of my goals is to sort of open your eyes about the tools that are available, how they have been successfully implemented, but also the challenges they face as it pertains to breaking through into the mainstream use within the industry and gain that regulatory blessing, that stamp of approval that everyone sort of wants to see before they make a change from what they've been doing for decades. And I think we'd all agree that understanding the release of our drug, whether it's in API form or drug product form or any stage in between, can help inform better decision-making throughout the development process. So let's start with the last point. Why is dissolution performed? Probably everyone in this room understands that dissolution is a QC test, and it is used for testing the robustness of our manufacturing. Right. So is the right amount of API there? Is it releasing the appropriate amount of time? Right. And the factors that impact that are usually manufacturing process related: compaction, blending, excipients. All of those things go into whether or not we get a passing QC result of a commercial batch of material. But as we know, dissolution is used throughout the development process. Right. So starting from the top, if we're talking about like early pre-formulation work, we're using dissolution in a very almost like binning type way. Or is it soluble? To what extent is it soluble? And then we want to understand some pH solubility profiles with that, right? That's an example of where the solubility company with their micro scale type analysis can really add a lot of value, because there's not a lot of material at this stage. And we might be able to get a lot of information with a little material using some novel methods. A lot of times, once you get a certain amount of material, you're chucking it into a flask, whether that flask is a small volume dissolution vessel, a beaker on a stir plate, or a pion microdis. You're trying to characterize some level of kinetic solubility, which is dissolution at the end of the day. Once you start looking at formulation design, you start thinking about things like de-risking the API with polymer choice or excipient choice, right? For ASDs, you want to understand these supersaturation characteristics. Do I have precipitation risk? Under what conditions do I have precipitation risk? And there's been a ton of publications about utilization of tools like the pion microdis for this type of work. Right? Neil Mathias had a publication in 2013 talking about BMS's two-stage disso approach for looking at the PPI effect, right? Proton pump inhibitors, when you have a weak base applied to a neutralized stomach, it could supersaturate and then crash, and you could end up having a reduction in the exposure you were hoping to see. Ultimately, we're building this data. We're all probably using models at some point of our drug development process. So whether we're using a partner company like a CRO or a CDMO to help build these models, or we have that capability in-house, this data starts to become very important for populating these models. And then once we get to the finished dosage form, finished being probably the key word, are we really finished, right? Are there aspects of this drug product that we need to continue to further evaluate? And with every change in this drug product, do I really have to go back and do an animal trial? Or do I have to do an extensive human trial to study some of these changes? The answer is no, right? A lot of these tools have been successfully applied, though in their own little microenvironments of the companies who have done it. Unfortunately, it isn't as widespread and wide known. But I know of examples where like a post-market polymorph change has occurred and they didn't go back to human trial. They just used a novel dissolution tool to prove that there would be no risk to this, right? We're working with other clients who are looking at dose. And can I reduce the dose and de-risk my formulation through the use of novel tools rather than having to go back into clinic? So when we think about the suite of tools, again, starting with the compendia is USP 1 and 2 in my mind for this type of dissolution work. Obviously, there's 3, 4, and derivations of those systems. But as Dana said, these tools are often non-discriminatory and they lack biorelevance. I can tell you 20 years ago when I was trained in dissolution, I was told the volume of the stomach was 900 mils and the paddle represented the shear the drug experienced in the stomach. Right? We obviously know neither of those things are true. And yet, obviously QC tools have their place, but maybe it's not so much for biorelevant disso. They are simple and standardized, right? So most people who have a wet lab and do some level of dissolution probably have an apparatus. They may have small volume conversion kits for that apparatus to do more biorelevant volumes, but ultimately these are static systems, right? The best you're going to get is doing a bulk dump of media to do a transition from your acidic to basic conditions. So the industry recognized this, and probably about 18 years ago, compartment models started to appear. Right. So towards the end of my career in the compendial dissolution world with Distech, I started to see these homegrown apparatus appear at companies. Right. So David Sperry and Michael Hawley published on this artificial stomach duodenum system. And a lot of companies at that time built out these systems within their lab. Unfortunately, no company ever commercialized these systems. Right. Nobody ever commercialized the exact artificial stomach duodenum, though a lot of companies reproduced its capabilities. And there's a practical aspect to why those have kind of faded away, right? When I think about the companies I visited in 2005, 2006, who were doing these type of systems, most of these were large pharma companies. They had extensive engineering departments who, when a pump went down or they needed to build a specific length flask or specific length tubing, they just went to their engineering group and said, build me this, and they'd fabricate it. Right. The reality is those groups have been diminished, if not eliminated, at most large pharma, and small pharma, medium-sized pharma just doesn't have that capability. So the need for a commercially available system has always been there. Recently, out of the Amidon group, the GIS Alpha system was recently commercialized. So there's another compartment model system out of the University of Copenhagen. There's a compartment model system that's been commercialized through the company Bioneer. So these systems are starting to appear in the market. Obviously, as a representative of TIM, I have a bias. I had opportunities to join all three of these companies as a consultant. I chose TIM because they've been doing it the longest. They have the most experience and most comprehensive data sets around the use of the technology. But in general, one thing that's holding these things back is they lack standardization and validation. So there's no sort of qualification toolkit for a compartment model, right? You can measure flow rates and pH, and that's about as far as you're going to go, right? On the TIM system, there's some checks and balances to make sure the system's working properly, but it's a far cry from like the mechanical qualification of a USP apparatus, right? Again, when I started now 10 years ago with Pion, it was thought that in silico modeling was a huge risk and was actually could potentially put instrument companies like Pion out of business, because why would you buy a system to measure pKa if you can predict pKa? And then what's next? You're predicting solubility, then predicting dissolution. You're not going to need to measure anything anymore, right? That was like the overreaction that occurred when some companies like GastroPlus started to talk about the potential of their technology in the market. And where we've come to is a compromise, right? Where we've come to is a realization that we need great inputs in order to have better models, right? And maybe there will be a day in the future where those inputs are reduced and the models take precedent, or in vitro is reduced and better in vivo knowledge comes forward, right? But the reality is today that biorelevant dissolution is one of the most critical inputs in order to have a reliable in silico model. Let's talk about ASDs, right? When obviously we talked a lot about crystallinity and supersaturation, or we heard a lot about it in Dana's talk. Measuring this in vitro can be a challenge, right? For all the reasons she presented, but we have a range of tools to attack this problem. And one thing that came to mind as she was talking was obviously Dana works for Pfizer, right? And large pharma has more bandwidth than small to medium-sized companies as it pertains to moving a drug through its program, right? They have defined processes, they have extensive instrumentation suites, they have huge expertise across ranges of sites. One of the challenges I've always faced in talking to people who aren't working for a Pfizer or a Novartis or a Merck is, how do I choose the right tool? I can't choose every tool, but how do I choose the right tool that's going to give me the right answer? And what came to mind in Dana's talk is maybe it's right now, I don't think we're there, right? I don't think we have that one tool that we can turn to. I've spent I spent a lot of my career with Pion, and I probably have trained more people in the use of fiber optics, between Distech and Pion than anyone else in the history of the technology, right? As we sit here at a baseball stadium, I'm a little envious of professional athletes, because if you hit a home run, it gets recorded and it's on the internet and everyone knows about it, right? So when you look back at what are your stats, your lifetime stats, you can look at this stuff. When you're in our world, right? I guess if you bring a drug to market, that's a stat you can always hang your hat on, right? I have a patent, I can hang my hat on that. But some of these sort of subtle things, like these fiber optic training piece, somebody said it to me, right? It's just like, you've probably touched more fiber optic clients and helped them be successful with the technology than anyone in the history of it. And we'll talk a little bit more about fiber optics. I think that's one thing I identified that I can speak from a standpoint of expertise on, and help people in the room who don't quite understand why fiber optics is in the conversation. Why is it actually there? But understanding what in vitro tool to choose is the challenge, right? So the range of tools that obviously we can start simple. We can start with some basic single flask disso. We can make it more complicated with some two-stage work. We can look at doing some dissolution permeability type studies with a flux type assay. And ultimately, we can go to something very biorelevant and predictive like the TIM system, right? So if you're a small company in a stage of development where you're trying to identify what to do, you might not be able to do everything, but my recommendation is to talk to as many people as you can. Find good consultants, talk to the suppliers. Most suppliers like TIM, like Solubility Company, they have really technical people who are happy to talk about your problem and discuss with you whether or not their tool is a right fit, right? So I think that's one thing that hopefully you'll take out of this is, while you don't have to buy everything and you don't have to subscribe to every service, do your homework, talk to these people, learn as much as you can about what their capabilities of their system are. And internally to your team or with external consultants, you can decide what the right path forward is for you. So one thing that is pretty well established is that within simple in vitro systems, precipitation is typically overestimated. And that makes sense. If we think about what is actually causing precipitation is seeding and nucleation and these crystals hitting each other and further building more crystals. If I do this in a small flask with a big paddle whipping stuff around, the molecular interactions are going to be pretty high. If I think about what the hydrodynamics are in our body, they're going to be significantly different. Right. So thinking about precipitation, yeah, DISO will probably give you a worst case scenario, but thinking about looking at a compartment model system or a TIM system, which I'll talk in a minute about, will give you a more realistic prediction of the precipitation risk of your molecules. All right, so let's talk fiber optics for a minute. This is a schematic of a pion rainbow within the drug development space. So within the early drug development space, the rainbow is probably the most widely used tool. It can be applied in a lot of different ways. The microdis is probably the most established novel dissolution platform out there. I have no affiliation with Pion. This is more just for education. So what happens is you have a lamp, you have a shutter. When the shutter opens, light travels through all of these fibers simultaneously. It enters the sample through this dip probe. And in this dip probe, which you can see a little schematic to the right, is an aperture. That aperture is filled with sample from the test vessel, from your dissolution test vessel. Light interacts with everything in there, is reflected off a mirror, collected by the returning fiber and sent to your diode array detector. Right. So the advantage of this is a high density of data. I noticed this in Dana's presentation, maybe other people didn't, but the work that she showed, like 2016, 2017, 2018, you had sort of discrete data points every 5, 10, 15 minutes, whereas the data she showed after 2020 had these painted line disso curves, right? That was around the time Lynn Taylor's lab got the Pion system. So I love to see painted line disso curves because it means you're running fiber optics, right? That's sort of a feather in my hat when I see these awesome dissolution plots. Light interacts with our entire sample, right? That's great if we have a neat sample, like an intrinsic disso sample or something that fully dissolves. But what happens when we have particles present? Worse yet, what happens when we have particles present that don't scatter light linearly, right? So if we think about a bulk particle, when it scatters light, it's probably going to distort the baseline in a horizontal plane, right? So we can choose any normal baseline correction technique, make a delta subtraction down, and get the right answer, right? But when we talk about these complex species that occur during solubilization or precipitation, oftentimes they're of a smaller variety or a colloid, and they can distort light very differently, right? So the red line would be an example of Tyndall scattering, which is the scattering most commonly caused by colloids, and Rayleigh scattering, the blue, is caused by small particles. What you'll notice in this plot is that at earlier wavelengths, which are higher energy, the scattering are much greater, right? If my friend Konstantin Sinman was here, he'd tell you it was because of the fourth power of frequency and the wavelength of the light. But I don't throw up these equations, right? So it's basically higher energy. That's the way we think about it. And so these smaller particles have a disproportionate impact on the scattering of light at higher energy. So how do we characterize this, right? So think about the previous slide, right? So we've sent light from this lamp into our vessel. We've collected this high density of data. It's diode array, so I'm seeing the entire spectrum at one instant from all my channels simultaneously, right? And now I see the scattering effect on my baseline. Now I compound that with an API on top of it. So how do I know if I have good data? So I've spent a lot of my career with Pion helping clients identify where they have and don't have good data. And a lot of that work continues today in my consultancy as companies call me in to help them better, they're running projects, they're seeing artifact data that they're reporting is real, and they're wondering what's going on. From a CDMO standpoint, the CDMOs have a disproportionate amount of touch to end user clients, right? If bad data is being generated within BMS, then that's a BMS problem. If bad data is being generated at a Catalent or a Lonza, that's touching dozens or maybe even more than dozens of clients, every month. So that can really negatively impact the potential of a technology if the end users of the technology aren't using it appropriately. So in helping customers understand how to apply fiber optic data, I came up with this rule of 3, right? Maybe I was inspired by Lipinski or something, I don't know. But either way, what we need, the first one's pretty simple, right? I need a standard curve that's linear over the concentration range that I'm looking to measure. That one fits, no matter what your analytical technique, that one just makes sense, right? When using second derivative as a spectral interpretation technique, the spectra crosses the x-axis at discrete points. And these x-axis intercept points are independent of concentration, right? So what that means is I have an anchor by which to evaluate good and bad spectra. So as I look at my standard spectra, when I start to see deviation of the spectra from these x-axis intercept points, I've broken my linearity. I've broken the second rule, right? And then the third is samples and standards have to have the same spectrum. So one mistake some early fiber optic users make when they start to apply the technology is they'll dissolve their standard in solvent, because that's what they do for HPLC. They'll stick the dip probe in the solvent system, and then they'll run a DISO test in 0.1 normal HCl or FASF or FESF buffer. And what they'll see is very different looking spectra because of the refractive index and molar absorptivity of the compound in those different media systems, right? So if we look at it, obviously, linear standard curve, here's an example of well-behaved spectra on the top where everything's crossing the x-axis through these specific points. And then we have some distortion. LLPS, liquid-liquid phase separation, is one example of where distorted spectra come from. Nanoparticle precipitation is another example of where these things come from. So understanding during a dissolution test where the speciation occurs can also be very informative, right? There's no one experiment that I don't think any expert on this technology would ever say, this is exactly what to run, right? The best advice I was ever given was by somebody from Bend Research, now with Sage, and he said, the problem he has in training new people is they just want a cookbook. Run this, run this, run this, be done. And what it really takes is you run an experiment and learn from it. And, using the principles that Dana talked about, using the knowledge of the technology that, that a company can impart, you can start to understand, all right, I saw this. Why did I see that? Did I not have the right level of non-syncness, right? Did I choose the right wavelength for calculation? All of these things come into whether or not I have good or bad data and good or bad results from it. So again, this is a snapshot from the Pion software. They have a function within their dissolution interpretation screen that allows you to overlay your sample and your standard spectra as a function of time. So these two windows are the same concentration time profiles. And what you see is during the first part, right? So if you see where that cross line is at the very top, this is very early in the solubilization. This is when the sample was just introduced into the system. You see that the sample and standard spectra perfectly overlap. But immediately the sample precipitates. And so when you move that line down the curve a little bit, and it's not showing up because of the resolution of the thing, but you see the spectra shift off. So that means that I'm no longer looking at the same species, or because of intense scattering reasons, I no longer have a reliable sample result that I can compare back to a standard. So I mentioned these systems just so you guys know what they are. The system on the left is the Rainbow. The Rainbow, when it's applied into a micro volume, a small volume dissolution kit, is called the microdis. And the microdis can be further expanded into use with the side-by-side dissolution permeability cell called the microflux. Pion has a mini DT, which also has a mini flux, and then the large volume USP vessel, which has the add-on, the macroflux. So no matter what you're doing for disso, you always have the ability to do a dissolution permeability, with the range of systems that Pion offers. All right, so let's get into the TIM. So the TIM system, just to give it some perspective, this thing dwarfs a refrigerator, right? And so the TIM system spun out of a Dutch research institute called TNO. And TIM stands for TNO intestinal model. We all hate the name, so no need for you guys to critique it. We're aware. It doesn't properly reflect the sophistication of what we do. It's kind of like honoring our mothership, and that's not really appropriate for as cool a technology as this is. So TNO never intended this to be an instrument or a service. They just did it because it was part of their research. Eventually, food companies started to say, well, we'd like to use this to help assess digestion of nutrients and all this stuff. And this is back in the mid 80s. In the early 90s, pharma caught wind of this and jumped on it. And so there were some very early adopters to the technology who forced TNO to build additional systems and supply them with additional systems. And out of this came the thought, well, this sounds a lot like a business, but it sort of suffered inside TNO for a long time. And when suffering, meaning it got a lot of research attention, but it got very little commercial attention, right? It's still to this day, I talk to people in the US who've never heard of this technology, right? And it's been around for 30 years, right? Companies like AstraZeneca have completely closed dog colonies in their Macclesfield, UK location because of this technology. You know, they run more they have more TIM instruments than the TIM company does. Right. So big pharma has recognized very early the power of these tools and utilized these tools for every oral program in development. Right. And that's a direct statement from both Genentech and AstraZeneca. There's no oral program that goes forward through their system that doesn't touch a TIM instrument. So these are upper GI systems, right? And there's two of them, TIM and Tiny TIM. Can't make this stuff up. So the big difference between the two is Tiny Tim was designed, all of a sudden TNO's like, oh my God, people are buying these things, but they're complaining about how cumbersome they are to use. They're very manual. So they designed the Tiny Tim, which is a much more automated, simpler version of the Tim 1, right? So the Tim 1 is the big refrigerator size thing here. There are a few differences. The Tim 1 does have compartment specific absorption capability. So you can look at the 3 different compartments of the upper GI, whereas the Tiny Tim has an assumed condition across the upper GI. But the big thing to note at this point is the TIM company, which has now spun out of the Research Institute, is private equity backed, is no longer selling instruments. So what they do is they provide a fee for service model for clients who want to access the value of the data, right? So unless you're a big pharma who wants to build out a several $1 million piece of infrastructure and put this piece of equipment in which case they'll work with you on a licensing model. For the majority of the industry, they're a CRO, right? So it's a CDMO who's providing this data to these customers. So what system they choose is less a function of how difficult it is to use. It's more a function of what do you need for your projects in order to answer the question at hand. Right. I was there earlier this year. I ran samples on the Tiny Tim. They're very well thought through systems. They're incredibly mechanically complex, and they control a ton of different parameters like the pressure inside the GI tract. Obviously, pH is one you would assume. And yes, they monitor and regulate pH within the stomach and the intestinal tract. But these are very precise computer-driven systems. They give you the ability to collect 2 different forms of data, and we'll talk a little bit about that in a second. But one thing that always comes up, because we're within this biopredictive dissolution world, we're hung up on biorelevant dissolution media, right? And most of us who run this probably standardize on the CIF powders from biorelevant.com. Those are great, simple buffers to use for biorelevant disso. The important thing to note about TIM is you don't start with biorelevant media, it creates biorelevant media. So through the secretions, right, if you can see through the previous slide, the bank of syringes on the top system, those exist behind the panel on TIM 1. But on the bottom right of the top image, there's a bank of syringes. Those are secreting pancreatin. They're secreting bile, real porcine bile. They're secreting all of the electrolytes and all of the other enzymes that are pertinent to digestion that actually occur in vivo. So the next slide shows that no minute within TIM is the same, right? Because no minute within the body is the same. This is where 2-stage disso, in my opinion, has a place from a very worst case scenario standpoint, but falls flat as it pertains to being actually biopredictive. So just like in the body, the secretion of enzymes, the secretion of biles, all of this is a dynamic process as a function of not only the physiology, but how you took the drug, right? So this profile would look slightly different if you were running a fed state versus a fasted state experiment, right? So fed state in CIF powder is just contains some lecithin and some other materials that make it more relevant, but it's also a simple buffer because it needs from an analytical standpoint. Fed state in a TIM system is bacon, eggs, toast, milk, homogenized, masticated, and introduced to the system with your drug, right? So in terms of, again, the bioprediction, you can't get more biopredictive than real food with your drug in a system that's secreting enzymes and all the other stuff that are pertinent to physiological dissolution. When we think about what we get from a TIM system, people always ask, what's the data I get, right? In the most simple terms, you get a dissolution versus time profile, right? And the thing is, your dissolution versus time profile will look a lot more like your PK profile than it will like your QC dissolution profile, because you're looking at segments of concentration, not just an accumulation of concentration like you do in QC flask-based disso. But you can get a lot more, right? So the filtrate samples are what's going to give you these concentration windows. What's the average concentration over the first 15 minutes, first 30 minutes, first hour, right? And each of those are collected in their own bottle. You can pull luminal samples. So when we think about the potential of precipitation or the formation of LLPS or colloids within my system, to what extent are these species present, right? Within a traditional dissolution system or this system, you face the same challenges of separating these from the matrix, but within this system, it gives you a much more biopredictive idea of whether or not these species are going to form, how they're going to form, and what's possible. In addition, you have these ileal effluent samples, which is what's going to exit the upper GI and enter the colon. So for a lot of clients who come to us, they have an extended release or modified release formulation where they're looking to understand the digestion across the entire intestinal tract. So what the TIM company has done is they've designed this TIM2 system, which is the lower GI. Again, can't make this stuff up. So each one of these is individual tests. So whereas the other one transits the entire system, each one of these flasks, you'll see N equals 4 here. There should be an N equals 4 experiments. You could actually run 4 experiments on this platform. This also is the size of a refrigerator. These systems can take that ileal effluent and infuse it into the system as a function of time. And this system is inoculated with real human feces to represent the human microbiota, right? So this is a lab you don't want to work in. And so it's funny. It's like, where's the TIM2 lab? There's like, it's all the way at the end of the hall through the double doors. Like, it's isolated from the rest of the company because it does smell. But anyway, the TIM2 system can give customers an idea of what's actually going to be entered into the colon and how it's going to react with the microbiota of the colon and how is it going to continue to release in the colon. So they've thought of the complete process. So what do you get out of a TIM system? You get biorelevant dissolution data. You get an idea of what is potentially present in the forms of species within the GI tract through the withdrawal of these luminal samples. You can visualize the formulation disintegrate. So if you have concerns about physiologically relevant disintegration, obviously the disintegration tests we use in like a QC type environment are sort of like hitting it with a hammer. That's brute force methods. Whereas this uses peristaltic action to actually, and we'll see that in the next slide in sort of the visualization of the system. It uses peristalsis to move the drug through the system. It has very specifically programmed gastric emptying. So if you just want to look at how are things physically changing within the system, you have the way to visualize that, but you also have a lot of analytical capability. This system doesn't have any inherent analytical detection, so all samples which are removed have to be processed with some external analytical tool. For the concentration samples, it's HPLC. So here's a little video of somebody coming up to run sort of a dummy TIM experiment. This drug is introduced at the top of the stomach. This system was designed, the stomach is actually 3 parts, just like the stomach compared to the bottom of the actual. So the formation and the stomach prevents the elimination system. What you see is that pulsation, that's that peristaltic action. And what's actually happening is that the tests occur and the liquid that is the water jacket which is being pressure of the water changes the peristaltic action and moves the drug through. Then you have this valve, peristaltic valve, that empties the drug into the rate into the small intestine. And that rate is different whether or not state, just like ultimately samples are collected through this filter, which is just basically a size filter, which was 50 the size they standardize on. There. And then the samples are collected in a bottle. There's collecting a luminal sample from the stomach compartment. Samples within the system are passed through this filter and collected into these bottles to get you to find much information. So this is all really cool, right? So why don't we do more of it? Talked a little bit about this at the beginning. Some of us just don't have the time. Some of us don't have the resources, budget. The timelines don't match being able to send this out. right? And there's some assumptions in the industry, right? In silico models are good enough for early stuff. I don't need the greatest data in the world to get in the ballpark. No pun intended, I guess pun intended. And a lot of companies look at it like, I'm not going to invest until I have a problem, right? So I'm going to run my drug program through. I'm going to assume everything's going to go great. And when it doesn't, then we're going to panic and react. And that often doesn't lead to the best choices of what novel technology to integrate. Right. We have some basic formulation approaches that simplify everything, like powder and capsule. We just, just chuck it in a capsule, we'll pump it into a dog, and we'll see what happens. Right. So that the fact is that's been going on for a long time, and it's worked. Right. So why am I going to ever deviate from it when it works 8 times out of 10? Right. That's great if you're a portfolio company and you can afford that 8 out of 10, and you have the resources to dig into the other 2. But if you're not, if you're an asset company, you have a couple assets in development, can you afford that one of your drugs isn't in that 1 out of 2, right? And then how do you identify how deep to dive into these problem statements, right? And animal models are still the precedent, right? So let's talk about animal models for a second, right? I hear this time and time again, everyone pumps everything into dogs, right? That's fine, that's the industry standard. The FDA almost looks for it like a checkbox. But let's be honest, at best, you get some directional information from a dog study. At worst, you're left with more questions than answers. And then what do? Do you repeat the dog study? Do you just ignore the data, right? The fact is dogs, anatomy doesn't match humans. I think that's, we all understand that. The pH of the stomach is way off, so we have to dose our drugs with, penagastrin. Is there any interaction there? Well, we don't know. We really have no choice, especially if we have a weak base. So we think of all these models that we use, right? And this is a publication from 2013. It's a correlation factor of like 0.5, which is the equivalent of a random number generator, right? So especially for modified or controlled release formulations, dog models, they just don't tell you enough information. The transit time through a dog is way too short to give you valuable information for these types of formulations, right? So it's got people talking, right? The FDA Modernization Act came out last year, and it's created a lot of buzz, right? Charles River was questioned about this at their end of year earnings meeting, and the CEO of Charles River said, as new in vitro technology becomes available, Charles River will be the first to implement it, right? And this is a company that's business model pretty much relies on animal testing. So, it got so big that the New York Times said is the first, drug to come to market without animal testing and development today. Fact is, Europe's been ahead of us for a little time, right? And some of it's washed out here, but in 2015, the European EMA came up with the 3 R's, right? So replace, reduce, refine. And the world is working towards it, right? I've sold into Europe, I've visited Europe, I've supported Europe, but I wasn't aware of how visceral the animal testing thing was there relative to here. Here we're like, nah, we shouldn't kill animals, we don't have to, but the heck with it, I have no other choice, pump it into a dog, right? That's kind of the American mentality is, we don't do what we believe in, we do what's convenient, and then we repent, right? So in Europe, they literally have guarded animal, vivariums, right? They're double barbed wire fenced armed guards because that's the level of, public scrutiny and attack they're under, right? So they're 7-8 years ahead of us. We look at this like a global approach, right? Finally, we're on the map. But are we ready? So here's my challenge to the room, right? The room coming from the supplier technology side, right? And maybe this pertains to the AustinPx folks as well, because you guys are coming up with a disruptive technology to the status quo. The industry is always asking for this sort of unattainable burden of proof that you cannot fail if you go this way, right? So otherwise, I'm just going to do my dog model. I'm going to do my 2-stage DIS. I'm going to do what I've always done because, as the saying goes, you don't get fired for buying IBM. Well, if that happens, I can tell you new technology is dead, right? Because we can't rely on the 4 or 5 big pharma companies who do have the resources, though even their resources are under even more scrutiny today than they were 15 years ago, to carry the burden of this through the regulatory acceptance process. The regulators they say they're open, but then they sort of act differently than that. So there's groups within the FDA that I know intimately that are really forward-thinking, innovative, and looking at novel approaches to solve these problems. But ultimately, it comes down to the reviewer, right? And how is new technology being exposed to the reviewer? If the industry isn't submitting this data as part of their submission process, the reviewers never really get the exposure to it because they don't have the time to shop the internet for what new technology might make things better, right? And as to the supplier side, we need to continue to innovate. We need to continue to get feedback from the industry and make adjustments in terms of what is needed to make the tools better to meet the problem statements at hand. So if we all don't do this together, it's never going to happen. We're going to be stuck with the same old stuff that we've always done. And as Derek said in kicking off this meeting, a lot of drugs are failing. Are those drugs failing just because they're the wrong molecule? Maybe that's a good portion of them. I'd love to see that broken down further. Are some of them failing because the appropriate formulation approach wasn't taken and the appropriate measurements weren't done to inform the formulation process to let them make a better decision? So as I mentioned, TIM has been around for 30 years. They're headquartered in the Netherlands. They are a contract research organization. So they're a fee-for-service model as it pertains to most people in this room. If there was interest from somebody, I can tell you if you want to run a TIM system, the expectations will be you might be able to run one TIM experiment per day with one instrument. You need a full-time FTE, if not a full-time FTE and a half, in order to run and maintain the equipment. And so that's the reason. It's not just buying the equipment or leasing the equipment, it's the infrastructure you need to build around it, which is why the model of a fee for service makes more sense today. They're obviously talked about by a lot of these big companies. All of these companies have publications on TIM technology and make some pretty bold statements about the potential of the technology. And with that, if I've left any time, questions?
So we'd have to send samples to Europe.
Correct.
Okay, there's nothing in the U.S.
Today.
Today, yeah, it'd be interesting to see if they brought, more dispersions. Obviously, there's always questions on ability, so it'd be nice to be able to.
Yeah, I mean that's not. So they've never had a full-time U.S. employee, right? So if anyone's talked to Tim and talked to somebody last night who talked to Tim 6-8 years ago, they had a part-time business development consultant just like me, who is their job in addition to bringing them clients is to give them feedback. I continually tell them that they need to put this on their radar in terms of building out operations. But, when they start to get clients telling them that I can't send samples to Europe.
Wade used to have one, and that was a while back. And say
long time. Yeah. That system has since been returned to Tim.
And then what's the availability if we contact them needed to do an analysis? How long would it take?
So yeah, I always try to say it relative to what else you would do, right? So you would either do a dog study or do this. Typical programs, assuming some reasonable scope of work, 2-3 formulations screened under a couple conditions, 4 to 6 weeks turnaround time from sample submitted to data received, which is in line with a typical US dog study, unless you have a dedicated colony. If you have a dedicated colony, then you can obviously do that faster. TIM's counter to that is you could have a dedicated FTE at TIM. So if you really have enough work to justify a dedicated dog colony, then you probably have enough work to justify a dedicated FTE at TIM. And so we're comparable in that way.
Why hasn't TIM approached the FDA themselves?
Stay tuned.
Okay.
In about, what's today? In about 16 days, I'll be able to say something different than stay tuned.
Okay.
So.
And then for like a sample that you pull out from the syringe, that goes through a membrane first, right? So
how you treat that sample is really a function of what you're trying to get out of it. The sample that goes into the bottle is through a membrane. So that is a filtered sample that is supposed to remove any particle larger than 50 nanometer. What you pull from that syringe, it depends on what you want to measure out of it. If it's just concentration, then obviously you have to remove all of the undissolved material. How you do that is a function of what's actually in that luminal sample. Right. If it's large crystal, then a simple filter will work. If it's not, then you have to look at something like tangential flow filtration or.
But you're not pulling it through like a biorelevant membrane.
You're not. No, it's direct access to the sleeve through those luminal ports. That's a good question.
Thanks for the good presentation. Have you done any analysis to correlate the data that you get from the TIM to human exposure?
Yeah, there's
to assess its predictability.
So. Yeah, absolutely. So there's, I think, 240 peer-reviewed journal articles on this technology, many of which have either dog or human data correlating them. I would be an imposter if I stood up here and started to talk about those case studies from a perspective of expertise. So having been invited to this to talk about the availability of the tools, the goal of my presentation was to make you aware of the tools. Tim has an extensive technical team that can talk about specific molecule classes, specific experiments, and how the expectation should be to human data. We've had publications from like Boehringer Ingelheim with level A IVIVC correlation to human data, and obviously AstraZeneca, Genentech, if they're using this as a replacement for dog, has seen the predictability of this type of information. But yeah, I just didn't cover it on this talk.
All right. So now we get to the part of the program where we pay for our lunches, the timeshare part where we listen to AustinPx. Kidding, no, it's obviously the next speech is about how kinetisol is disrupting spray drying. But before I get into that, I thought the last talk was interesting. New things I got to learn about. Rayleigh scattering, Tyndall scattering. Thank you very much, David. Things to learn. But I want to test everybody. Does everybody remember Kowatsky's rule of three? Little test here. It's going to be a test. I don't know what it means, but linear standard curve. Number 2, precise points of intercept. And number 3, standard and samples have the same shape. That good enough for some catches? All right, thank you. Good. So we're going to have, I think that in terms of one main benefit of kinetisol is obviously the solvent use compared to spray drying. And just wrote a couple of notes here that by 2026, it's expected the world's going to use about 33 million metric tons of solvent. The United States will take up about 4 million metric tons of that, and China, 12 million metric tons. That's growing at about a rate between now and 2026 of 3.4%. The dollars are out there at about 8 trillion or $8 billion dollars, but it's growing at a faster rate. It's growing at a rate of 4.8%. Compared to what I'd said was the regular solvent use in the world is 3.4%. You can say, okay, well, that's because we're all getting older, and it's becoming, pharmaceuticals and healthcare is becoming a bigger part of our world. It's true, but I wonder also if it's because we're using more solvents in the pharmaceutical industry. And 80 to 90% of pharmaceutical waste is solvents, apparently. And of course, not just for spray dry dispersion. I hope it's not that. But the COVID, all the vaccines, use them a lot. So I think this next speaker is going to be important to learn how we can have the possibility using kinetisol in disrupting spray drying. We'll learn later on in the afternoon how it's not a one solution for everything. Absolutely. So we have to understand when we use it and when we don't. But in general, we'll be using some real world experiences and examples where kinetisol successfully replicated commercial SDDs, offering benefits like the elimination of solvents and better drug properties. Comparative analysis will be provided, contrasting the infrastructure and processing needs with kinetisol, offering insights into the efficiency and simplicity of the latter. And Dave will delve into the superior biopharmaceutical performance of kinetisol over spray drying using multiple case studies. And as we learned from this morning, robust analytical data. And hopefully by the end of this next speaker, we'll be able to recognize the possibility of kinetisol as a commercially viable method to simplify the manufacturing process. Yesterday, we were talking a lot about how it makes our job easier. And I think that's interesting because I always think, well, a new technology would make something harder. We know spray drying, this is different. But I'm interested in, for myself, how it can make our world our work a little easier. So I want to join in welcoming Dave Miller, the Chief Scientific Officer at AustinPx. He has a very rich background that includes a decade as VP of R&D at Dispersol and a significant tenure as senior scientist at Hoffmann-La Roche. He's contributed to over 42 research articles and 8 book chapters. And he's a proud alumnus of the University of Texas at Austin here, where he earned his yeah. And we'll see that as another theme today, all the UT people. Where he got his BS in chemical engineering and a PhD in pharmaceutics. So let's give a warm welcome to Dr. Miller.
Okay, so there's my title. It's pretty bold. Last week it was even more bold. we were on a virtual meeting with the other speakers, and it said, why Kinetisol will displace spray drying. And my good friend Michael Crowley audibly chuckled, and I said, well, maybe that's a little too bold. Maybe I should back off that a little bit. And because it probably, there's always a place for various drug delivery technologies. So I replaced displace with disrupt. And I think that's appropriate. I think that's an appropriate title because I'm not formally business trained, but I read a book from the Harvard Business Press once called The Innovator's Dilemma. And there's a lot of important lessons in that textbook about commercializing a disruptive technology, particularly in a conservative industry. And I think a lot of those lessons really read onto our history of Kinetisol. And I think the key is that my take-home message from that book with respect to Kinetisol was that you've got to stay flexible and adaptable, and you've got to withhold resources because your first thoughts about where your place will be in the market may not be correct. So you got to be able to respond to market feedback. And I think what we've done recently in pivoting to Austin Pharmaceutics and bringing this great business team and Tim in, we've eliminated a lot of the barriers that precluded some companies from utilizing Kinetisol. And in doing so, we've brought on more molecules in the last 6 months than we've seen in quite some time. And that allows us to get a lot of feedback from industry. And what the industry is saying, per analysis of our current pipeline, is that they're struggling with a lot of limitations of spray drying. There are many and various problems with spray drying, and they're eagerly and actively looking for a better solution. And that's the reason why about 3/4 of what we're working on today is Kinetisol conversions from spray drying. So I think this is an appropriate title. The industry is looking for disruption. We've evolved this technology over the last 16 years to a state of maturity where I think we're ready to take on the challenge. We're ready to implement Kinetisol commercially, and so we're at the right place at the right time to capitalize on where the industry is with respect to use of solvents and other limitations of spray drying. So in these next several slides, I hope to convince you all that we're on the cusp of Kinetisol making a serious dent in the spray drying market. Later today, my esteemed colleague, Dr. Justin Keene, will get into more of the nuts and bolts in the process. And tomorrow at the Technology Center, Chris's chocolate factory, I hope you all are going there. It's going to be a great experience. You get to see these machines in operation and how they're made. Chris is going to go into great detail about the technology, how it works, its history, et cetera. So I'll just gloss over these slides, but I think everybody here, if you're here, you probably know the basics of Kinetisol, but I want to calibrate the audience just with some brief overview. So I'll go through these slides really quickly. I think everyone knows when I met the process and when I met Chris, it was a mature industrial scale plastics processing technology. And it went through a drug-induced mutation over the last 6 years to becoming a very elegant and robust pharmaceutical unit operation. And here's a schematic. Colin and Rob have heard me present this so many times. It induces nausea at this point, I'm sure, but you're going to appreciate this. So I'll leave the details to Chris, but essentially Kinetisol is an ultra high speed mixing process. It converts a blend of crystalline drug substance and excipients into an amorphous solid solution, and it does it in about 10 seconds at temperatures well below the melting point of the API. And that's it. That's the fastest I've ever given that overview, and it pains me to leave out all the details, but Chris will do it tomorrow, and he'll do it much better than I ever would. Again, we have 2 scales of equipment, research and manufacturing. You'll see these in operation tomorrow, and Chris will go into great detail. For us, the research machine in my group is the workhorse. This is where we can establish feasibility with any given molecule with single-digit gram quantities. And if you've got 50 to 100 grams, we can exhaustively map a formulation space to find the optimum formulation. And we're even using this system now in GMP as a way to accelerate drug product into a human PK study. So eliminating need for engineering batches and expediting tech transfer. And then next, it's just simple linear scale factor to the manufacturing machine, where this is a very versatile machine, can produce first in human supplies all the way to commercial from a single machine in a very small footprint. So that's all I'm going to say, and I'll leave the rest to Justin and Chris. So when Kinetisol came on the scene, eliminating the use of solvent and minimizing thermal stress through both time and reducing the duration of exposure, reducing temperature, it really shifted the boundaries for ASDs and allowed more incorporation of more actives. So, high melt point, poor organic solvent solubility, thermally labile actives. Now, more of those have become viable in the ASD space. And similarly, it expanded the excipient space for a lot of the same reasons. We could process polymers that were thermally sensitive or non-thermoplastic or didn't have a common solvent with the API. So it really does broaden the formulation design space relative to other technologies, and that creates opportunity for more optimal drug products, surprising results that lead to meaningful IP, compositions that can't be duplicated by other technologies. So I think it's not trivial that the operation of the process and how it increases what you can do in terms of formulation for ASDs. It's not a trivial thing, and I'll show it later in the slides of how we've been able to use this broadened design space to really develop optimized ASD products that have real clinical benefit and bring along with it some significant IP. So when we first sort of came on the scene, this was a diagram that was presented by several different scientists around the industry, and in the top quadrant where these brick dust compounds were and starting to emerge back in the late 2000s, there was a question mark in this box that these brick dust compounds are becoming more and more prevalent. We don't have a really great solution. We need some innovation in this space. So this is kind of where we focused initially. Really thought that Kinetisol as an enablement platform was going to make a huge impact, and it still has that potential to really impact brick dust compounds. But what was surprising was the application of Kinetisol in the other quadrants, where melt extrusion and spray drying have been the more conventional approaches. There were some really key limitations in each of these quadrants where Kinetisol was a more viable option when solvent processing is an issue, or where thermal degradation limits melt extrusion, or viscosity limitations impact formulation design. So where we focused initially on enablement, I think we've seen a lot more application in the other quadrants, just as a result of there are more compounds in those spaces than there are brick dust molecules. When we look at our development history as a function of melting temperature, I think what stands out is that about 73% of the compounds we've worked on historically would be considered high melt temperature. Melting temperature is greater than 200. And maybe even more surprising, 40% have melt temperatures greater than 250. And, I think we may all agree that melting temperature kind of loosely correlates to all solubility. So many of these compounds are also organic solvent challenged, solubility challenged. So now this data set's probably enriched given the technology that we have, but it may sort of represent also general trends in drug discovery that molecules are trending more towards high melt point, low organic solvent solubility. So starting to see gaps in the ASD coverage space with the conventional technologies, and a growing need for something like Kinetisol. And then now calling back to our Venn diagram here and the expanded formulation space of Kinetisol, and back to my point that this is not just a trivial thing that you can, put more ingredients into the formulation. When we look at our clinical product history, the drug products that we've put into the clinic using Kinetisol, 2/3 of those have been multi-component systems, and these components that we've incorporated into the formulation beyond just a drug polymer binary system have been key to first optimizing performance. So that's the goal: maximize bioavailability, and then other components are incorporated to ensure manufacturability and stability. And in a lot of these cases, these ancillary excipients have been key towards stability or performance to an extent that constitutes the surprising result of a formulation development, where you can get some meaningful patent coverage around an ASD that incorporates this drug, this polymer, and this stabilizing agent. And without that agent, you don't have a viable product. So that's where the IP component comes in, and also incorporating performance enhancers that allow you to achieve maximized PK at a given dose. So to the extent that it would be difficult or impossible for a competing technology to duplicate down the road, preventing an AB-rated generic. So with all that front matter out of the way, I'm gonna descend into my title here about my contention that we're poised to disrupt spray drying, starting with a couple of examples of where we've shown kinetisol to be a substitutable technology for spray drying for commercial products. And so case study one is kinetisoling intolerance. So intolerance is a FDA approval in 2008. It's an HIV drug. It's a J&J molecule. What attracted us to this drug product as a company was that the patents were up on the API in 2019, and all the regulatory exclusivities, pediatric exclusivities were expiring in 2022. So this was effectively one of the first spray dried products to come off patent. And we targeted it as a product that we could make an AB rated generic using kinetisol. It was challenging to say the least. My longtime friend and colleague Sandra Kuchera courageously led this development. I fear it took years off of her life, but here's the reward: a really compelling case study for kinetisol. So it's a spray-dried dispersion of etravirine in HPMC. It's a highly variable product, and bioequivalence is difficult to achieve even with the same technology. A little more detail, specifically, it's a 25% drug load SDD. The feed solution, the thing to point out here is it's a relatively low solids load. You're spray drying, per this patent example, 600 kilos of solvent. A majority of that is chlorinated solvent to obtain less than 9 kilos equivalent of etravirine. So that's a problem, I think, in terms of the way we see green chemistry now and the ecological footprint. Like most spray dried products, it requires secondary drying, roller compaction. I've already mentioned that the drug product has highly variable performance, and obviously it's environmentally and economically very costly. So when we set out to work on etravirine, we were slapped in the face with some real challenges. It's a high melting temperature compound, 272. That's not unusual for us. As I showed in the diagram, we're used to working on a lot of high melting compounds, but the molecule degrades at melt. It degrades before melt, actually, I think. So the challenge would be, can we render this thing amorphous by kinetisol and quench it fast enough before there was any degradation? It's a BCS4 molecule, so that presented some challenges as well in terms of trying to match intolerance from a bioequivalence perspective. It's not just a matter of dissolution rates and solubility. It's about presenting it at the right place in the GI tract. And we're working with this high melt compound, we're working with a minimally thermoplastic polymer in HPMC. So not a lot of, it's not helping us out in terms of viscosity and polymer dissolution. And beyond all this, duplicating an amorphous solid dispersion made by a solvent process with a thermal process. It's like very dissimilar technologies trying to establish a bioequivalent product. It's a big challenge, but we were able to do it. Here's an example of the processing profile, pretty typical kinetisol profile, as I mentioned before. In less than 10 seconds and at a temperature about 100 degrees below the melting temperature of etravirine, we were able to generate a single phase amorphous dispersion, matching the composition of the spray-dried dispersion. But I've laid out all the challenges from a biopharmaceutical perspective in trying to match the clinical performance of intolerance. And I'm gonna pad your stats here and give Dave K a lot of credit for the microflux. He came down, he trained, my whole team has been trained by Dave on the use of the flux system, and the flux was really the critical tool. It was what provided the in vitro in vivo correlation that allowed us to be successful in the fasted state. So we leveraged that tool along with dog modeling and GastroPlus, and went through various iterations and ultimately arrived at this slide, which is the punchline. So we were able to develop the product. In our pilot studies, we were able to show bioequivalence to intolerance despite the high variability of the comparator product. We made an IR tablet through direct compression. As I'll talk about later, Kinetisol eliminates the need for roller compaction, secondary drying, et cetera. It's very straightforward direct compression. And we were able to scale this up to registration scale, as represented by this diagram here, which was our PAT tool. Justin will talk about this more in his presentation. So I'll just say this is the pictorial representation of registration scale Kinetisol, and Justin's going to talk more about the details. So that was a big success. We were able to show that Kinetisol is a viable substitute for commercial spray drying for etravirine. Now on to case study 2, and this is the subject of some fairly recent research, so we blinded it for now. We'll make it public soon. But the commercial product contains the API in HPMCAS, once again in a 1:3 ratio. Similarly, the feed solution to spray drying contains quite a bit of chlorinated solvent and ethanol and a fairly low solids load. So it's very costly in terms of spray drying and a lot of drying time, a lot of solvent waste to obtain relatively little amounts of API equivalent. And once again, a much more complicated downstream processing approach to achieve a tablet. So we were able to take this molecule, actually create a range of amorphous drug loads. So it works very well with Kinetisol. We were able to establish a range between 20 and 40% of single phase amorphous solid dispersions with absolutely no process degradation. In fact, we purified the API a little bit here as our process related impurities are negative. And then in terms of looking at optimization of drug load, we DISO screen, 2-stage DISO, looking at our various drug loads relative to the spray dried dispersion, and identified that at 25% we were slightly better than the spray dried equivalent, but that appears to be the optimum drug load for this product. This is the one where Danny was saying he didn't want to use the TEM2, but I think we need to understand speciation a bit more here, and we'll talk to you, Dave, about that. So we took this optimized ASD intermediate and took it through our standard tablet manufacturing process, where out of the compounder comes our larger cookie. So you've got all on your tables there example of the discharge from the formulator. So this is what they look the same on the manufacturing scale with a larger diameter. And you take those through a milling process, and most of the time it doesn't make blue granules, but in this case they were blue. Then you blend them with external excipients and run them through your tablet press to arrive at your tablets. I think what's important to point out here is that we were able to arrive at tablets with acceptable tensile strength and disintegration dissolution performance with 85% of the amorphous dispersion in the final tablet, which will become important later in the presentation. But we're able to, this is key for this product because at the high dose, there's a pretty significant pill burden. The high dose product is very large and difficult to swallow. And for this particular patient population, dysphagia is an issue. So whatever we can do to reduce the pill burden is important. And by maximizing ASD load in the tablet, we're able to significantly reduce tablet size. So once again, using our Pion tools, we're able to show with pH change DISO that by developing a tablet, we didn't alter the dissolution profile of the ASD intermediate, and then running flux between the Kinetisol intermediate and the spray dried dispersion, we showed very similar flux profile from our tablet. And then finally, this all culminated in an animal PK study. In this case, we did a rodent PK where we took the commercial tablet and pulverized it into a powder and dosed that against the equivalent of our Kinetisol tablet. And what you see sort of qualitatively, well, if you could see it, the PK profiles lay virtually on top of each other. And since that doesn't look so clear, you can look at this F%. We're about 96% of the commercial tablet. So there are some next steps involved here in further establishing this, but I think we're off to a good start in terms of establishing there's a high probability of success that we will be able to duplicate this commercial spray dried product with Kinetisol. So what I've shown here is 2 case studies where we show Kinetisol to be substitutable for commercial spray drying, and the implications are we would eliminate tons of chlorinated solvent and waste solvent annually. The technology obviously has a much smaller physical footprint. You've seen that our manufacturing compounders that you'll see tomorrow have outputs that rival PSD4s, maybe even larger, in a system that's on wheels and could be rolled into any existing GMP suite. You can operate multiple in parallel, so you don't have to build an entire plant around a Kinetisol manufacturing line. It works in existing GMP facilities, and obviously the ecological footprint, a lot less energy usage, no solvent usage. And also in terms of capacity constraints, I think that's one of the biggest problems that we see from the clients that approach us. They're in phase one or even later with spray dried dispersion, looking ahead and trying to figure out where they're going to manufacture their commercial product given the capacity constraints for spray drying. So that doesn't exist with Kinetisol. We make the machines, happy to make them for you, put them wherever you want. And you don't have to, there's no major CapEx risk. If you wanted to build your own spray drying plant, you're in hundreds of millions of dollars until your phase 3 fails. Like with as was the Teleprovir story. That risk doesn't exist with Kinetisol. So, and I think by now I've shown it's a simpler, more efficient process. And with some of the benefits of the form in terms of maximizing drug load in the formulation and maximizing ASD load in the tablet, there's significant potential to reduce pill burden. So now I'm just been talking about making equivalent products to spray drying, where the goal is to be bioequivalent. But now I want to talk about the case studies that we've seen in collaboration with our big pharma partners, where we've shown superior biopharmaceutical performance and understanding why particle properties are critical. So early on in our history, we had a fairly extensive collaboration with Boehringer Ingelheim in Connecticut. And they originally came to us with the issue illustrated on the left. They were using SDDs in preclinical studies, and they were having issues with respect to suspendability and gavageability of spray-dried dispersions, batch-to-batch variability. The dose in their tox studies was being limited by what could be administered from suspension with an SDD. And as they got into chronic tox studies and the demands for drug product approach the 100 kilo scale, they were having issues with supply chain and budget. So they came to us with some very practical needs to ideally provide an intermediate that was more suspendable and gavageable, and to be able to manufacture at large scale to meet their timelines and their budget. And so the panel on the right is there to illustrate that we were able to tick all of those boxes. The Kinetisol intermediate typically has a bulk density between 0.5 and 0.6, which tends to be much better in terms of suspension and gavage dosing. We were able to manufacture the material a few batches for them at a fairly large scale and deliver it ahead of schedule. And I'm guessing it with a little lower cost than what they were being quoted from spray drying companies. But the surprise result of all of this, we were just asked to solve some practical problems. The surprise was when they took our Kinetisol formulation, which was quantitatively identical to the spray dry dispersion. When they dosed it at the maximum dose that they were able to administer from spray drying, they got a 4-fold increase in exposure. Obviously, there was some error in dosing or in the study, so they dosed it two more times and got the same result. So in triplicate, they got a result that demonstrated that the same formulation produced by Kinetisol provided 4-fold increase in exposure over spray drying. And more than that, they were able to escalate the dose well above the maximum dose they were able to administer from spray drying. And as this was presented in 2017 by Keith Horspool, who was VP at Boehringer Ingelheim at the time, and he presented several case studies. This was one of the first ones, but he said this was important to the company because this allowed them to identify tox issues that wouldn't have been otherwise identified, and they killed the drug. And he estimated saved the company about $10 million. Avoiding clinical failure. So similarly, we just did we came off a study recently led by our own Urvi Gala, where with Eli Lilly, they were facing similar issues. They were in preclinical studies. They were headed into a chronic tox study for a phase 2 drug, and the preclinical safety team they were faced with a problem that they weren't getting the exposures high enough. They weren't meeting the safety threshold with the spray dried dispersion, and the formulators were shrugging their shoulders about, what more do you want us to do? We've got a spray dried dispersion. There's not much more we can do here. Fortunately, Rob and I swooped into Indianapolis we flew in with our capes on and showed them that Boehringer-Ingelheim graph, and they said, if that's real, we really need you to help us out here. So we did, and we did. So we did the same thing, basically, effectively duplicating the spray dried dispersion formulation. They went into their tox study, and unfortunately they didn't see a 4-fold increase. They saw a 6-fold increase with the kinetosol dispersion, and obviously very satisfied with that result. And once again, there was some concern, though, that our drug loading was slightly lower than the STD, and we had a different vehicle. So they're in the process of repeating this PK study. So I'm really looking forward to seeing the 6-fold increase twice, much like Boehringer-Ingelheim dosed it in triplicate. I think we'll see the same result again. Anyway, so we're starting to see a trend here. Here's another case study that Keith presented back in 2017. This time we've got some in vitro data to accompany the PK data. And what we notice here when comparing the kinetosol process material, that's this, I don't know if you can see it, this green line, versus the spray dried dispersion. So both versions of the spray dried dispersion show, even though it's an enteric polymer, it's all HPMCAS based, right? It should be protected from acid release. There's significant release of the drug in the acid phase. Whereas with kinetosol, you see almost no release in acid. And then as you transition into the neutral phase, this version of the spray dried dispersion begins to precipitate almost immediately, while this one shows some spring and then followed by fairly rapid precipitation. The kinetosol formulation springs into solution. There is obviously a parachute effect, doesn't quite hit that spring and plateau that Dana was talking about earlier, but begins to precipitate. So you start to see the in vitro differences that start to lead you down the path of a hypothesis as to why kinetosol is routinely outperforming spray dried dispersions. So sure enough, this translated into a canine PK study where, once again, we saw with different particle size versions of the kinetosol material significant increases in exposure relative to the spray dried dispersion. Dana mentioned that there are some instances where the recrystallized spray dried dispersion performs worse than the physical mixture, and this is one of those. The dispersion actually precipitated out from suspension and in the gastric environment so catastrophically that I think either the particle size increase or you've got aggregates that are even more slow to dissolve than the dispersed physical mixture. So we started to form a hypothesis at this point that it's got to be something to do with the surface area or the density of the particles, that it's this protection in the acid phase that protects the payload, the amorphous payload, for release in the intestinal tract. Whereas with spray drying, the higher surface area particles, the drug's able to diffuse out of the enteric matrix before the polymer is soluble. So you've released your spring without deploying your parachute. But in the case of kinetosol, your parachute is preserved until the spring releases in the neutral phase, and then you deploy them simultaneously. So to use the verbiage from the Taylor group these days, kinetosol particles promote congruent drug polymer release, whereas in these cases, the spray dried particles seem to be promoting incongruent drug polymer release. So we, in collaboration with our good friends at the University of Texas and some buddies of ours at Merck, did a study to really sort of examine this effect in depth using BI's 639-667 compound, the same compound in this study, and just some basic properties of this molecule just to show it's a real compound. It was in development at BI at one time. So the methodology for this study was to produce the same formulation by kinetosol and spray drying, and then do in-depth characterization at the molecular level and at the particulate level, and then look at performance both in vitro and in vivo. So first, looking at the molecular level, obviously first stop, X-ray, they're both fully amorphous per XRD. Looking at FTIR, we saw no differences between drug polymer interaction. And the young Chow at Merck was very kind and did some very in-depth solid state NMR analysis that I'll be honest, I don't understand. So don't ask me a lot of questions. I can just say that he says between 1D and 2D solid state NMR, the samples are molecularly similar. And then when looking at miscibility, I know enough to say T1 and T1 row, those parameters are similar, which means that in both cases, the drug and polymer are completely miscible in this case to a domain size of about 32 nanometers. So based on the solid state NMR analysis, XRD, FTIR, at the molecular level, there appears to be no difference between spray drying and kinetisol. So there's no, at least per these analytical techniques, there doesn't appear to be a difference in how the drug is distributed in the matrix. But when we start to look at the particulate properties, you start to see divergence. With spray drying, you see much finer particle size, as you might expect, and a very high specific surface area that's about an order of magnitude greater than the kinetisol particles. Even when we go to the extreme of cryomilling the kinetisol material to reduce the particle size to a minimum, we're still only about half the specific surface area of spray drying. And we also wanted to examine the effects of how do you tune particle size for spray drying? Well, it's through compression. So we sort of simulated high and low pressure compression, and you see the specific surface area doesn't really change very much. And likewise, kinetisol particles can be tuned through the milling process and optimizing your milling parameters to achieve different particle size ranges. And within the typical range of particle size, we don't see the specific surface area change too much. So it's just inherent to the particles themselves. Kinetisol inherently has a low specific surface area. Spray drying has a very high specific surface area. I don't think this all fits with intuition. We added another layer to the story recently. We just published a paper with our collaboration with UT, looking at galeterone, and Stephen Thompson did this research, and he looked at surface energy analysis by inverse gas chromatography for kinetisol dispersions in HPMCS-H with galeterone versus the spray dried equivalent. And what was interesting about this study was that, as you can see between the left and right panels, the surface energy of the kinetisol particles, particularly acid-base surface energy, is substantially lower than the spray-dried particles. And I think this is really interesting and something that we're just starting to think about. As you form a particle from a solvent-based system, there are interactions with the polymer and the solvent. As the solvent is being evaporated and the particle is starting to form and evolve, you can expect that perhaps there is some change, some specific orientation of the polymer, where polar groups of the polymer might find their way towards the outside of the particle, whereas with a kinetisol particle formation, where it's sort of just a random mix of drug and polymer, those polar groups don't orient in a specific way. So that may explain this lower surface energy. It could just be a function of surface area as well. I don't know. Nonetheless, the couple specific surface area with this increase in surface energy, and you can start to understand why we saw what we saw previously, that particularly in the case of enteric dispersions, these particles are promoting, the spray dried particles let me say it in the reverse way, because I like that better. Kinetisol particles promote congruent drug polymer release. They prevent drug release prior to the dissolution of the polymer. And I think when I was in graduate school studying amorphous solid dispersions, the idea was that you take an insoluble drug and you impregnate it with a polymer to where the drug's solubility and dissolution characteristics no longer look like the drug, they mirror that of the polymer. So by kinetisol, we're holding true to that fundamental property of ASDs, where we want the drug's release to mirror that of the polymer. And with spray drying, you can see these differences that are driven by surface area and surface energy. So to carry the galeterone, just as a last case study, this is the graphical abstract from the paper. So I like it because in one slide, it just summarizes the whole thing. So we took galeterone, we made a kinetisol dispersion in HPMCAS, we made the equivalent spray dried dispersion. You've seen these graphs. This equates to, once again, in vitro release, where the kinetisol material prevents acid phase release and promotes intestinal phase free drug. And once again, the punchline, as always, we do an oral bioavailability study and show superiority of the kinetisol material relative to the spray dried dispersion. Because this is a propaganda presentation, as I said at the beginning, right? That's the disclaimer. Is this always the case? No, I think it's a majority of the case. It's particularly important when you've got drugs with rapid crystallization or precipitation kinetics, where the protective effect of the polymer is critical. If you've got a drug that can spring into solution and stay there on its own, they're rare, but they exist. We've seen a few of them recently. I think this is less apparent. and spray drying works as well as anything else. But for a majority of compounds that we see, the crystallization kinetics, precipitation kinetics are quite rapid, and polymer protection of the amorphous payload is key. And so I think this is a real effect for most compounds, that kinetisol would outperform spray drying. So just a brief snapshot. I thought, it's nice to see sort of a graphical summary of where kinetisol went head-to-head against solvent processing and showed bioavailability enhancement. So these are public examples that we can share. There are others, but I without going into detail, I think there are multiple examples that we've put out in the public domain. With the BI compounds, the Lilly, galeterone, our work with Zelboraf was particularly satisfying for me, coming from Roche. But to show that time and again, we show significant performance enhancement over spray drying, and it's rare that we're inferior. And if we are inferior, oftentimes it comes down to modifying the particle properties side, producing finer particles through modifying our milling process. Okay, so I think I've beat you all over the head with all of these points, so I don't need to summarize, but basically it's just saying that molecularly, kinetisol material and spray dry dispersions tend to have the same properties, but the particles are quite different. And I would argue for in the most cases, a lower specific surface area and surface energy promotes better performance. And there's the line of honesty written there. For compounds with rapid precipitation kinetics, KSDs tend to outperform STDs. My final segment in why kinetisol is the greatest thing since sliced bread is to compare kinetisol to spray drying in terms of downstream processing, specifically tablet formation, because I don't think it's trivial that kinetisol dramatically reduces the process flow and going from amorphous dispersion to final tablet. So spray drying is a series of typically 7 steps, starting with spray drying, secondary drying, addition of external excipients, which is a dilution step that I just sort of picked a midpoint. I think 25% external excipients at the roller compaction phase might be a nice midpoint. Could be less, could be more. Then coming out of roller compaction, you've got a sizing step, followed by additional dilution, adding external phase excipients headed into tablet compression. So I think from what we've seen with spray dry comparators that we've gone head to head with, tablets, as of midpoint, contain about 50% of the spray dry dispersion. Whereas with kinetisol, we've eliminated 3 of these steps. There's no need for secondary drying, blending, and roller compaction prior to tableting. We come out of kinetisol, go into a hammer milling step, a milling sizing step, and then adding the external phase excipients. Typically, 25% is all that's necessary to achieve a tablet with acceptable tensile strength and disintegration properties. So the final tablet, in many cases with kinetisol, has about 75% ASD load, which can be, as I pointed out in some of the first examples, really critical in terms of reducing pill burden. And how are we able to achieve tablets with 75% ASD load? And in this case, the particles aren't blue. They came out of the mill orange, but that's not why they're compressible. The reason they're compressible, if you look at it, it's granules from a milling process. So under SEM, it doesn't look that much different than melt extruded granules coming out of a milling process. But if you look closely, there are pores in these granules throughout. And these pores are generated during the quenching operation where there's air entrapment. As you'll see tomorrow, when the material exits the compounder, it's got the consistency of Play-Doh, and then it's rapidly quenched through a compression operation to bring it down to close to room temperature. And in that quenching operation, some of the air is retained. And those pores are points for plastic deformation and brittle fracture. So that is what allows kinetisol material to be significantly more compressible than similar thermally processed materials. So we have good compressibility with the kinetisol granules, even without a lot of external phase excipients. So this is what allows us to, with minimal dilution, arrive at really acceptable tablets. Some examples of this are KDFX tablet. This is one of our most advanced products, phase 3 ready asset. It's a high melter, but we were able to create a 50% drug load dispersion by utilizing a combination of polymers, Odrigidel 155 and copovidone, that have different functions within the ASD, both critical to manufacturability and performance. And then MagSterate, which also serves as a processing aid, but we serendipitously discovered it's a bioavailability enhancement, bioavailability enhancing excipient in this formulation. So we were able to get 50% drug load in the ASD, and then this ASD produced a viable tablet with what do we have, 80% of the ASD in the final tablet. So we have a 360 milligram dose in a tablet that weighs 900 milligram total weight. So that's a pretty significant payload for an ASD product. And it was absolutely critical for KDFX, deferrosirox, because it's indicated for iron overload, and the doses go as high as 40 mg per kg. So pill burden is a significant issue for this therapy. Anything less than this dose wouldn't have been a viable product. So when the demand is for a high dose drug to reduce pill burden for an indication like this, we can meet the demand through Kinetosol. And this is just a table showing that we had good tensile strength and good disintegration. Similarly, we've done a lot of work with ritonavir internally, and did some collaboration with AbbVie as well. And the driving force here is that, most of you know, ritonavir isn't used as a therapeutic agent itself. It's used as a PK booster in a lot of cocktails for HIV and other viral treatments. So the commercial Norvir tablet is melt extruded. I think the drug load is about 15%. I think it's about a gram tablet for the 100 milligram dose. So we aim to do the same here, increase the drug load in the amorphous intermediate, then increase the amorphous dispersion load in the tablet, so that you can make something more amenable to fixed dose combinations or co-administration of ritonavir with other antivirals. So we were able to generate a 33% drug load Kinetosol intermediate with equivalent performance to Norvir by pivoting polymers. So the commercial product is in copovidone, which isn't a great parachute for ritonavir. We were able to pivot over to HPMCAS, and what enabled that, ritonavir and HPMCAS are incompatible. Ritonavir is sensitive to acid catalyzed hydrolysis, but the cycle times of Kinetosol being so short, it prevents degradation due to HPMCAS exposure just by virtue of the short processing time. And then we were able to incorporate 75% of that dispersion in the tablet. So we fit a 100 milligram dose into a tablet that weighs less than 450 milligram. So this was a good example of how a case where a compound used in combination with several other products, pill burden's an issue, and we were able to pull two different levers in terms of drug load in the ASD and drug load and ASD load in the tablet to arrive at reduced pill burden. Oh, you can't see this at all. Oh, well. My buddy, where's my good friend, and he's not in the room, Jim D'Annunzio, he presented this graph that you can't see back in Denver in 2017, and he pointed out the issue with amorphous solid dispersions in terms of tableting, and that, the comfort zone in industry for drug load was, he drew a line at about 40%, and then the comfort zone in terms of tableting for an ASD was about 60% ASD in a final tablet. So this was sort of the boundary layers for ASD products that were limiting the dose that you could achieve per tablet. And so the part of this that you can't see is with Kinetosol and our ability to utilize a combination of polymers and other excipients, we can often achieve higher drug loads with similar performance. So I kind of, based on deferrosirox and some other examples, like I put our boundary layer at about 50%. And then based on our number of case studies that show we can get acceptable tablets as high as 85% ASD load in the tablet. So the Kinetosol enabled zone for a typical tablet extends out beyond the typical where the industry is the industry's comfort zone based on melt extrusion and spray drying. So this is my last slide. So I think hopefully by now I've satisfied myself that Kinetosol is a simpler, more effective manufacturing technology than spray drying. Can I say it again? It's a much smaller physical and ecological footprint. There's two case studies where we showed where we think we're directly substitutable for commercial spray drying and can result in a bioequivalent product. And then for NCEs, we have the potential to provide much better performance than spray drying when we, just by virtue of different particle properties, but also by opening up a formulation toolbox that the other technologies don't have access to, we can arrive at an optimized ASD composition. And then the easy part, simpler downstream processing, that's obvious. And then we're able to achieve higher ASD load per tablet. And this is the breakdown of the assets we're working on currently. And as I said, about 3/4 of what we're working on is kinetisol, is conversions from SDD. So when I said in the beginning that kinetisol will disrupt spray drying, I think this is the evidence. The industry is looking for a better alternative to all of these problems, to deal with all the problems I mentioned, and it appears that kinetisol is well positioned to be that alternative. And this is just the beginning. In the future, I suspect we'll put a significant dent in the spray drying market. Dave talked about stats, so here's my stats. And a lot of us in this room, we've been publishing papers on kinetisol since 2009. Jim, who left the room, this probably makes him nauseous to hear it again. He published the first paper in 2009. Stephen's Galetterone paper was the latest in 2023. So we're beyond 30 peer-reviewed articles on the technology, and we're still learning about the technology. There's still tricks that we're working on and things that we don't know. And actually, now that the business model is such that we're trying to put the machines in the hands of other scientists, I think we stand to learn a lot more as we deploy the technology and put it in labs and let some of you big pharma scientists play around with the tool. And then so finally, just I get to present all this kinetisol stuff all the time, and and I'm the face of it. But honestly, it's contributions from my team at AustinPx, and we have an amazing scientific team and an amazing leadership team and amazing financial backers, and it's a proud moment to stand up here in front of you all and present what we've been working on over the last 12 years and in a venue like this. I can't imagine you have any questions after that, but if you do, I'll answer them.
Thanks, Dave. Yeah, a quick question. What's the sensitivity of kinetisol, generally speaking, to API particle size?
I would say in general, it's kind of insensitive to particle size. I think we designed the process parameters are developed according to the state of the drug substance as it's provided to us. I think the particle size distribution, the morphology is something that we track through development. Should there be any significant changes in particle size distribution or morphology, there'll be some tuning of the process required. That typically doesn't happen though, unless we start real early, like getting compound just fresh out of discovery. There will be some changes along the way. But by the time you get into clinical, it's been our experience that the drug substance properties are fairly consistent and the process doesn't change. But we've got the levers to tune should that happen. But it's generally insensitive. There's no upfront filtering of particle size or anything of that. Like we take the drug substance as it's supplied. Yeah.
I was just wondering, do you have a recommended drug substance quantity that is requested for the initial screen or the screening process using kinetisol?
Recommended? I'd recommend 1 kilo up front. Do whatever we want. Well, so we've been making a lot of strides. Well, so first of all, I want to say that when we started out, all we had was the manufacturing scale equipment. So the requirements for API were more in the hundreds of grams, and then Chris designed and built the formulator, and that changed the game for us completely. And since then, we've been taking that formulator and working on some different methodologies to further reduce the amount of API that we need to establish feasibility for kinetisol, and then allow us to do some polymer screens. So my team and led by Danny Davis developed a low drug load screening process where we can establish feasibility with the process in general, and then screen all the polymer chemistries with about 2 grams of API. And we just finished a project recently with a PROTAC compound where all they had was 3 grams, and we were able to do that screening and deliver a prototype ASD with just 3 grams. And
that's great information because it's a constant struggle in terms of what phase are you in, how much material do you have to spare. And I know on the analytical side, one of the reasons why we pushed the X-ray diffraction method of testing was because it was indestructible.
Yeah.
So again,
right,
same thing.
Testing. Well, for us, it was, you want to capture all the opportunities, and I think that upper left quadrant on that diagram, those brick dust compounds, we think when you're in that situation coming out of discovery where you've got a molecule that's ultra high melt and insoluble in everything, at an early stage, you're having trouble solubilizing the molecule to even get sort of readouts in a petri dish or early preclinical models. So there's a need for kinetisol at a very early stage. So we wanted to try to capture those opportunities. When companies would come to us and say, the world supply of this API is 2 grams, what can you do? For a while, we were saying, well, come back when you've got 50 grams. But we've made strides to capture those opportunities, and we've been successful at doing that recently.
Great presentation.
Thank you.
I really liked your slide with the 4 quadrants. It seems like it could be a solution for a wide range of compounds.
Yep.
I was wondering if there are any physicochemical properties or properties of a compound where you look at it and say maybe this wouldn't work.
Yeah, that's a common question we get asked, and the answer is no. I think in the early days, in the very early days when we were focused on enablement, we would look for high melt point, poor organic solvent solubility, as those were the opportunities that we wanted to utilize our bandwidth on, because it's not a situation where we could spend a lot of time developing a kinetisol formulation and a company could just take that formulation and go make it by a different technology. So initially we kind of screened opportunities that way, but now as we see the advantages with respect to spray drying that I've laid out here and to some extent melt extrusion, there's really nothing up front that, thermal degradation, thermal instability of the amorphous form in the presence of certain polymers is something that we need to understand. But there's not a good surrogate for that. I mean, even, doing thermal analysis, DSC with physical mixtures, heat stressing, rotovap samples, for example, don't really simulate kinetisol because the time scales are so much different. We're talking about 5 to 10 seconds. So this is why the low drug load approach has been so helpful, is that we can establish, like I said, compatibility of the drug with the process in general, and then its compatibility with all types of polymer chemistries really quickly as like a pre-formulation step prior to getting into consuming lots of API and heading down, the development path. We just conduct this as a pre-formulation step, and we've had to in some cases, especially in early discovery where the APIs are less robust, you run this low drug load feasibility screen and you find out the drug cannot tolerate any exposure to heat in its amorphous form, and then we can quickly eliminate those compounds from consideration. So the answer is no, but we have a tool now that gets us to the data we need to screen out a candidate quickly.
Great presentation.
Thank you.
So like you mentioned, a lot of the drugs that you're using are rapid precipitators. So is there an influence on the processing of spray drying versus kinetisol on the precipitation kinetics that you're seeing?
Yeah, I think that's what we've shown with a lot of with the in vitro studies of kinetisol versus spray drying, is that it's the key is congruent drug polymer release to delay precipitation, delay nucleation and crystal growth by maintaining the amorphous drug in close proximity to the polymer throughout release. And I think that's where you see the impact. And also, it comes down to polymer selection as well too. The drug will have different affinities for different polymers in an aqueous environment, and in some cases, combinations of materials help in term. So there's also a formulation component too, where you're constrained to some extent by common organic solvent solubility. The polymer, the excipient system has to be commonly soluble with the drug. For spray drying, we don't have that constraint. We can mix anything into a single phase system using kinetisol typically. And that's been effective for really difficult molecules that are really poorly soluble and precipitate really quickly. The ability to formulate creatively to find that synergy of excipients has been very helpful in some stubborn cases. But in general, particle morphology tends to help.
There's an interesting thing coming up a little bit about this is like, the ESG, we talked about the environmental sustainability of solvents. And I came a little bit back to the conversation about Tim with the other Dave Kay. And I thought one thing about Clayton Christensen's book, The Innovator's Dilemma, he says, you also have to kind of sometimes think about the disruption of the business model as well. That you can come up with a technology, but how do you get people to adapt it in the industry? You can see with Tim, for example, they say, well, we're going to, not supply the equipment anymore. We're going to do the service. You see solubility, it's complicated enough, so it's also a service model. At Excellience, we took a piece of equipment and we provided the service to it, so that customers could choose when they wanted to buy the equipment, or they could have the service. And in the last year, that's what Austin has been doing too. Is that it's easy enough that you can, buy the equipment, or you can have the service. So I think that there's interesting that you have to have disruption in order to have adaptation by the industry. You have to also change the model too. I think there's also another lesson for me on that one was also the business study from Boehringer Ingelheim, that it was rated as a success that they were able to kill the drug and save $10 million. And sometimes we think, well, the success is when we get a drug out and approved, but with the IRA happening, and we all know what that is, right? The IRA, it's a threat and a difficulty for our industry, and companies are trying to decide how they adapt to that. Just read a report this morning that it's a little bit that companies could choose to say, well, they'll go to those compounds that are protected away from the IRA. And that's odd too, so meaning that you're going to be choosing as a company to do things that are not best for the public sometimes. We have a responsibility as people here in this room to try to reduce costs, to try to find ways, and this is definitely a cost. If it had gone forward, that $10 million would have taken away from a budget in Boehringer Ingelheim to produce another drug. So it's a little bit about responsibilities. I think we feel good about doing pharmaceuticals, we're bettering human society, but we also have to look at the solvent use, the ESG, animal work that in this case Europe seems to be ahead of us on, and then also ways to improve the innovation. And obviously that's happening a lot here at Austin. All right, so we picked a really good presentation coming up, and we've just had a very high carb lunch. And the next one is going to be great because it's a lot of movies. So it's really animated. I had a chance to look at it last night, and I think you're going to enjoy it. And we're going to talk we're going to talk now about more characterization of ASDs. It's not just particle size. It's also about the porosity, surface areas, and the particle wall thickness. So I think that's new for me too. And these microstructural elements are not only affecting the manufacturability of the dispersion, but also the characteristics of the final dosage form. So I really hope the animation works with the new projector that the team here has pulled up together here, and not gotten worse with the new variable. So through real-world industry case studies, we'll be able to get insights into how the in-depth microstructure characterization can help us in our manufacturing decisions. So I'd like us to welcome Josh Lomeo. He's the Director of Application Science at DigiM Solutions. He's a proud alumnus of the University of Rochester, and he joined DigiM in 2019, I believe. Big advocate, obviously, for microstructure analysis across various pharmaceutical assets. In his current capacity, he collaborates with scientists offering solutions that span the formulation, manufacturing, and quality assessment of drug products. Let's give a warm welcome to Josh Lomeo.
All right, so today I'm going to talk a little bit about the role of microstructures in processing scale-up and performance of ASDs. And this is really around the lens of imaging and understanding the structures of our drug intermediates as well as the final product. I want to start off taking a look at a single particle. So this is one rendering of a single spray-dried particle from an X-ray microscopy scan. It may seem pretty simple, but really there's a lot going on here. I'm going to go ahead and play this movie, and as we spin the particle around, we're actually going to slice through it and see what the interior structure looks like. So this is where we start to reveal that it's not as simple as it seems, and there's actually a lot of different structural interfaces to think about. Really, this particle is carrying information about a history of the manufacturing conditions, whether that's how we're making the ASD, the different process parameters within that manufacturing technique, as well as the solvents and excipients used. We can also think about the future of the particle, and ultimately the different attributes of this particle are going to determine porosity within the final dose form if it's being processed further, disintegration, dissolution, mechanical properties, as well as even potentially stability. Particle size distribution is just a small piece of this story how do we quantify the other attributes and determine their relative importance for the processing and development of our amorphous dispersion? So some example attributes of interest as we look at this 3D rendering, things purely around the geometry, of course, the particle size, the sphericity, aspect ratios. We also have this thin particle wall in the case of spray dried particles. We frequently see this. Added to that, we have an external and internal surface area that's going to be available and interacting with other materials as we compact and granulate. And then there's also an internal void space, the volume and the size of these internal void spaces, as well as any other types of porosity we might see in this system. So how do we go about characterizing these and quantifying them? So I'm going to go through a little bit of a methodology review on how we're visualizing and actually quantifying these microstructures. So one of our go-to techniques at DigiM is X-ray microscopy. This is in the world of computed tomography, very similar to a CAT scan, except here we're actually scanning the sample instead of a person. So the sample sits on a rotational stage, and as we rotate, we're collecting projections at each position along the sample. Now that's traditional micro CT. The technique we like to use is X-ray microscopy. So this is has an advantage over traditional micro CT with local tomography at a distance and an order of magnitude increase in resolution going as high as 0.34 micron. So that's kind of what the setup looks like for X-ray microscopy. The major difference here being that with traditional micro CT, our beam is kind of fixed. We would have to cut the sample or move it closer to the source to get higher resolution. In X-ray microscopy, we can focus in on a local region within the vial and scan at very high resolution. So what does this data look like? So this is one scan of a spray dried particle powder bed, essentially in the vial. We're essentially slicing through first in the Z direction, but also in the X and the Y direction, where we can visualize hundreds to thousands of spray dried particles within the powder bed. X-ray microscopy isn't exclusive to powders. We can also look at the final dosage form. In the case of a tablet, looking at local tomography at resolutions as high as 0.34 micron to 2 micron. So here we get a really strong understanding of the interfaces of all of the ingredients, as well as their internal porosities. We can also scan entire tablets to look at representativeness and the overall distribution of ingredients across the tablet. This is a fun, relatable example. So this is inside a Claritin D12 pill, a rather intricate formulation where we have a tablet within a tablet, and also the exterior coating that has 2 of the active ingredients encapsulated. And then lastly, we can also look at triplicate or more scans to probe at larger batch uniformity and ensure that the results that we quantify from higher resolutions are representative across a wider number of samples. Another technique we use, and this is something we've really developed at DigiM as a approach of making better use of SEM and getting the internal structures. So this is a technique called mosaic SEM, where we are cross-sectioning the tablet and polishing with an argon milling. And then from there, we are collecting hundreds of images at nanometer resolution to get a really fine detailed view of the material interfaces. What this allows us to do, pausing here as an example, this will allow us to actually track the fate of spray dried particles, inactive ingredients, and really any form of amorphous solid dispersion to understand what's happening to the inherent porosity of that material in the final dosage form. That imaging is great, but what does that mean for us quantitatively and predictively in understanding our manufacturing? This is where we're bringing in our proprietary image analysis to actually classify the imaging data. So this is a more sophisticated example here where we have actually a pre-granulation blend with MCC, with API, and each of them have respective porosities. So the porosity granule is, the MCC granule is quite a bit more porous. The API has a little bit of pores, not as much. And then we also have the airspace between the particles. The reason I said that this is sophisticated is image processing wise, the airspace really has very similar grayscale contrast between the pores and the air between the particles. So we want to actually have a way to classify those so that we can go about quantifying them. Yeah, the variety of phases here, the different types of solid, the porosity within and between particles, and ultimately using that to understand surface area and compaction behavior. So the solution here is a series of steps with supervised machine learning and deep learning. These are approaches really using the AI to take the human user input and understand the morphology and grayscale differences that can then be applied to a larger set of imaging data. So what that classification looks like, this is an iterative process here where we'll actually train the AI on a single image or a small set of images. And then once we're happy with that training and the differentiation of each phase, so here we have different shades of green for different particle classes and different shades of red to indicate the different porosities. Once we have that classification and we're happy with it for a single image, we can then apply that to the entire 3D data set. From there, we can go about quantifying our attributes, in this case, the particle size distribution of the ingredients. Particle size distribution is one thing. There's a lot of other things that we can look at. So the amount and the size of the porosity and voids, the wall thickness, internal and external surface area, surface contact area, and surface area to volume ratios. So that's a pre-granulation blend, but we can also look at the final blend to see more specifically how these attributes are comparing between the pre-granulation blend and the final blend. Lastly here, we can apply essentially the same workflow to look at the structural interfaces within the tablet. So here we have some more attributes that we're looking at. So this is truly giving us the internal particle size distribution in the product in a way that when it comes to regulatory submissions can be important when that question comes up. So truly a non-invasive way to evaluate and quantify that particle size distribution. We can also quantify the spatial distribution of those ingredients as different relevant functions, functional directions along the tablet, whether that's the height or the diameter, and being able to associate that with our compaction parameters, our tooling. Coating thickness is another common attribute. We're still tracking that phase-specific porosity, so still being able to look at the MCC and the API and see their evolution. And lastly here, particle and pore connectivity, as well as transport properties. This is where we're actually taking the pixels in the image and essentially using them as computational cells to understand media transport. And that can be further tied into dissolution, disintegration, understanding, and even predictive aspects towards dissolution. So just to kind of wrap up this as a sort of mini case study, in this work with Genentech, looking at the pre-granulation blend, the final blend, and then the tablet, we're actually able to track particle attrition and porosity evolution across the entire manufacturing process. So that's our basic workflow. Now I'm going to take a look at some of the industrial case studies that we've published with clients on ASDs and what it has meant for those programs. So the first work here was with Merck, looking at spray-dried particle morphologies to improve process development. And the challenge here and the question is, how can we correlate these process parameters more specifically with particle morphology and compaction, especially with regards to the tablet mechanical strength. So just want to show this movie again so we have an idea of what this data looks like. In a typical spray-dried particle scan, we have bubble morphologies with the large internal voids. We have smaller particles as well that will be more shriveled and don't have those internal voids. And all in all, this is the kind of data that when we look at a more traditional technique like laser diffraction, we'll get our particle size, but we're not going to necessarily be able to understand all of these complex structural interfaces within the amorphous dispersion. And so that's really, where we're coming in and filling in that gap on being able to correlate the process parameters with product performance, in this case, tensile strength. So taking a look just as a visual assessment. So in this paper, we looked at a variety of outlet temperatures. Here I'm just showing 3 of them. So 40 degrees Celsius, 54 degrees, and then 62 degrees. And just visually, we can see quite an evolution as we increase our outlet temperature. As we increase, we tend to see a larger volume of the bubble hollow particles. And as we go towards 62 degrees, again, we're seeing more of them. And they're also getting to have larger and larger internal voids, as well as thinner walls. The wall on that particle in particular is, I want to say, almost on the border of XRM resolution. It's rather quite thin. So those are some of the visual trends we see. But of course, we want to go about actually quantifying them. So this is, again, where we're applying the deep learning workflow. And the really critical thing for spray-dried particles in this case is being able to differentiate the inside air from the air between particles. Without that differentiation, it's going to be very difficult and probably require manual work to go about quantifying the volume and the size of these internal voids. So once we have that classification, and we're also classifying those thin walls marked in yellow, we can compute all of our particle attributes of interest, essentially in a single go. What that data looks like. So when we're doing this quantification, all of the microstructure attributes we compute are going to be across the entire XRM scan. So we're calculating particle statistics for hundreds to thousands of particles, which are plotted here. This is really useful in that it allows us to look at both the particle size distribution as well as the wall thickness. And from here, we can actually start to piece out different particle populations with regards to morphology, with regards to the frequency of thicker walls versus thinner walls. All of this information can be then used to correlate downstream performance. Some of the other attributes that we can compute in this instance, the internal void volume and size, the ratio of bubble to raisin particles, as well as the internal and external surface area. Taking one of those attributes, in this case, the wall thickness, what does that mean for our product performance and behavior? And ultimately, the goal here is to correlate these computed attributes with tablet performance and make predictive usage for process development. So looking first at one trend here with regards to the wall thickness, we had seen this visually from the images, but just to quantitatively demonstrate, here we do have that direct correlation of lower to higher outlet temperature. As we increase our outlet temperature, we're going to have thinner and thinner particle walls. So this is something in the process space, once we have that correlation, that can help us understand future spray drying and what that'll mean for our particle morphologies and behaviors. The second correlation then is actually the particle wall thickness against the tablet tensile strength. So we see a nice trend here as well, where as we have thinner and thinner particles, we have ultimately higher tablet tensile strength. That is tying back to how readily compressible those particles with the thinner walls are, whereas particles with thicker walls, we may not always break those walls. The porosity within those spray-dried particles may be better preserved, and accordingly, that's going to affect our tablet tensile strength. This is really giving us a way to mechanistically understand compression trends for the tablets by quantifying these particle attributes and also going back to our process development. So case study 2 here with Eli Lilly. This is where we're looking at different tablet dissolution on the basis of different spray drying parameters. And what we were looking at here, 2 particle lots, equivalent composition. The only differences were in the drying rate as well as the outlet temperature. And each of these powders were blended, roller compacted, and tableted into respective tablets T1 and T2. From SEM imaging, as an initial glance, these particle batches look fairly similar. How different can dissolution be? And this is really where we were working with the Lilly team to understand and help them evaluate something where all of their previous analytics internally on these powders had shown relatively good equivalence, and the expectations around dissolution differences were not there necessarily. So what does that dissolution actually look like? We see quite a major difference here between T1 and T2. T1, we have almost immediate release by about 20 minutes, whereas T2, we have an incomplete and an extended release that is still running past an hour. So this is really where the structural data becomes important in evaluating these powders and mechanistically understanding why are these tablets so different. So taking a look at this data, one of the immediate things that stood out to us amongst the powder lots are the types of aggregation and interaction between particles. In sample P1, we do see some kind of static interactions between powders. In comparison to P2, we actually have a physical aggregation forming this honeycomb structure. These particles are highly fused together. They're almost sharing the same particle wall. And that was a major difference amongst these two powder lots. Now, of course, we want to take that quantitative and we look at our spray dried particle CQAs, the particle size as well as the wall thickness and the exterior surface area. We see some significant differences where we have thicker particle walls in the P2 batch, as well as comparing P1 and P2, we have more available exterior surface area in the P1 batch in comparison. And in part due to these honeycomb structures, it's really changing the dynamics of the what can be compacted from these powders. Now, we then used our similar workflow for the tablet. So at an initial glance, we do see that there is more porosity within tablet 2. That can be tied back to some of the particle properties mentioned, the preservation of pores and this honeycomb structure. But it's not just about the porosity, it's also about how those pores are connected and interacting. So this is something more on the kind of connection to the computational side of what do we expect for dissolution media intrusion and interaction with the tablet. So here we're actually quantifying the connectivity of pores that are connected to other pores. And this is a visualization for tablet 1 where when we look at the scan, we have a very nicely connected pore network. In comparison to tablet 2, we have these large regions of disconnected porosity that through their disconnection, that's actually going to change the dynamics of dissolution media intrusion and accordingly the dissolution differences we observed for these two. So tying that back and just looking at these two together, we see again that immediate release for tablet 1 with the pore network that is nice and highly well connected. Tablet 2, we have those disconnected regions of pores and ultimately that delayed release that we see. And so that tells us that, the difference in particle attributes were significant enough to change the internal tablet structures and accordingly the dissolution. As we saw with the Merck case study, right, this can even go to the mechanical properties as well. This also tells us that in the scope of this specific program, the outlet temperature and the drying flow rate, they are fairly critical process parameters to control. When we change them and we deviate even a little bit, we do see downstream how differently these powders can behave. Now, both of these case studies were more so on process changes, but we see with clients quite frequently that this workflow can help assess scale up, site changes, as well as vendor comparisons for the preparation of these amorphous solid dispersions. So it's really important to kind of consider these structural attributes and kind of navigate them and take a look at them and see what they would really look like. So case study 3, this is work with Genentech, looking at a more novel ASD preparation technique. And here we're assessing that technique as well as finding pathways to correlate surface area directly with dissolution. So this is another technique here called acoustic mixing to form this co-precipitated amorphous dispersion. I'll go ahead and play the movie here. Particle morphology wise, there's a lot going on here. They are have these really large honeycomb structures. We do have quite a number of smaller particles as well. So a lot of different things going on here in the structure of these powders that we want to go about quantifying. Repeating the same workflow here, we're actually going to go in and classify the different types of particles. So separating these porous solid from the non-porous solid, as well as differentiating the air and the intraparticle air. Once we, the important thing about this, I should mention, is that these porous structures are not necessarily going to be understood with traditional techniques. We might pick up on them, but we don't really know what they mean in a structural interface standpoint for these particles. So this is where imaging is really allowing us to come in and put quantitatively an association of the surface area to the types of porosity that we're seeing. So quantitative wise, we have, of course, the percentage of particle porosity, the pore size distribution, the external surface area for each solid phase, as well as the total solid volume. And then in the last column here, we have the external surface area to volume ratio, which really allows us to understand, how these materials are going to compact and process downstream. So in the scope of this paper with Genentech, we looked at both the acoustic mixed co-precipitate amorphous dispersion, as well as a more typical spray-dry dispersion. And from there, we also looked at their corresponding tablets to assess the fate of these particles, the ultimate porosity, as well as the types of mixing and interaction with the other ingredients that were added. So just a visual comparison here, we see our spray-dried particles in this instance are actually not porous. We have a fairly small particle size. In comparison to our acoustic mixed preparation here, we have that large honeycomb structure. And as we saw from the previous scan, that structure is fairly abundant. And from there, we can go about actually comparing the 3 samples that we studied. So we have the spray-dried dispersion, and then we have 2 mixing rates of the acoustically prepared amorphous dispersions. So this is important that it allows us to actually navigate and compare technique to technique, just how different things like the surface area to volume ratio are, the porosity. In one instance, we have no porosity. In the others, we have about 11%. So comparing technique to technique, as well as, of course, looking at process parameters and sensitivities within the same technique. So we did see one of the acoustic mixing techniques had quite a bit of lower porosity in comparison. And then we can also evaluate what that means for the surface area. So connecting all of that together, what does that mean for dissolution and performance of the product? This is where we're taking these imaging data of the tablets and actually computing transport properties directly on the porous phase. What this really means is that we're taking the network of porosity within the tablet and we're dynamically assessing how permeable the network is and actually reporting a permeability number in Darcy. Then allows us to actually correlate to dissolution directly these structural properties. So on the x-axis here, we have the tablet permeability that we measured computationally. and then on the y-axis, the percentage of dissolution at 60 minutes. So starting off with our clearest differentiator, we did see a much higher release from the tablet formulated from STDs. We can see actually with the tablet permeability that correlates decently. It has the highest permeability amongst the three formulations. The acoustically mixed prepared dispersions had a more subtle difference. At the onset, they are comparable, and then they start to diverge later on, and we start to see that separation. Despite that, that separation and the low the low difference with them, considering especially these high standard deviations, we're still able to pick up on and understand that there is a structural variation, and we do measure different permeabilities for each of these respective tablets. And so this is, in all really a way to begin looking at microstructural properties, correlate them to dissolution, disintegration, and is a way that we're, really looking to build in silico models to predict dissolution from this type of imaging data. And, as it stands today, these are transport properties that we can incorporate to existing dissolution disintegration models that you may have. So case study 4, looking at a different avenue of amorphous dispersions and assessing stability. So this is work with AbbVie, where we had a couple of tablets intentionally seeded with recrystallized API. The amount of those API, the recrystallized seeding, was held anonymous to us. We did not know how much there was in each tablet. So here we're actually probing to see what we can quantify from that X-ray data and understand how much recrystallization there is. So this is what a scan from that, a single slice from that scan looks like. We have the brightest domain, which is corresponding to the recrystallized API. We have a fairly bright domain, which is the amorphously dispersed API. And then we have the PV-PVA polymer on its own. Added to that, some porosity as well. And these contrast differences, especially with the amorphous dispersion and the PVA polymer on its own, they're fairly subtle, right? And this is really where we need to use the AI segmentation to differentiate them and classify them. Now, I want to mention in the context of some of Dana's earlier comments that this type of analysis can really be used across any type of imaging data. So in the realm of assessing crystallization trends with SEM, TEM, polarized light microscopy, this AI analysis can be applied to those images as well and really give us a more quantitative understanding of how much crystallization there is. The amount is important, and there may be other things important as well. So understanding the volume, the spatial distribution, as well as the size of those recrystallized domains, those can potentially be informative in terms of how any type of thermal evolution or humidity evolution is happening within the tablet. We have a way to understand that directionally within the final dose form or any intermediates. In addition to recrystallization, this can apply in a lot of other areas as well, looking at things like coating evolution, tablet cracks and mechanical failure, as well as ingredient interactions. When we're talking about things as sensitive as an ASD, this can actually be a pathway to understand what is going on with the dispersion and its surrounding ingredients within the tablet that allows us to actually have a quantitative and visual understanding on those stability changes. And so with that, I want to just go back to our spray dried particle and all of these attributes that we looked at. There's a lot going on here. It's more than particle size. And the question can come up, which of these attributes is more important for the performance and product quality? And to be honest, there isn't a really good answer for that. It's going to depend on a variety of contributing factors, the disintegration and dissolution mechanism, how we're processing these particles downstream, as well as relative material solubilities. But, this is very much the reason why we need to take a look at these microstructures and understand them, in the sense that once we start to quantify these attributes and we look at the history in terms of the manufacturing conditions and the future of this particle, the idea is that we can begin to deconvolute what are the most important attributes around our dispersion, whether it's a spray dried particle, whether it's hot melt extrudate or kinetisol. We can begin to understand which of these parameters is most important to quantify and have good control of for the downstream processing. We can also look at this historically back to our process and manufacturing space and identify which process parameters are most important to control and maintain, and which of these parameters are specifically affecting our microstructure CQAs that are important for downstream performance. Now, much of these case studies were around the manufacturing science and the process of ASDs, but there's a whole other workflow here and implications for formulation development as well. Being able to go in and look, visualize, and quantify our microstructures can be really important in guiding our formulation development as well. And with that, I'll open it up for questions.
Is your vision training is it based solely on the grayscale of the image, or is there anything else that you look at when you do that AI supervision? And also, are there any materials that aren't distinguishable?
Yeah, that's a good question. So grayscale predominantly, as well as morphology. In the space of pharmaceuticals and what we're looking at, right, most things are pretty organic. The key differentiator contrast-wise is either a density difference or an elemental composition difference. So there are ingredients that can be purely organic and we can still see that contrast differences. There are other instances where the materials are just too similar. Perhaps we don't have enough of say like a phase separation between the two where we may not pick up on that contrast difference.
What are the brief steps to training your AI?
To training?
Training, yeah. AI to help differentiate the different whatever chemicals or.
Yeah. I mean, really, it's just based on the human vision. So it's a single step where a user will actually go in and make traces on the image that this set of pixels has a certain grayscale contrast, has a certain look to it, and I recognize that it's a different phase than ingredient number over 2 that's darker. So it's a fairly simple process in training that. There are more sophisticated, in the case of deep learning, it's a more sophisticated setup where you may be doing a few machine learnings on several images to train on those more complicated features like the different types of air.
And then does that help you build a model or a library of different compounds? Or is there other variables that go into that?
In a sense, it does. We try not to contaminate client data with other models that have been built because really every system is different. But there are generalized kind of understanding and approaches to classifying certain types of systems. Spray dried particles, for example, our approach to classifying those will have a kind of a standard approach about how to train that deep learning segmentation.
Perhaps I may have missed this when you covered it, but what are the scales that we are talking about? Micro-sized particles, nano-sized particles?
Yeah, that's a good question. So really, we're a technology company, so we can support the analysis of any type of imaging data. We typically work across nanometer scale, in which we'll use SEM-based techniques. So that's down to 3 nanometer resolution. And then for the X-ray microscopy and micro CT techniques, that's down to about 0.5 micron resolution. And the smallest feature sizes that we can quantify within those typical rule of thumb is 3 to 4 pixels to have confidence that a feature is real. So if our resolution is half a micron, we'll be able to quantify features that are 2 micron and larger.
Since December, AustinPx has signed up 15 feasibility projects. So the premise of opening the door and see what comes in seems to be working. That's pretty good. But now, so I guess Dr. Miller, other people do agree with you too, that that this result Kinetisol has a place. But then what? Now we get into the next project, next speech on scale up. And we try to figure out what do we do when those feasibilities work out and they come back and want to do larger volumes. So Dr. Justin Keene, the Senior Vice President of Operations at AustinPx, will present that. So with real world applications and how the process changes, go to make sure we still have the highest quality drug product. Dr. Keene has over 2 decades of pharmaceutical product development. He's a graduate in chemical engineering from the University of Texas. He started his journey as a formulation scientist at DPT laboratories. So he's worked on products like Imodium AD, Tylenol Cold and Flu, Cool Burst. And then he spent some time over at PharmaForm, where he got into hot melt extrusion and developed projects there too. He's played a pivotal role in the early phase clinical manufacturing on Novofil delayed release tablets. He has a PhD in pharmaceutics. And with that, let's give a warm welcome to Dr. Keene.
All right, well, thank you. So, we get asked a lot, how do we scale up the technology? And usually that conversation starts about when the pictogram that Dave put up earlier gets put on the screen. And so, I think we're all a little tired after lunch and listening to the last talk, but I want to make you use your memory. Maybe it'll wake you up a bit. But do you guys picture the pictogram for me? It's a circle, and there's another circle inside it, and some blades coming off of it, and then a bunch of arrows. And so that's more or less what most people associate with Kinetisol. A nice pictogram sideways cut out of the diagram of the system, and some arrows where we're talking about it. And you start talking about blender scale up and mixer scale ups, and we really look forward to tomorrow at Chris's shop so you guys can see this in action. But I'm going to walk through a different set of drawings today to try to get at this picture. How do we scale this up? Because it's really simple, but only after you've had the benefit of Dana's talk and you understand what's important to a dispersion, and even some of the things that were discussed by Josh. Going through the formulation design process, these iterations allow us to start identifying which parameters are relevant. One of the things we get to do in chemical engineering is draw lines through parameters and say this parameter is not important, this is what is important. So before we get into the details, though, I think it's important to talk about the regulatory considerations, and then we can talk a little bit about these principles and which ones we think are important to the process. Okay, good. So just at a high level, the development objectives from a scale-up standpoint are phase specific. And Dave mentioned earlier, after this formulator scale Kinetisol machine became available, we realized that we can do the whole drug development process of service by taking the knowledge we gain in formulation development and quickly just translating that over to a clinical manufacturing objective. And then we do this scale-up event. And then after that, we do a mode change. And then as we look to commercial demand forecasts, we can sort through how fast we need the machines to operate, maybe how many machines we would need to operate in parallel to meet the demand forecast. So what do I mean by mode? In context of, a unit operation perspective, Kinetisol, as we talk about it routinely, especially with the pictogram, is just this little unit operation here. But before that, we need to blend the formulation to feed the machine. And then to make a drug product intermediate suitable for downstream processing, we need to mill it. And so we have these, feed unit operations that are compulsory. We can't just operate the machine all by itself. We need to prepare the blend that we send to the machine. And then we also need to post-process it. And we talk about the mode being really just, this is an automation question. How does the operator or the scientist interact with the machine in order to achieve the desired result? And, back to this regulatory perspective, we heard earlier about critical quality attributes. This is part of a broader framework that's well defined in the ICH documents, this Q8, the pharmaceutical development section of our governing, advisory framework about how to develop a drug. And so the first thing we do is define this quality target product profile. We identify what's a critical quality attribute. And then this is where the process engineering piece comes in, is really executing studies to understand how the environment, the materials that are at play, which we already understand a little bit from the formulation development process, and other parameters or attributes of the equipment might affect those parameters and those attributes. And then we ultimately are after a design space for the process so that we can define a control strategy for the regulators. And so in the context of a typical kinetisol solid dispersion run, it's pretty simple. It can be more complicated, but by the time we're talking about scaling it up, we have a good understanding of most of the variables that are at play. I think Dana mentioned it several times early on that as you develop a formulation, if something from a dissolution or performance standpoint isn't working in your favor, you might want to go back and reformulate. And so this is totally baked into the process we use at Austin Pharmaceutics. Dave and the scientists that work with him produce formulations with the technology, directly with the technology. And so from a practical standpoint, we know that most of the variables around heterogeneity, potency, moisture content, these type of variables we have well under control. So we would expect to see crystallinity as a CQA, and on occasion, if the drug is sensitive, process degradants as a CQA. In the context of scale-up objectives, we're normally asked to scale up first and foremost to deliver some clinical trial material. This is, part of the process. It's built into all of our interactions with our customers. And so we need to run our experiments and inform the control strategy, maybe run some engineering batches in order to accomplish this. And in terms of the FDA guidance that's relevant here, we have this SUPAC term, which I think looking to the future at what we may need to change or understand about the process in order to make a processing change is really important. So we have this scale up and post approval guidance, and it was revised in 2014 by the agency, and they call out in here why they made these revisions. Specifically, the 1998 version, I believe, came with an equipment list, and the FDA was saying, these are the types of equipments that we classify this way. They operate on these principles. But what industry heard, at least in some instances, was I need to use some equipment that's on this list, and then the FDA will let me change these parameters, and my life will be simpler. And they expressly say, look, this was misinterpreted. And I think it's not just a reflection of this misinterpretation. I think there's a whole aspect of melt extrusion and spray drying becoming part of a common, review pathway for these regulators, and trying to understand the difficulty and complexity of this equipment and bake that back into the guidance. And so we can step through this guidance and really get a flavor for what might be important to a scale-up process. I think if you read the guidance, it's a dry read, but it's got this outline flavor to it. You can step through it and say, okay, well, what does this mean? Why am I even talking about this? It's kind of boring. But these first three are relevant to kinetisol. We need to blend in order to run kinetisol. We need to mill in order to run kinetisol. But we're not performing the unit dose, and I think that's important. There's a whole aspect of what it means when the equipment's creating a unit dose. But I've highlighted this granulation piece here because what's notable in terms of unit operations, what's not on the list is spray drying. What's not on the list is hot melt extrusion. These are captured in this granulation step. And if you dig into the granulation section of the guidance, which again is in outline form, it lists all these types of granulations. Here we find the term spray dry, the term melt extrusion, which is separate from hot melt granulation. So the vernacular gets a little muddy, but we can learn quite a bit more if we dig into these 4 particular operating principles of equipment. Specifically, if you try to make sense of the guidance, honestly, I feel like hopefully there's nobody that wrote this document in the room, right? So I read this and I get to the part where how do you categorize a melt extruder? And I think they just gave up and said, look, this stuff is complicated and it's a granulator. But that's not true of this other piece, dry granulator, because it can slug or roller compact. These are subclasses. So SUPAC says, here's how we assess equipment, how we assess unit operations for what's important when you change things. And so if you can design your process at the beginning so that it's easy to change later, you can see the whole map. And what subclass is it? What operating principle do we have? And then you get into this whole muddy area. I'd love to have some conversations with folks that have dealt with this in spray drying and melt extrusion. This guidance isn't the end all be all, but it is teaching us something that at least if this document is the only thing you're going off of, HME is a granulator with continuous unit operations. And I think we know that's true. It conveys material to some mixing section. And if we're using the term granulation, this is where that granulation part happens. It's also a pump. There's a vent. This is a very important process. If you don't control moisture removal or residual solvents from an extrusion process, the whole system can go haywire. And then, the term extrusion comes from this last little inch of the machine, maybe ½ inch. But melt extrusion is a good comparator for kinetisol because they're both fusion-based ASD forming machines. I pulled this research from my graduate days. I was lucky enough to be sponsored by Roche and Lystritz to do this work on a commercial scale machine at the recommendation and the funding of Dr. D'Annunzio, who will talk next. But we were interested in how, if we configure this machine differently, will it affect the kinetics of the system? Can we manipulate the thermodynamics of the system by changing these machines? And there's a lot of good science to be done here. There's quite a few products made by this process, but a couple things that you can point out here from a kinetic standpoint and from a unit operation standpoint is there's these potentials for long residence time tails. And so one of the things when you think about scaling up and doing high throughput processing with kinetisol is there's not really a residence time distribution. What we do is we break the blend up into pieces, and then we apply a specific timed energy event to it, which is very short. And then we just repeat that over and over again. And so we don't have this disparity between the material that came out here and this material that might still be in the machine 3, 4, or 5 minutes later. This is a significant potential for drug degradation. One of the reasons why extrusion can be limiting. But the other is a practical standpoint, Dr. Miller explained earlier that we can produce these dispersions at a temperature that's lower than the temperature of critical temperature, I think was the term I learned today. There's a kinetic component and a thermodynamic component here. And what we do with kinetisol is exploit both of these in just the right way, that it enables fusion processing for a number of drugs, and it's simple. We can make it complicated if we want to, but it is simple. So I'm not done talking about granulation. And the title here is the humdrum of slugging. Is I would expect most of you have heard the term if you've been around pharmaceutical unit operations. Nobody thinks twice about it. You can take a tablet press, which is usually used to make a unit dose, and you can make slugs. And this looks a lot like the kinetisol batch mode diagram that I showed earlier. We would blend some material, put it through a tablet press, and then mill the material. And now we have a granulation, which we could take to another unit dosage form generating machine, right? And so, there's a question that gets asked a lot. And I think this is a really sort of key question for this process as well. So nobody gets excited about slugging, but what we do is we take powder, we send it through a feeder. That material gets aliquoted into small bits, and then we put energy into that material, and then we take it out of the machine. And it's also a great way to bring back this mode change we were talking about before. I say that word in meetings. Chris says that word when we're trying to talk about the process in front of the circle pictogram, and folks don't really truly appreciate what it means. And I think this is a really good way to paint that picture. So this is a batch mode tablet press, if you will. And if you were developing a pretty simple drug that you wanted to granulate by dry granulation, you could make like a 2-gram slug easily. So I've seen 3-gram slugs on a press like this. You could take that 3 grams of slug, grind it up into granules, mix it with some other excipients, and you might be able to make a couple dozen tablets. You could develop a formulation in batch mode slugging with a tablet press. And so I think what's really the most important part about scaling up kinetisol for me is the difference between batch and continuous mode tableting. What's important when you make this transition? It's usually to dealing with this system right here. How do we make sure the powder doesn't segregate before it gets into the dye and turned into a unit dosage form? How do we make sure that it flows so the machine can operate at a speed that's suitable for high-speed rotary compression? And the answer is occasionally we can directly compress, but sometimes we need to pay close attention to this feed material to make sure the machine can do what it needs to do. So, I asked the question again, what is slugging? It's a granulator with some continuous unit operations that are happening. So we take powder, we put it in the top of the machine, and the machine on a continuous basis separates out some powder, moves it, works it, ejects it in a couple different ways. These are all, if you were to bound the definition of a unit operation, you could get kind of detailed about this, but things can go wrong when the tablet ejects from the die, like capping or laminating, or maybe it doesn't eject from the tool. There's a lot that could happen here, but in the end, these things are happening. And as pharmaceutical scientists and engineers, we've grown accustomed to the vernacular of this, how this works, what's important for this. And if you understand what's important for making powder flow through a tablet press, then you can scale up kinetisol. We put powder in the machine, and it does almost the same thing, except for I learned another term I think Dave used earlier, which was kinetisoling. So I would I think I need to put that right there. But instead of slugs coming out of the machine, we get shots. That's the term for it here. And it has roots in like injection molding. If you're around NuvaRing, you may even hear these kind of terms used. But it's not much more complicated than this. It's just a simple process. The way the material flows through the system, I assure you, is simpler than the TIMS. Can draw it. So we put the powder in the feeder. The feeder controls the shot size, and we can do this with a high level of control. But what we need to do is make sure it can get into the chamber quickly and reproducibly. And so there's a series of actuators and mechanisms to allow that to happen. And if you want to know why this is at this angle and how this actually works, you're going to see it tomorrow. And that's, it's really cool. It's really simple. But what I have here in orange is the product contact surfaces. These are where the powder goes through the system. After it gets processed in this chamber, this is your pictogram turned sideways. This is where the magic happens. And then we take the heat out of it. And so now we can talk about process engineering, because we understand the regulatory perspective here and what's practical in terms of this. This is a continuous process that involves some pre-batching, and what's important here is contained in just about every textbook on the topic. I like this one. It's a good one. But what we need to do is scale the blend first and foremost. And we need to make sure we keep the number of blending events constant, and we match the Freud number. This is standard pharmaceutical art. What we do is take the size and the speed and turn that into a dimensionless number. We do some math, and then I don't know. I prefer to just buy good blenders that all of this is just baked in, and just when it works at 25 RPM on the bench, it runs at 6 RPM on the 300-liter bin, and it just works. This isn't the hard part. What's really we need to understand are all of the things that we've been hearing about today. What's the particle size distribution? Are there density differences that could cause segregation? Are we going to get mass flow? We didn't talk about that today, or funnel flow as the material moves through the system. And so, measuring the wall friction angle with like a shear tester, these are basic things that are known to pharmaceutical engineers that we can collect. And then what we do is we use that information to just understand if there's a segregation mode. If there is, fix it. Is there a mass flow problem? If there is, fix it. Otherwise, the process manages itself. And I think you saw a version of this curve today too. I think we're going to have Dana give her talk every time I have to answer the question about scale up going forward, because basically what happens in the chamber is relatively simple. We turn the mixer on, and over some course of time, the material gets hot enough where the viscoelastic properties of the system change dramatically, and then this viscous heating regime occurs. And once we have this sort of turbulent system in the mixer, this crystalline drug, starts to dissolve by this Noyes-Whitney equation relationship that we've already seen today. And that dissolution process runs to completion, but we can't see that directly. And what we do is we correlate this to some maximum temperature we want the mixer to run to. I think, again, this is T critical, maybe. If I don't know, I liked her presentation a lot. But really, we can't measure the exact temperature of the dispersion directly. You can't do that in extrusion either. This is an apparent temperature. So what we're doing effectively for the process is generating a correlation between this temperature and the dissolution process that's occurring in the system. And so this is what happens inside the chamber after the material has been actuated into the machine. And we can talk about what's happening in the chamber in very complicated ways. I'm going to put a couple equations up here, and then I'm going to simplify them. And I think over the course of the ball game tonight, some of us are going to talk about these equations, and we can talk a lot about these equations. We can turn this K right here into a different number, and then we can turn the diffusivity term in that number into a whole other set of numbers that have viscosities in them. Like there is a ton of art and science behind what's going on here. But from a perspective of the temperature, what matters is this term here, this saturation solubility versus the temperature of the system. So this changes as the material is heating up. And so we need to pick an apparent temperature that gives us the driving force for long enough. And long enough is defined by the mixing speed, which we'll talk a little bit about more. And so we can't just control on the temperature, because sometimes this temperature is too hot. And when it's too hot, we get process degradants. So this is the fundamental relationships that we care about when we run the mixer. We want to find the right temperature that gives us the driving force for dissolution, but doesn't cause significant degradation. The other parameter that is important is the speed. This is the a speed inherently is like an RPM, right? There's a time factor here, and I learned at DPT a long time ago that we scale up stirrers in a very predictable way. It's not a perfect relationship, but in the end, the tip speed of the machine is relevant. But if you think about what I presented at the very beginning, the first thing we're doing is developing the formulation on a formulator, and then we transition that directly into formulation sort of validation, get into the human PK study and make sure the formulation's behaving the way we want it to behave. And then we do one single scale up. And it's not a large change. I think it's a factor of like 6 or 7. And we can just adjust for that. We just change the speed. We know what speed to set it on based on the speed we ran the last machine. It's not complicated. But where the RPM gets complicated is it does affect this term. I keep adding equations. I apologize, but I could have put a lot of terms here. Really, what you should see here when I talk about this dissolution coefficient is there's a relationship between diffusion and the boundary layer. And I really like the photos I saw. I'm going to talk about Dana's presentation the whole time. She showed a couple really good images where crystals were dissolving. And if you were looking closely, you could see that there was actually as the crystal was dissolving, there was another boundary where the crystal used to be. That was sort of a saturated drug layer. It was a diffusion. That was a stagnant diffusion layer that the drug has to go through to get out of the system. And one of the best ways to make those go away is with shear. And so we've got this high shear mixer, and so we can make that boundary layer go to almost nothing. In fact, I would argue a lot of the crystals fracture and the area goes up, but really the temperature also affects this, and so does the RPM. So we have 2 different parameters. Both of them make the dissolution rate go faster. One of them, on occasion, can cause the drug to degrade. But there's all kinds of other settings, geometries. We could list 100 factors. We could do that for the tablet press. We could do it for an extruder. We can do it for a spray dryer. We don't need to spend a lot of time on these. We've developed the machine around a practical and pragmatic space. The formulation has made it through the formulation development process. And so we know that it's amenable to the technology. And so when we get to the point where we're scaling it up, all of these parameters, some of them may change, and we can take a page from tablet coding. This is an energy balance that I would construct around a shot basis. And if you're interested in how this works, there's a couple great articles in the tablet coding space that explains the utility of this type of an engineering approach to a scale-up problem. But there's, effectively, this first law of thermodynamics that says we can't create or lose energy. And so we can say, the conditions before the shot and after the shot, the energies that are involved have to be equivalent. And we can organize those energies that are at play into terms. This one is the term that describes how we heat everything up in the system. So you would take the heat capacity, the temperature change, and the amount of material for each of those, and that would be this term. But there's also always moisture. There's always sun, and we're liberating it in the process when we heat it up. And so there's an evaporative cooling effect when we have this moisture term. So moisture is a factor that we need to be aware of. It affects the kinetics. It also affects the total amount of energy we need to put in the system to get the same result. If we add more moisture, we might need to add more energy to the system to get to the same point. And so there's this energy of mixing, which is just when the drug dissolves in the polymer, there's a thermodynamic interaction that may have a positive or a negative sign. And then there's a heat loss parameter associated with the equipment itself. And we can affect that term. And from a process engineering standpoint, we can change the temperature of the cooling fluid that's running through the machine, and choose the flow rate. But the place we see it the most is as we try to speed the machine up, because after we made our first scale change, the next thing we want to do is switch to a continuous mode. And usually the objective there is to deliver volume, throughput, maximize yields. And so as we start to speed the process up, the starting temperature of the system, this T1 might be different. But again, we know we need to put a certain amount of energy into the mixture to dissolve the drug in the polymer, but we don't want to put too much in the wrong way because that could cause degradation. So there's a balance here. But effectively, as a process engineer, what it means is if there's variation in the environment that affects the heat term for heat loss, if we change the cooling rates, if the moisture content of the system changes, this balance changes. And what we need is a robust process that can adjust to that. And so here's everything. I think I totally violated the equation rule for a presentation, but people are still looking at the screen. So I think it was just the right amount of equations. But in short, what we control is this apparent temperature that we want the material to reach. What we control is the speed of the mixer. It's a mixer, right? Like, how many of you walked into a plant, seen a big vessel, and somebody's pouring salt into water and there's a mixer running? Like, in the end, it's a mixer. There's not that many parameters to get hung up on, because everything else can just roll up into this heat balance, and we can understand that and we can account for that. So here's the non-equation version of this parameter set. We've got the maximum temperature the material may achieve, the speed, the shot mass, some material parameters, some environmental parameters, and then we have some other parameters associated with affecting that heat balance of the system. And what we see typically, and you'd see this graph, I think the Merck team wrote a really good chapter in a book that describes this space for melt extrusion. But basically, if we don't put enough speed or time or temperature on the system, we end up with residual crystallinity. And if we put too much, we might end up with degradation. That's molecule specific. We really like the molecules that don't degrade. So, just bring those on down anytime. But for the most part, the time durations here are so short. They're just so short that we can accommodate this just by the nature of the process. And so what we see is we're controlling the speed and the temperature, and we create a design space where we get the target critical quality attributes out of the system. And then if we change the shot mass, which is an input parameter, it's very easy to control. We're talking about 100 gram, 200 gram shots that are push button control. If we shift the mass, it may affect where we lie or may push us out of the design space. But that's what boundary conditions are for. So we can bound that parameter, we can set that parameter, we can set it and forget it and never touch it. Everything else can also affect where we're at in that design space. And what we're aiming for is a process that's robust enough where this isn't going to push us out of any of our specifications. But really, in practice, if something shifts the process, we can detect that and we can shift it back. This is an energy balance. Something's affecting the energy of the system, counter it. If there's too much energy being put in, take some away. It's not that hard. We can make it hard if we want to, though. So the machine's really fast in terms of its control and PID loops. Chris will talk about PID loops. There's a programmer in the back here, I think, that probably loves process control parameters. But we had a process where we had observed some segregation, and we needed to deliver a bunch of clinical trial material. And so what we did is we roller compacted the material before we fed it to the machine just to take away that segregation. There's more than one way to do that. We could have gotten different particle size distributions of the materials and not had to roller compact it. But we needed to deliver clinical material. We had the machine. We did that. And somebody said, well, what if the granules affect the process? Well, we just set the machine to run 2 stages and mix it for a little while. We know what mixers do, especially the type of mixer we have. It's just going to grind those particles away. And so we just mixed it at a low energy for a while to remove that granulation history that we added so that the material could get into the machine. And then the process did what you see normally is, starting here, we ramp the RPM up to a speed that affects the viscoelastic property changes in the system that allows for the dissolution process to happen. And you can see, this was a couple hundred shots, and the only real variation is in where this inflection point happens. And that is what we call the sort of when the process kicks off. When you're watching the machines run tomorrow, don't forget to listen, because you can hear this. When the mixer starts to become bogged down by the energy required to keep its motion, the whole viscoelastic nature of the system changes, and you can hear it in the machine. And whether or not that kicks off at, I don't know, what is that, 11.2 seconds and 14 seconds? I mean, it's kind of funny. It's like plus or minus 2 seconds. Like, this is not relevant. What's relevant is that the shape of this curve and the endpoint of that curve and the speed is the same every time. And so this is that energy balance I'm talking about. As we're running the process, maybe it was a little hotter and kicked off earlier. Maybe we stopped the process or the first shot kicked off a little later, but this doesn't affect the quality of the system, of the product that we're making. And you can see that in other parameters. Like, if you were to take a data set like this and construct a process control chart, process engineers love process control charts. This is a lower control limit and an upper control limit, but from the purest statistical standpoint, I don't like statisticians. Are there any statisticians in the room? This number is meaningless from a product quality standpoint. What it's telling us is information about this data set. And this is where we can get an understanding of what's happening from this heat balance standpoint. So each one of these dots is a shot. And the first shot is being put into a machine that's got coolant running through it. It's kind of cold. And so it takes a little while for the system to generate up just enough heat for that kickoff to happen. And then the second shot happens a little quicker. And then the system stabilizes. Maybe the operators went to lunch. You know what we do when it's lunchtime at AustinPx? We stop the machine and we go eat lunch. I don't think you can do that with a spray dryer and extruder. It's those little things that make me happy. We stopped the machine, we started it again, it works. And we know it works because we can map it, we can test it. We have all these great scientists sitting around here that have taught us how to do this. One of my favorite scientists is Angela, because she knows how to work our ramen process analyzer that we can take into our GMP suite. And we use this really to map the process. We don't need it for process control standpoint, but we can. And so what we can do, because we're making a shot by shot by shot basis, and you'll see Chris and the team tomorrow, you can just walk up to the machine and put in some parameters and it'll make a shot. And then you can take your ramen shift with your validated reference curve that's been trained. We could have a whole conversation about this, but in the end, we can just map all of the parameters. The 2 parameters we care about, maybe a third. If you really want to get fancy, we can add some moisture, take some moisture away. We can map these 4 parameters and understand the whole system. Like this. So, this was really cool about this is I keep saying we needed to deliver some clinical trial material, because that tends to be very important in early phase development. I don't think it ever gets not important, but it's always looming. We don't get to just run experiments all the time. Some companies do. I'm not sure where the resource balance is there for you as an individual or at your company, but we can do things like this. It's really cool. This is like the 200 shot. We delivered the clinical trial material quantity we needed to, but we wanted to understand the system a little bit more. And so we just wrote up a little protocol, and at the end of the batch, we just started testing stuff. Let's change the RPM and let's make 3 shots in a row. Because after 3 shots, energy balance. The energy balance. Change it down, 3 shots. Change the shot weight. I mean, this took like 30 minutes. It's not even that. I mean, this is really powerful. I really, as a process engineer, so cool. Is it? Yeah, I mean, yeah. So then we get to the boring part of the process, but it's the part of the process that I think people think there's a lot of risk. So now we have this dispersion. We know how to make it. We know how to make it over and over again. We've demonstrated it many times, but we do have to deal with this hot mass of sort of aerated, rubbery material. I think from a material standpoint, if you go read a material science textbook, it's a rubber until it passes this glass transition temperature. It becomes a glass, right? And so we've got this rubber, and we want it to get past its TG, and it's doing that with this sort of quench plate system because it's pretty practical. The mass comes out, these 2 plates come together, and they pull the heat out of the system. And you can ask Chris about it tomorrow, but the first thing I did was make him connect the earliest machine we had to this quenching machine. There were 2 separate machines at the time. I made him connect them so that I could measure exactly how long did it take to quench, how long did it take to get to the temperature we needed it to be at. And we looked at it for a couple of years, and then he put all this stuff into the same machine. So all that data is collected all the time, but it's actually become it's irrelevant data. When I mentioned at the beginning, one of the cool things that chemical engineers get to do is just take their pen and draw right through a term and say, that's not important. This is one of those things. And it becomes a very practical matter. Did we get it vitrified? Did we make it into a glass? And then, is it going to melt the polymer liner on your containment that it's coming out in? Is the operator going to touch it? Is it too hot to handle? Beyond that, there's not a lot to it. We're just taking the material out of the system, cooling it to some practical temperature, and we can start to press this time as throughput becomes important to the process, as we care about efficiencies, as we care about yields. I don't care about that much in phase 1. Not that much in phase 2 either. but for commercial, it can become important. So this becomes a practical thing about throughputs and potentially, yield. So what's really important about quenching is that the materials don't stick to this. That's probably a scale up standpoint as we start to get bigger and hotter and faster, just making sure that we have the right materials of construction on the equipment. And we've studied that. So the other aspect of this is, there are parameters and they'll show up in our batch records. Maybe for some systems, we might find that they become a critical process parameter. I doubt it. I really do doubt it. But the two parameters are quenching delay and quench time. And so the material leaves the system. It needs to get into a location where we can quench it and take the heat out. And we need to tell the machine how long to do that. And where we set that time is where the cooling curve for the system would diverge. And process engineering wouldn't be complete without an equation. There's a total heat term here that's based on the convection of the system, the area, so the size of the plates, how much force we put on the plates to make the shot squeeze down. And then we can change the coolant. The shot temperature's more or less already set because we set that parameter for the previous part of the process to cause the dissolution process. But we can affect quenching in the absence of making the dispersion by changing the coolant. But the shot mass is also a pretty relevant factor here. But again, it's a practical matter. Our experience set teaches us something. And I think I heard it at least twice today that, if you're formulating a dispersion and your performance is affected in some negative way, or you can't make tablets in some way, maybe you're using the wrong process. Maybe you should go back and reformulate. Every one of you has one of these little shots in front of you that came out of the formulator. And so what's really, I think, important, and not to be, don't dismiss it as a relevant piece of the puzzle here. We formulate with this small machine. It's empirical, it's practical. We can do it rapidly, and you'll see that tomorrow. But what it means is everything that's made it to the point where I need to scale it up is proven to have survived the quenching process, which involves, at the small scale, an operator manually taking the material, putting it in between some plates, and then taking the heat out of it. So if that happens routinely and effectively at the formulation scale, the machine can do it. And so you can look at these, this is important from the regulatory standpoint, because it's not just about what that SUPAC guidance says, it's about the conversations with the regulatory authorities. What's the risk? That's what everybody cares about. And so at a hot temperature, there's no driving force for nucleation because we're above the T critical. I'm going to get this right. I'm going to factor these terms in. But then, when we get it down to low temperature, we vitrify the dispersion. There's no molecular mobility. If you have a risk right here, you have chosen the wrong process and you should go somewhere else. You should not be here. But this is really, again, we're talking about seconds of exposure. There's a practical perspective here. This is just a low risk process. So then we get the material out of the machine to provide a dispersion that's suitable for a finished dose manufacturing. We have to mill it. So there's a really practical part that I believe heavily in, that is to do a two-stage milling process. The first reason is because we want to be able to control the feed rate to the mill, and having this big disc makes that kind of hard. So we're going to just bring it down to like the centimeter scale. But also, as we play around with the shot size, as we scale up in terms of throughput and speed and maybe the shot mass, we want to be able to remove the geometry dependence from the system so that we don't have to re-optimize our milling process every time we change a parameter in the compounder. And then, more equations. So we got to mill it. This is, again, textbook stuff. If we scale up the mill from our small hammer mill, tabletop hammer mill, to our hammer width 3, or maybe to future to a hammer width 6 or a Fitz mill, we start again this same equation. A lot of the operations here just deal with rotating things, and we match tip speeds, and then we control these parameters that control the particle size distribution. There's a couple people in the crowd that do this every day for a living. So if somebody asks me a question about this, TJ, you have to answer it. So this brings us back to this sort of same perspective on, so what do we need to do to scale up the process? First and foremost, because we're using a small version of the technology to generate the formulation process develops the first iteration of it. And so then we can just reproduce that to deliver clinical trial material so that we can validate the formulation. And then we do a small scale up event. It's less than 10 times in the geometry factor. And there, it generally makes sense to call the spectroscopists in the room and map the process. And we can do that while we're delivering batches. We can map it on the morning of the first batch and then just deliver the material. Or we could do an engineering batch and then map it some more. I mean, we have a level of flexibility that I don't think anybody will really appreciate it until they see it in action. We can just stop the machine. We can just change the parameters because we can. And nobody thinks about it because you're so stuck. We're using a process where you can't. And, you know, it's, for me, it's very profound. And then we need to go fast. And to go fast, we need good powder handling properties. So we either go back to the supply chain, or maybe we granulate, maybe we don't, maybe it's suitable for direct compression. I like HPMCAS MP. That's big particles. I like cohesive APIs that stick to those particles. Then we don't have to worry about this. But this is a practical matter for any pharmaceutical unit operation that deals with powders. You solve that problem, map the process out, make registration batches, and then later, as you try to go faster, you have a set of, I think the term is experience, conditions that you've mapped for the process, and you should have a range around those. And as you try to speed the process up, you just shift around in that space. And if you can't do it visually, which operators for the most part can, and we've proven that, you can bring a Raman tool in the room or some other PAT tool. Every 30 seconds to a minute, something comes out of the machine. It's plenty of time to check it, make sure it's good. You can get feedback control if you want. And we've done this a bunch of times. This is the most public example. Dave talked about it earlier, where we did this with etravirine. This is one of those molecules that was bounded because there was a process degradant. A lot of APIs don't do this in the system. I love those, again. If I didn't say that earlier, but we can deal with it. We can just set a boundary, say like, this is a temperature bound. Some formulations don't really have that. And then we control the speed within that bounded temperature. And this was a data set we collected on each batch just to prove that we were in control of the process. And it works. And it's easy. So, because it's just a granulator, but does other discrete unit operations. We can't scale it up if we don't scale up the blending process. That's actually, for me, I put more thought into that than I do the process itself. And then, we set the temperature and speed ranges. The design space for the process is simple. It's 2 parameters. We can make it more complicated. We have, but you don't have to. And then you bound the other parameters that may make it go out of control.
Thanks for your great talk. I'm interested in some of the practicalities of, you said, 30 seconds to a minute per shot. How many shots are in a batch? Is there a limit? And how is it cleaned? You said you can just stop the instrument, and I think that sounds wild to me, having never seen it. So I'd love to hear a little bit about cleaning.
Yeah, so 2 good questions. The first is we set the batch size based on the blend that we make to feed it. That's our parameter space. So In our shop, we have a 300 liter Boley bin blender, 150 liter, and then a 3 cubic foot V shell, and then a bunch of other smaller blenders. So we just, we set the batch size based on the blend that we feed it, because it's a slug, it's a shot, it's not a sub batching operation. But the machine itself, from a cleaning perspective, all of the material, all of the product contact surfaces are removable. But beyond that, the machine is kind of self-cleaning, especially if the formulation is, got some mag steroid and just has the right, viscoelastic properties. When the mixer is running at a very high speed, the door opens and the material comes out in force. There may be some residual material in there, but it's not significant. And we stop the process all the time. We go home, come back the next day, and start it back up. We do it because we can, and we can prove that it works. But when we take it apart and clean it, we do cleaning validation. We have all that stuff, all of it, everything you would expect to see with any other machine. So the machine comes with a sort of a clamshell design, so you can just kind of pop it open. There's, you can get a little, hard to get in some of the nooks and crannies, but we don't do that very often.
Justin, really nice talk. Hey, question for you. Is there a reason because you can keep a track of the power input too?
Sorry?
You can keep a track of power input.
Yeah. Oh,
right?
yeah.
The torque.
Absolutely. We can.
Can that be a scaling factor when you do it?
I really want it to be.
You want it to be?
I do. I do, but practically we haven't found that yet. Really, it's just, empirically we map the space. But any granulator, if you go, if you look at the pharmaceutical scale-up world, like torque controlled granulation endpoints are a thing. But in the end, we're not looking for the energy that you would see when a powder turns into a granule like you do in granulation, typical granulation. But in amorphous solid dispersion granulation, we're looking for a dissolution endpoint. And the power feedback of the system really doesn't correlate with that. It's the temperature that correlates better with it.
Also, I think, fundamentally, you apply this shear to increase the temperature, so drug will dissolve.
Mm-hmm.
So time has to be a factor.
It is in the speed. And but it's just, we're hitting it with like a sledgehammer of convection and shear.
Mm-hmm.
And so really, we just find that, as long as the material is heating up, the RPM can play a role, but it's not huge. It's more about the temperature. It's the dependency of the temperature and the RPM, and which makes it a two-factor space. And two-factor spaces are, they're not that hard.
Yeah, early on there was a question about particle size effect.
Mm-hmm.
I wonder if you run into cases where when the particle size goes bigger, even though you hit the same temperature, but drug is not all dissolving because time was not enough.
Yeah, I really enjoyed the conversation about fracturing crystals. We've done some studies where we tried different particle sizes. Dave, you probably have a test case for everything, but I don't think we've observed the particle size distribution ever impacting the temperature we need to run the process at. What it can potentially lead to is if there's a wide distribution, that the temperature that correlates with dissolution completion has a distribution. And so we may dissolve the really small particles early, and then those molecules are there with conformational freedom, getting hit with a convection shear sledgehammer, while some of the other particles are still dissolving. So I tend to believe that it's more about the distribution than it is about the average, because I think the first thing the machine does is rip those crystals to pieces.
That's probably one of the reasons.
Yeah.
Can you talk about some of the important parameters with respect to the quenching process and how wide the design space is?
It's, of all of the design spaces that I deal with, it's about this big. Just like that fish I caught. But it really, it's a practical matter. We have just, again, I'm probably just making up terms here, but we've got this sort of convection shear sledgehammer that we're just whipping this material with. And then we take it off. And so if it can survive that process in that environment for 6 seconds or so that it takes to get it to that condition, it can survive for 2 seconds before you start to take that heat out. If it doesn't, you never would have seen that puck on the table. That's the reality. It wouldn't survive the formulation process. It will get screened out.
Have you modeled the cooling rate?
There's really good equations for that. Heat conduction to a plate. That's the one that we had to do in undergrad. But no, because honestly, I don't worry about it.
Or knowing anything about it, it just occurred to me, you've scaled down to make the formulator, I think.
Mm-hmm.
So the contact surfaces and the thickness of those contact surfaces, are they the same in terms of ratio to the slug you're making between the two sizes?
Yeah, there's always a volumetric problem when you scale a radial geometry like a mixer, but we're not making a huge step. It's like a factor of 7, I believe, on that dimension. And we have all of the material surfaces are pretty robust, stainless steels, hardened stainless steels. And so I think it's just as a matter of practice, we don't really see a problem when we scale up. I learned early on in career when I was scaling up these huge tanks of liquids and gels that mixers get more efficient as they scale up in general in terms of their power consumption. And I think what we see and what we've experienced is that if we can formulate it on the formulator, we can make it on the compounder.
Okay, so the thickness of that puck between the small scale and the large scale would be the same. It's the size of
the thickness of what we get out. No, because we're typically taking almost like a 10-fold change in the mass, and then later we can further increase that to maybe 30-fold. And so the mass that comes out is significantly, or the volume of the mass that comes out is significantly bigger, but we just have a bigger plate.
Okay, so the relative scales of the puck size and the whatever's smashing them together.
Yeah, what we're practically looking for is something that's maybe a couple centimeters thick or so that we can break it without a lot of force before we pass it through a hammer mill.
Right. No, I'm trying to just visualize that, not looking at the.
Are you coming tomorrow?
Yes.
Okay.
Yes. Because I'm thinking this is the thinness it's a small dimension, but when you start talking about increasing that, then the material scientist in me wants to visualize what's happening inside and thinking the opportunity for recrystallization and other things associated with crystallinity start becoming important because we've.
I think I had 3 slides on quenching, and like I said, I made Chris put extra sensors on the machine for those exact same reasons. But in practice, it's just not. We don't experience that to be a limiting factor for the technology because we screen that out at the formulation. But really, what we do is the next size up machine smashes it back into a plate, so the diameter of that plate gets bigger.
Right.
So yeah.
Right.
And so then we just break it back up, and that's why I put on the milling side. There was a crusher and then a mill, so that what we're controlling are the process parameters around the mill. And what we want to do is, as we change the mass, just reduce it back to this sort of same scale, centimeter scale particle that we mill. That was the elapsed time of the shot, right? So we're not specifying that as a parameter relevant to the design space. That's an artifact of the system. What we've specified to the system is that we mix it at a constant rate, or we set that rate or series of rates, and that we set the temperature at which the machine, deems the process to be complete. And so that is what we controlled, and it was the same for all those shots. And we verified them all with the Raman too. So that was just a characteristic time related to the heat balance of the system, which everything else kind of rolls up into that heat balance. The chamber itself opens up. And then there's a series of bolts that are on the outside of the machine that hold these liners in place. And so what the parts of the machine that contact this viscous material, it's glue. Like we've made some formulations with PVP. Does anybody know what PVP is practically? It's Elmer's glue. It's Elmer's glue. So, cleaning that out of an extruder for me was a nightmare. You had to pull these screws all the way out, and you got people in there with a drill, and you're putting towels on the end of the thing, and you're getting at it. And, we just open up the machine and we take the parts off and we clean them in the sink.
Is the surface wetted with a polymer melt, or is it like particles adhering to the surface?
Yes.
So both.
Yes.
Okay.
It starts initially with some sort of, kind of compaction event that then turns into a viscous or a frictional heating, and then that turns into a viscoelastic flow that turns into more heating. I don't know, it's everything. So I think it switches. If you saw my temperature diagram where I had that sort of flat curve change shape, that's where it switches from sort of a particle to a viscoelastic situation.
Mm-hmm. I think it might be more the particles adhering to the surface, because when you have a real wetting, I wouldn't see it dropping out of the machine afterwards, because wetting always means strong adhesion and then that it sticks to it.
Yeah,
somehow.
There's a lot
At least
of
this is the problem.
There's a lot of momentum in the system, and the material wants to stick to itself more than it wants to stick to the machine. And in part, that's the way Chris designs the metallurgy of the system. But occasionally, they're sticking, and it can occasionally get in the way of the door closing. But I can go to lunch, I can go home, take a nap, come back, and start the process back up. If there is a sticking event or a jam, is what we would call a jam. Sometimes machines jam. We just clean the jam out and start back up.
A completely new take. The next presentation is going to talk about real industry experience with the different solubilization or different ASD techniques. We've talked a lot about, spray drying and hot melt extrusion and kinetisol. Next gentleman comes from Merck, and I think what I got out of what he's going to talk about is early detection of solubility is very important. We know that, but also that you have to have a comprehensive lifestyle management of your program. And I think it's a good way to kind of conclude today's talk is that what you choose depends also on the timing of the development. So regardless of all the different factors we've heard, it's very nuanced. So we add another complexity. It depends on the phase. And that I think Dr. D'Annunzio will talk to us about. You pick the approach on the specific for the product, but also during the timeline. Of course, we'll also come back to the crystallization and understanding the different amorphous states. So I'd like to welcome Dr. James D'Annunzio, who has over 15 years of experience in OSD development and holds the position as director at Merck. He's also a proud graduate of the University of Texas at Austin. So Dr. D'Annunzio earned his PhD in pharmacy, and then before that, he got his BS and MS degrees from chemical engineer from SUNY Buffalo and Columbia University. And before Merck, he was senior scientist at Roche, always focusing on amorphous formulations and pioneering technologies using melt extrusion. He worked at Pharmaform and Forest Laboratories. And I'd like everybody to help join me in welcoming Dr. D'Annunzio.
But I also really appreciate all the fantastic talks that were given today. My talk today is going to be on industry approaches to solubility enhancement, and really hoping to tie everything together that we've had throughout the day, framing how Merck approaches solubility enhancement and product enablement for our low solubility portfolio. So stepping back and thinking about the problem statement that we have in front of us when we're working with a low solubility compound, we ask ourselves, what does the Venus de Milo have in common with many Merck commercial products? Well, actually, the Venus de Milo in many cases is actually more soluble than the assets that we're being tasked to deliver. So a monumental undertaking for the formulation team. And we do this through a number of technologies, but most prominently within our portfolio, we're using hot melt extrusion and spray drying. We also use a variety of characterization techniques,
many of which we got exposure to today across the different talks, to characterize the products. It's also important to remember it's not just a dispersion. We do have to deliver a tablet. So when I was at PharmaForm, I overlapped a little bit with Elizabeth over here. And when we were setting up for the talks, she said, nobody should mention the BCS classification. So I just had to, of course, throw this in there, not because that's how you should think about it, but actually to set the framework for how we want to think about solubility enhancement and the need for solubility enhancement when you have a low solubility compound. So going in and looking at the guidances that we have for industry, we can define a highly soluble compound where the dose is dissolved in 250 milliliters. So anything below that is going to be not highly soluble, so low solubility. But does that actually create a problem that requires us to go to the lengths of creating an amorphous dispersion? My answer is no, and I'll explain how Merck thinks about solubility enhancement in a second. Another thing is that we tend to see a wide range of poorly soluble compounds being reported in the literature that actually require enablement. 40%, 90%, really, really big numbers, and that doesn't jive with my experience. And actually, the other thing that's scary about that is when you go and you actually trace this out, took this review article from 2021, so authors will remain nameless. I don't think it's anybody in the room. But where does that statistic come from? Actually, it traces its lineage all the way back to a gadaphosphate paper in 2006. When I was in graduate school in 2006, we hadn't even started working on kinetisol yet. So that tells you, exactly how out of date some of this is, and whether or not, this is the right framework for us to be thinking about solubility challenges, both in terms of what defines the problem statement, as well as how prominent that problem statement is across the industry. So before I share some of the details about the Merck portfolio and our experience, I wanted to just roll this back to fundamentals. I promise less equations than what we've seen in some of the other talks, but there are a few over there on the right side for you. Starting with the product that we develop. Again, Dana hit on this. It's not going to be the dispersion. It's the tablet. So you have to have not only the right solubility coming from the dispersion, but a product that's actually going to disintegrate, be able to be ingested, and ultimately drive the solubility in the GI tract to facilitate absorption of that. And when we think about absorption, rather than thinking about it purely in the context of the BCS classification, we can start to apply some dimensionless numbers. And there's three dimensionless numbers that were derived in the paper that's referenced here that speak to the parameters that we're going to be interested in when we think about absorption. One of those is the dissolution number, which is essentially looking at the residence time you have in the GI tract relative to the time for dissolution. If you don't have enough residence time to dissolve the drug, well, you're going to be limited in terms of that dissolution number. We can also think about the absorption number related to the progression of the material down the GI tract in context to the radial absorption of the drug through the wall. And most importantly is actually the dose number, which is very similar to how the BCS classification defines solubility. And so when we look at thinking about this now, rather than thinking about it in the context of the BCS classification, where 2 must be enabled and a BCS class 1 doesn't need to be, we can actually think about it in the context of the dose number. And plotting out our historical portfolio from 2019 or up to 2019, what we see is that actually compounds where the dose number is moderate, we don't see any deviation from the predicted exposure. It's only when we exceed a certain threshold that we start to see these negative deviations in terms of the bioavailability that we're getting, particularly as we're increasing the doses. And so we can look at our early development portfolio, understanding our historical performance relative to dose number, and use that as an early descriptor to understand whether or not we need to be using an enabled technology. And so when we look at our early development portfolio, I think there's a few things that jump out here. One, only about 25% of the compounds in our portfolio are actually requiring us to use enabled technology, nowhere near that 90% number that you're seeing in the literature. So for us, it's actually perhaps not as prominent of an issue that we're facing. When we map it out across the 4 quadrants that I think Dave had called out in his presentation, if we were to look at our portfolio, we have 15 recent assets plotted here. Only one of those is showing up squarely in that first quadrant. And this may be a reflection of our portfolio. Other organizations may have different portfolios, but certainly if we were to explore kinetisol for only the advantages provided by working with these brick dust compounds, it's not going to represent a huge fraction of our portfolio. It's not to diminish the value that you can have by working in these other quadrants, particularly when we talk about some of the green initiatives in trying to limit solvent use. And certainly that will factor in terms of the productivity hit that you see with some assets as we take compounds forward with spray drying. And I'll talk about that in a little bit. But for us, we're really going to think about our development and implementation of amorphous dispersions at a portfolio altitude. So rather than being at the individual product altitude, we want to pull that up a little bit because we have multiple assets in our pipeline at any one time in various stages, and they'll progress from the preclinical phase through phase 1, phase 2, and then ultimately, hopefully, achieve approval. But the reality is not everything is going to make it end to end. Actually, only a small fraction does. And so how we think about implementing amorphous dispersion technology is actually in the early space where spray drying has much lower technical complexity, because really all you're doing is dissolving the drug and other excipients and then spraying through. You don't really care about productivity. Your batch sizes are generally pretty small. It's very straightforward. So we're able to do that very easily. So that becomes our workhorse early phase technology. Melt extrusion for small scale manufacturing, while we do have some unique capabilities with small scale extruders at around 7.5 millimeters that provide us an opportunity to do 10-gram batches, it's still not going to be able to compete with the productivity that we see in early phase spray drying. We're also bounded by some of the thermal and rheological liabilities of extrusion. So that technical complexity piece, much more challenging in the early space. But as programs advance, our philosophy is to look to pivot from spray drying to melt extrusion, because the downstream work that we're doing as we go to scale up or scale out those processes is much easier for us. And so that really represents the heart of how we approach development. So in the early space, there's a few different technologies that can be leveraged. For us, spray drying is the preferred approach for our early phase development work and screening studies. We do have the capabilities for small scale prototyping with extrusion, but the reality is API demand is much more significant. Certainly the progress that the team has made here with kinetisol is really exciting to see with their small scale compounder and their ability to rapidly turn around prototypes. So I think in that space, kinetisol certainly provides some unique advantages over hot melt extrusion that would warrant evaluation in terms of how we think about our research operating plan at Merck. But for formulation development, do we even need to prototype things on the extruder or the spray dryer? We can actually use high throughput screening. So evaluating a range of prototype systems becomes actually very, very quick to do. We have 96 well plate systems. We have the ability to quickly solvent cast, identify lead polymer combinations, potential other additives such as surfactants that may aid in that dissolution process. We can stress these systems, evaluate chemical and physical stability of these systems, all in an automated and high throughput fashion. So this is how we go from a potential formulation space that is incredibly wide down to a few lead systems for further prototyping. And then when we talk about the prototyping piece, this is where, again, most of this work is going to go ahead and start with spray drying. But if you were to break these two processes down, spray drying and hot melt extrusion, my colleague Mike Lowinger had put this together, and it's really just two basic steps. You have a mixing step and you have a quenching step. For spray drying, super easy. You're talking about just dissolving the components of the formulation into a common solvent. Not that difficult to do in the vast majority of cases, particularly if you're not hindered by solubility or you're in the early space and don't really care too much about solubility. The quenching part is a lot trickier because, and we'll talk about this in a little bit more detail, but it locks in the physical form of the solid dispersion and the physical attributes of the SDI that you're working with. And depending on how those attributes are playing out from that manufacturing process, there can be downstream challenges to compression, particularly when you go and manufacture tablets. So with extrusion, the hard part is actually the mixing piece inside the extruder, where you're going to rely on the melting point depression and the mixing action of the extruder to create an amorphous dispersion. But similar to how Justin had talked through the challenges or absence thereof of challenges with quenching melt extruded dispersions, it's similarly very easy for us to quench them down. Also, because we're going to then go through subsequent milling processes to control and regulate the particle size attributes of the material, it's not as coupled in the same way as you see with spray drying, where that's locking in those physical attributes of the dispersion particles that you're going to be working with. So I think Dana had covered some of the spray drying phase diagram work in her presentation this morning, but essentially when we talk about spray drying and that idea of locking in the process, we start with the initial droplet. As it's sprayed out, atomized, we see the formation of a skin. We then see a slow formation and diffusion of the solvent out to create that final structure. And I think John's presentation with the XRCT images really did a good job showing us what that microstructure looks like. And so we can look at the drying rates. The Pecklet number can be used to define how that drying process relates to the end state of the SDI that you're going to get. Are you going to get a balloon? Are you going to get a crumpled raisin? Could you actually dry it slow enough such that you have no real internal porosity? Would you dry it so quickly the balloon actually ruptures? And all of those things have factors into the downstream processing because of the material attributes that you're inducing in the SDI particles. Similarly, as you follow the droplet drying trajectory, the rate at which you're drying your SDI droplet is going to contribute to potential phase separation based on both attributes of the polymer. Here we're showing the polymer gel point, as well as the solubility of the drug in the organic solvent system that you're selecting. So this makes spray drying very, very complex, particularly when you talk about scaling up the process to support late stage manufacturing and commercial supply. So here we can see some of these attributes actually coming to bear from spray drying processes. So the figure in the upper left here shows the processing conditions that we evaluated. So in spray drying, we were looking at the droplet size through different nozzle selections in order to change the degree of atomization that we were seeing. We also evaluated the outlet temperature, looking from cold temperatures at around 40 degrees C for our acetone solvent system up to hotter outlet temperatures. And what you can see is a very, very different morphology depending on where you are within this space, showing that, in fact, depending on where you're operating, that's going to have an impact on the particle attributes, and that manifests then in differences in your mean diameters, your bulk densities, that then have to be dampened out through roller compaction operations. Similarly, depending on the processing conditions, when we take the dry SDI and evaluate it using DSC, we can see differences in recrystallization enthalpy, at least being observed in this particular example, suggestive of a potential difference in physical stability of those dispersions. So we would want to be able to control our solid dispersion that we're producing in a way where the control space for the product would not be sensitive to these variations that we see. And lastly, when we look at the palatability of the formulations that are containing different SDIs that are produced, you see that there is a huge difference in strength development depending on conditions that we're spray drying the materials in. So not only is spray drying and the process parameters that are used in that process important for generating the solid dispersion stability from an amorphous standpoint, but they play a key role in downstream processing. Extrusion, a little bit different of a beast, right? Because we're going to be talking about melting point depression being key to that mixing process. Actually, one of my other colleagues, Greg Troop, had developed a risk assessment scale, simply looking at the melting point of the API, the extent to which we're seeing melting point depression of the API in the polymer system, and then the viscosity of the polymer system itself. So compounds with low melting points where we're not even going to be concerned about the melting point depression are actually quite straightforward for us to use for melt extrusion. However, as the melting point becomes higher, particularly in instances where we don't see substantial melting point depression of the API, and in a worst case scenario where you have a high viscosity polymer system, it can become quite difficult, if not impossible, to manufacture amorphous dispersions using hot melt extrusion. Wanted to shift gears a little bit with that as the background, going back to our development philosophy of that idea of spray drying in the early space and then looking to transition to melt extrusion later on. So the first of the examples actually walks us through this process. So we had compound A in early development. We had been using spray drying to enhance the solubility of the compound. The melting point, as you can see, was pretty amenable to hot melt extrusion. And so this had clear line of sight for us to say, okay, as we move into later development, we really need to go ahead and work to try and transition this over to melt extrusion. So in the initial development of the spray dried dispersion, we had a formulation which was 1 part drug, 2 parts HPMCAS, a pretty standard solid dispersion formulation. The amorphous form was well maintained in terms of the stress stability of the dispersion that we had created, and we had a crumpled raisin-like morphology. So again, nothing too particularly challenging from a spray drying standpoint. But one of the other things that we were considering at the time was, how do we increase drug loading? And drug loading is always a challenge for us with solid dispersions. Oftentimes when we think about melt extrusion, it can be a challenge for us to go ahead and actually produce the initial dispersion with the high drug loading. And Dave had some really good examples speaking to the potential of kinetisol to maybe open up some opportunities here, which is really exciting to see. But the payload of solid dispersion that you have to bring in has a significant impact in terms of the final image size. So if you look at your dispersion loading and the amount of dispersion within the tablet, you can see that the higher you go, the smaller your tablet image is going to be. When your doses get higher, that space is constrained. So there's even more of a driver for high dose formulations to push drug loading. So we went ahead and we tried to do exactly that. Look to move the drug loading up. We started with spray drying simply from an exploratory standpoint. A few things to call out here is that we were able to create amorphous dispersions for the material. Generally, the amorphous form, even for our 60% drug-loaded system, was well maintained after 2 weeks in open conditions. We saw some fusing of the material, and notably, we also see a reduction in the glass transition temperature. So this is obviously problematic from the downstream standpoint. Another thing that becomes challenging for us with spray drying is when we look at the outlet temperatures, the TG is going to be depressed beyond these points because you're carrying residual solvent with it. So that can also create a processability bound. So when we think about maximizing drug loading in an amorphous dispersion, there's a few potential pitfalls for us with spray drying that we need to be aware of. So we went ahead and started working through this process of evaluating hot melt extrusion with this active ingredient. We prototyped on our 7.5 millimeter extruder. Generally, we're able to generate amorphous forms at reasonable temperatures. We did see some low assay, although that was attributed to challenges with the small batch sizes that we were working with. And in later development, when we scaled up the HPM-CAS process, there was no issue with the assay. We moved forward with the prototypes after successfully manufacturing, and the first thing to go ahead and do is, of course, look at the dissolution. It gives us a reasonable first pass assessment, and Dana was kind enough to walk us through the multitude of ways in which we could go ahead and look at dissolution and the factors that we're considering as part of that process. And so in our case, we were looking at two-stage dose-relevant, biorelevant dissolution. And that is a mouthful. But essentially, it's a two-stage dissolution test with simulated gastric fluid before going into a FASIV stage. For the test, we were actually sampling and filtering through 1 micron filters, and then also doing 80K centrifugation in order to identify differences in the speciation behavior. So do you have drug in solution? Is there a large fraction of nanoparticles being formed? And what we saw was that most of the drug that we were observing was actually molecularly dissolved drug, at least in the context of that test. Of note, when we compare it now across the different formulations, you see very different dissolution behaviors. Our non-ionic systems show substantial dissolution in SGF, followed by what is precipitation and then subsequent redissolution of the material, although not reaching the benchmark that we had set with the HPM-CAS spray-dried material. Of note, and I think Dave's work had showed some differences between the kinetisol material and the spray-dried material. We see a similar difference in the dissolution in the SGF phase, but ultimately that didn't make a significant difference in terms of the second stage performance. And so from there, we went ahead, stressed the dispersions. We started to see the non-ionic systems crash out. So our povidone system had actually shown the formation of crystalline material over the course of the 2-week storage period, as did the copovidone. Our non-ionic systems, they had shown no significant recrystallization, at least that was detectable by X-ray, suggesting that they would be suitable. But we did see an increased level in the degradation products with our L155 system. And so we elected to move forward with HPM-CAS. So it turns out serendipitously, we had started with the right polymer system all along. Looking at the increase in drug loading, we then prepared a 1 part drug, 2 parts excipient, and then a 40% drug-loaded formulation. We see a similar difference in the TG values, where the TG is depressed as we're going to higher drug loading, not unexpected given the attributes of the active that we were exploring. We also saw acceptable physical stability, and of note in the case of our glass transition temperature, even when exposed to high environmental humidity, we didn't see a significant depression over the course of the storage period. Actually, we saw maybe a slight increase, if anything. So we characterized these same systems then looking at the downstream performance, because again, we're not making a dispersion, we're making a tablet formulation. And so strength development of the material that we're creating, disintegration time is also quite important for us. And what we saw was that in the context of the tabletability profile, and maybe I'll take a second to just walk through that in case folks in the room are not familiar with that test. But essentially what you're doing is creating a compact, diametrically breaking it, measuring that breaking force. And what we want to do is relate the compressive stress used to create the compact to the strength of the resulting compact, so that way we can operate in an ideal space for our tablet compression operation. For Merck, we've set a standard where we want to maintain the compressive stress at or below 200 MPa. We can go higher and have gone higher in certain instances. Certainly going above 300 MPa starts to be a point of concern. And we want to see a tablet have a tensile strength of 2 MPa or greater. This will allow it to survive the film coating process or have acceptable friability if going with an uncoated presentation. So what's washed out here is the green space, which is our ideal space to be in for tablet strength development. And what we saw was that we were able to operate, although very narrowly, for our 33% drug-loaded formulation. As drug loading went higher, we actually saw more favorable mechanical properties because the API was able to compensate for some of the inherent ductility that we see with HPM-CAS. And so this shows how we also think about how dispersion formulations impact that downstream manufacturability. And so with that being the case, both the 33% drug-loaded and 40% drug-loaded formulations look great. Maybe there was a little bit of difference in terms of the dissolution that we were seeing in that two-stage dose-relevant, biorelevant dissolution profile in the SGF phase, where the release was muted for our systems. But when we move forward into dog studies to evaluate it, actually all 3 formulations provided similar exposure, giving us confidence that minimally we could make a transition over to hot melt extrusion. Potentially, we would have avenues by which we would be able to increase drug loading in the product as well. And so the second example that I'm going to talk about hits on some of the aspects that Dana had brought up in her talk around bioperformance risk and how we think about crystalline content within an amorphous dispersion. Generally, crystalline content in an amorphous dispersion product is thought of as bad. We want to try and have absolutely no crystalline content. The reality is there may actually be a space where we could operate with some crystalline content, or potentially need to at least understand the impact of crystalline content in de-risking the product. So this example was a moderate to high melting point compound. So this utilized spray drying for the manufacturing process. We saw fairly low microgram level solubility for the asset in SGF and FASIV, and a reasonable acetone solubility for commercial manufacturing. So as we went through the development, I want to come back to a point that was brought up in some of the earlier talks around the control strategy for amorphous dispersions. When we think about amorphous dispersions and stability, there are 2 enemies of these types of products. One of those is temperature. The other one is humidity, or the water activity that you're carrying within your drug product. And so within Merck, we will run a product characterization study where we look at stressing not only the dispersion, but actually the tablet formulation under different temperature and humidity conditions to identify the boundaries for failure that we see. And then we can overlay that to our proposed control space, because we're thinking about our control space now, not just in the context of how we're setting the process conditions on the equipment or the material attributes coming in, but we're actually thinking about it from the standpoint of the package and the permeability that that package will have to allow moisture to penetrate. We also think about that from the facility standpoint, because the environmental humidity that you have within the facility will actually contribute to the starting water activity that you have in the drug product. And depending on how close these red points are to your control space, is going to drive how you handle some of the risks that you have and how you control your facilities. So when we look at understanding crystalline content, there's a few approaches that we can go ahead and look at to understand the impact of crystalline content over the course of development. One approach is, well, we're just going to test it, and we're going to try and push the limit of detection down as low as we can in order to enable us to understand, is it crystalline or is it not crystalline? The reality is, depending on which technique you use and how close you look, if you go looking hard enough for something, you're generally likely to find something. But once you find something, what does it actually mean to your product? Well, there's a few ways that you can go about it. You can look at your clinical experience, but one of the downsides to your clinical experience is generally you're not going to go ahead and put in a batch with 5% or 10% crystalline content into your clinical program. So for us in this particular case, we had a crystalline content history of our clinical batches where we had never seen it. So that wasn't particularly helpful. We had also looked at some PBPK modeling to try and understand, could we translate the dissolution performance and the preclinical performance to model the human performance. But again, the reality is, in the absence of data with crystalline content, it's really hard to validate, and it's really hard to understand the impact of it. And it becomes particularly challenging on fast-moving programs where that control space that I showed you on the previous slide, where the red dot was all the way to the right, when that red dot is getting a lot closer to your proposed control space, you start to get nervous. So what did we do? Well, we went ahead and actually ran intentionally a clinical study to interrogate what would be the impact of deliberately spiking 5% and 10% crystalline content into our drug product formulation. So we took API, micronized it down, added that along with a representative amount of excipient to compensate for the SDI that was removed. So essentially we had the same amount of stabilizing polymer. We had the same amount of API, but there was a fraction of API that was crystalline and all of that. And when we ran our QC dissolution test, we had designed the dissolution test, and I know Dana will not be a fan of how the test was designed, but that's okay. We designed this test anyway. We were able to detect crystalline content. What's notable here, though, is that actually the plateau is not quite proportional to the amount of crystalline content. So our 5% crystalline content showed a 10% loss in total amount dissolved, and the 10% showed a loss of 14%. So this actually gave us a little bit of angst, I would say, going into that study, because we were concerned that the extent of exposure reduction might be more than we were hoping for. But it was not. Actually, much to our chagrin, we ended up seeing that at 5% crystalline content and 10% crystalline content, there was no difference to our fully amorphous system. So this actually enabled us to understand not only how to characterize crystalline content and set an appropriate control strategy, but gave us an understanding of what would be the implications if we were ever to see crystalline content downstream in that particular formulation. And so the third and final example that I'm going to go ahead and talk through today relates to one of our compounds. It's that compound that I highlighted at the beginning in that first quadrant. It's that brick dust compound that, man, I wish we had Kinetisol when we were doing this. So this one has a melting point of 280 degrees Celsius. It also has a whopping acetone solubility of 2.6 milligrams per mil. Not exactly that efficient. But we did need spray drying to enable the bioperformance of that product. So again, leveraging some of the high throughput screening capabilities that we have, went ahead and evaluated a range of solvent systems. Some of these mixed solvent systems, notably, we see that acetone with a pinch of water gives us a little bit more of a boost in terms of the solubility. So we're able to go ahead and work through solvent selection as a means to improve the productivity, I guess, a little bit, but still not that great. one of the other challenging things with this asset is that in terms of the recrystallization propensity, compound C, which we're talking about now, and the prior compound, compound B, were the two strongest recrystallizers that we've seen in the Merck portfolio. So both of them were challenging to work with. This one in particular, though, really was challenging for us because that wet TG of the material coming out of the spray dryer and how close we were in terms of the conditions during spray drying bounded us. So if we were within a 5-degree delta of the temperature to the wet TG, we were seeing near 100% crystallization of that material over the course of storage. We bump it up a little bit, so in that space 0 to about 20 degrees, we're still seeing a large fraction or unacceptable fraction of failure going on. And so it wasn't until we went ahead and bumped that delta up to about 20 degrees or more that we actually were able to control the level of crystallization. But what happens as a result of that is it hinders your productivity. It limits or it caps your drug loading that you can carry within your formulation. So then thinking back to compound A, where we had shown the contour plots for the impact of dispersion loading and the level of dispersion in the tablet, we're hindered in terms of the size of the tablets that we're making as a result of this. So definitely not a good place to be. But ultimately, we needed to do it to enable the product. If you look at the preclinical exposure between our conventional formulations and our enabled formulations, a substantial improvement in bioavailability. So we had to be enabled. One of the other challenges, though, was that in order for us to enable it with spray drying, especially in the early space where we're talking about maybe we're going to have to invest in internal spray drying capabilities. We're not sure what the volumes are. We're not sure what scale we're going to. All of that's going to get rolled into the cost of goods. And so in our early assessments, actually, our spray drying was projected to cost more than the manufacturing of the rest of the drug product. So having access to a tool like Kinetisol would be absolutely invaluable in these cases because while we can do it with spray drying, it definitely wasn't a pleasant experience for us to go through. And so, to kind of summarize the content that we went through this afternoon, low solubility products are definitely a challenge for the industry, although I think the prevalence of those issues are maybe not as significant as some papers would lend you to believe. There are some compounds where they are the brick dust compounds. It may not be a huge fraction of our portfolio, but certainly, for your portfolio, if you see these products, they're going to be very difficult to develop. When we think about identifying these products in the early space, we want to pull it back to dose number. Don't think about it in terms of BCS classification, but dose number. Develop off of that and try to use engineering principles when thinking about how to understand the bioperformance of your product. Both spray drying and melt extrusion, fantastic tools for us. They're our go-to technologies and have supported us successfully across our portfolio, albeit painfully in certain instances. But we've been able to navigate every asset in our portfolio from that perspective. Transitioning between the technologies is acceptable. It's very feasible. And, when you talk about managing a portfolio of solid dispersion products, definitely think about the simplicity of the technology at the stage of development. So you're doing stage appropriate development throughout the process. The design of the dispersions, certainly your control strategy, not just in terms of the formulation, the manufacturing process, but also other considerations like the facility and the packaging need to be factored in to have a robust control strategy. But we do know, at least in one instance, having a little bit of crystalline content may not be the end of the world. And lastly, new technologies in the industry are absolutely paramount. While this presentation only showed one example where we were in the first quadrant of the brick dust compounds, I really enjoyed the talks today that brought up the idea of green processes. And certainly the efficiency for kinetisol is a really exciting advantage of it, in addition to being able to differentiate in some of these really challenging compounds. So I appreciate everybody's attention today during the course of the talk. Just wanted to also take a moment and recognize that the work presented today is really a total team effort from the Merck side. So I want to acknowledge the contributors here to the content that's been shown, and thank everybody for their attention, and I'm happy to answer any questions.
Really nice talk. See, the example you show when you spike the crystalline drug, based on Donna's talk this morning, if that residual crystalline is in the ASD, it could be a different story, right?
Yeah, and definitely that could be something that we talk through in the process of running the study. And we had looked at two potential pathways for producing that material, one of which being going ahead and doing the spiked approach, where we just added it directly, which is the data set that I had shown. We also looked at stressing and aging the materials from the standpoint of at least the characterization tests that we were able to do around dissolution, not just the QC dissolution, but also some non-sync dissolutions that were in biorelevant media. We didn't see a significant performance difference between the two systems. So ultimately, because of the operational complexity in stressing and aging the material, we went ahead and did the spiked crystalline content study. But we do acknowledge that could definitely be, an area for future exploration.
I noticed you speciated only one of your examples. Do you speciate most or just some?
So we will, for nearly all systems, do at least some studies for the dissolution, looking at speciation to understand that distribution. In the case of the one example that I had showed, we didn't see substantial nanoparticle formation. There's other dispersion products that we've looked at where the speciation has been quite critical to bioperformance. But short answer is yes, we do look at it. We don't universally look at it every single time end to end, but we will look at it initially to establish, and then if it's a critical attribute, we'll continue to evaluate that throughout development.